I'd like to acknowledge once again the presence of all the various leaders who are with us representing key institutions, government leadership and organizations, specifically starting and acknowledging the various honorable ministers from the SADC countries, including the Minister of Health from the Republic of Seychelles, who's still with us in his presence, the representation of the various ministries regarding health, environmental affairs within the Republic of Zambia, acknowledging the Permanent Secretary who's still with us from Angola, respective leaders, dignitaries of all key organizations that are key to enabling the conversations that are taking place here today. I am delighted to warmly welcome you, and once more, through the training, coaching of my Zambian sisters and brothers, Mwakwa Bwanji. I'm hoping I've said that correctly, but clearly I failed. Mwakwa Bwanji. A very good morning and a warm welcome once more to Day 2 of the One Health Regional Summit, Eastern and Southern Africa. A very good morning to you all, ladies and gentlemen. If anything, I think it proves that I need to stay in Lusaka for a little longer, right? Practice a little bit more and perhaps I'll be a lot more fluent. But on that note, it is delightful to see that we have a room full of so many of you who have come back to engage in critical conversations that we started off just yesterday. As has been said and made quite clear, we obviously are all aligned in terms of making sure that One Health is not just a health intervention, it's an economic policy and strategy that we implement in our region and countries respectively. Understanding that there's key participation to ensure that right across the sector and various industries, we want to improve upon trade, enhance the level of job creation opportunities for the next generation, and most importantly, ensure that through these processes we find alignment and ties into innovative solutions that can be brought forward. Today is Day 2. We're looking to build up on much of these themes and concepts that have been shared with us, and we really have an invigorating program where we'll hear from many more stakeholders and partners. We'll start off this morning by understanding how best it is that we implement this, unlocking capital, ensuring that the private sector is on board, and of course enhancing the level of regional interoperability and partnership that we do have. So this is just to give you an overview of the various sessions that will be taking place today. We will do our best to actually keep to time, but not hold back on the quality of content and conversation that we are here to deliver. So to the various speakers who will be joining us, we are looking forward to the insights and concepts that you'll be able to share with us. We also look forward to everyone else's participation in the room through the questions that you'll ask, the challenging and opposing views you might share, but most importantly, how it is that you're able to extrapolate the information and data you need to ensure that when you head home, you're able to implement some of the solutions and are excited about the future that we can co-create. Again, a gentle reminder of the house rules: cell phones to kindly be on silent, to minimize any movement and disruption for the various speakers and panelists who will be on stage. The restrooms, as highlighted yesterday, are outside the corridors, both on the left and right, and smoking is only to take place within the designated areas within the venue. But most importantly, one of our speakers yesterday highlighted the spirit of Ubuntu. And that is what we look to build up on today, making sure that through our coordinated efforts and united focus, that we're able to move forward in synergy and partnership to build on the future we desire. On that note, ladies and gentlemen, we'd like to start off with the first overview of the conversations and themes that do help us correlate and understand and underpin the commitment that we have. We will be hearing from a key message of one of our quadripartite partners and organizations, that specifically being the Food and Agriculture Organization of the United Nations. Please turn your attention to the screens as we'll take a look at a video from the FAO Assistant Director General and Regional Representative for Africa, Dr. Abebe Haley Gabriel.
Excellencies, distinguished delegates, representatives of partner organizations, dear colleagues, ladies and gentlemen. It's an honor to address you at the Regional One Health Conference for Eastern and Southern Africa. I extend warm greetings to you all and thank the Government of Zambia, SADC, the World Bank, the Quadripartite partners, and all other co-organizers for convening this timely and strategic gathering. Across the Africa region, the human-animal environment interface has become a defining space for collective resilience. from zoonotic disease threats to food safety challenges, antimicrobial resistance, and climate-driven shocks, we are confronted with risks that transcend borders and disciplines. This is why the One Health approach becomes essential. It's a powerful opportunity for us to transform the way we work across borders, across sectors, and across institutions. FAO has been contributing to this agenda in concrete and measurable ways. Through the Emergency Prevention System for Transboundary Animal and Plant Pests and Diseases, EMPRESS, and the Emergency Center for Transboundary Animal Diseases, ECTAD, FAO has been supporting countries with surveillance, early warning, and rapid response to high-impact zoonosis. Through the Global Framework for the Progressive Control of Transboundary Animal Diseases, FAO contributes to strengthening regional coordination to prevent and control transboundary animal diseases. Our work on antimicrobial resistance, from the development of national action plans to practical tools for responsible antimicrobial use in agri-food systems, is helping countries protect both human and animal health. And through FAO's leadership in food safety, including support to build stronger risk-based systems, we continue to safeguard consumers and enhance trade. FAO is also fully engaged in advancing the Quadripartite One Health Joint Plan of Action, ensuring that countries can access coherent guidance, technical support, and scalable solutions, while ensuring that innovations from digital tools to community-based approaches can scale up and deliver real impact for the people we serve. What makes this conference unique is the composition of leadership assembled today, representing a wide spectrum of key actors, stakeholders, and partners. This is the kind of collaboration needed to unlock investment, accelerate innovation, and deliver impact, not just to safeguard livelihoods, lives, and ecosystems, but achieve sustainable transformation. I wish you a productive and inspiring conference. I thank you.
Thank you very much for that opening welcome, and more than anything, underscoring the level of commitment we have from our alliance partners and moving forward with the agenda that we all are looking to prioritize. What we build up with the program for today, and for many of us in the room, as I look across and as was expressed so boldly, we're all youthful. We're young, we're excited, and we're keen and eager to also help contribute to future leaders within the One Health space. But this also calls upon us to actually reflect on the lessons and learnings that we have from various participants within this particular sphere, to share some of their insight, and most importantly, provide guidelines that we can implement as we look to encourage new employment opportunities for future participants. Our next speaker knows all about this. Someone whose affinity for the world and life of agriculture, whether it's goats or livestock, was really imparted upon her during her childhood, as her mother herself is passionate about agriculture. She's a biotech entrepreneur, she's also a genomic expert, and most importantly, continues to push forward with studies, research, and providing guidance and insight to industry players at large. She's going to share some of her contributions to the industry, some insight that we can learn and lean on, and of course, key avenues of partnership that we can also identify. Please help me warmly, and when we say warmly, I think we know what that means by now. A truly proud African. Welcome to Dr. Gyabetswe Ncube, postdoctoral researcher at the University of Johannesburg. Dr. Gia. Welcome.
Good morning, distinguished ministers, esteemed delegates, colleagues from academia, civil society. Please allow me to ride on the protocol that has already been established, with a special honor to the Government of Zambia and the co-organizers. Our collective presence here signifies more than just attendance at a conference. It stands as a commitment, a recognition that One Health is not an abstract ideal, but a continental imperative. Our theme, One Health, One Future, It asks us not only to imagine Africa's shared future, but to actively shape us. And I got to think about one future. What does this mean for Africa? A youthful continent so rich in diversity and excellence and talent. For me, this means that the future of One Health in Africa is young, scientific, and innovative. Yesterday laid a powerful foundation. We are reminded that One Health challenges us to break the silos that separate our institutions, discipline, and sometimes even our countries. The message was consistent and resonant. One health, one future, one voice. And that is the voice of Africa. As Dr. Alimi profoundly said, we cannot leave one person, one country, and one community behind. As we advance as a continent, we must not leave behind women and youth and children. Inclusion is not a peripheral aspiration. It is a prerequisite for a resilient, healthy, and prosperous Africa. Honorable Minister Elijah Muchima further reminded us that One Health is not the responsibility of government alone. And if I were to reflect, everywhere we always blame the government for everything. But then we have to ask ourselves, how are we contributing to help the government to reach the goals that is in front of them? The drivers of One Health include farmers, vets, teachers, children, academia, industry, and civil society. His message was unequivocal, and we must move from dialogue to action. As an academic who works very closely with small-scale farmers, meetings such as this one always leave one question in my mind. How do we take the conversation from this room to the most rural and remote small-scale farmer? I am encouraged to see farmers like Anezwa from South Africa represented here. We saw a video where she was featured yesterday. My love for cooking introduced me to Anezwa, as I also love sustainable farming and rural farming. Through TikTok, I saw her videos of how she engages and works on sustainable food systems. But then there are other farmers. What about the farmer who doesn't have social media? What about the farmer who doesn't even know what technology is? So Anezwa is an example of how we are reaching small-scale farmers, but I would say we have to go beyond that. One Health shows us that farmers are partners, innovators, and solution builders. Their presence inspires us to go further. The challenge before us is to translate One Health into something understandable, actionable, and accessible, even in the most remote parts of our continent. The ministerial panel was among the most of my favorite panels yesterday, as it has emphasized how everyone works together to translate all these conversations. We've heard how several countries, such as the Kingdom of Eswatini, collaborates with small-scale farmers to mitigate the drought season brought about by climate change through building dams and irrigation systems, practical interventions that strengthen food systems while improving community resilience. We learn also from the Seychelles how investment in training field epidemiologists who can identify risks early and respond swiftly, and from Mozambique's community training programs that empower citizens to detect threats before they spread and work together to respond to those. Zambia also urged all countries to communicate, collaborate, and stand together during outbreaks, because disease knows no borders, and neither should our responses. We have 21 innovators in our presence, and this demonstrates how science reaches communities, farmers, and everyone else in redefining One Health. For the dairy sector, my favorite was Maziwa Plus, on how they show solutions and the mastitis monitoring can transform milk safety and productivity, addressing a disease that causes an estimated of 31% production loss and contributes to global economic losses of about 19.7 billion US dollars. Crucially, their model embodies co-development with farmers, One Health in practice, not in theory. One participant asked yesterday, why are we leaving out plants in the One Health? And this made me to think deeper on what else are we leaving behind? And learning from the wildlife sector, I asked myself, are we and why are we leaving stock theft behind? In many regions, livestock movement through illegal channels contributes significantly to disease spread, including transboundary animal diseases and zoonosis. Then I wondered if technologies such as the Face IT by AgroLedgers cannot be integrated with existing genetic traceability frameworks used by organizations such as the ARC and Ingaba Biotechnical offer an opportunity to strengthen biosecurity and law enforcement. Pairing facial recognition with DNA profiling could revolutionize livestock identification and safeguard farmer livelihoods. And who could have thought that ice cream will come from black soldier fly? Personally, when I see a fly with doom on the one hand and a flip-flop on the other, one mission, it must meet its ancestors. But, but then we've seen learned from how insect farming expanded our understanding of sustainable protein systems, livelihoods, and circular economies that can strengthen both food and financial security. A food-secure nation is a healthy nation. Lastly, the economic panel grounded this conversation in reality, highlighting regional losses of up to 4 billion US dollars due to diseases. One example is of foot and mouth disease. We saw in South Africa how current beef, one of our largest feedlots, came to a halt during the FMD outbreak. Now, current beef slaughters about 1,000 cattle daily, and this meat is exported in the continent and outside of the continent. So with a large entity like current beef coming to a halt, this challenges and affects financial security, food security, and various livelihoods. So, even amidst this crisis, Botswana's swift response in the emergency release of the initial 900 vaccine doses as support to South Africa reminded us of what true regional solidarity looks like. Such collaboration aligns with Africa CDC's vision of producing over 60% of the continent's vaccines locally, a critical step towards Africa's sovereignty in health security. Ladies and gentlemen, as we begin day 2, our focus shifts to the engine that will turn our vision into a lived reality: partnerships, policies, and systems. This is where the future is built, not in statements of intent, but in the concrete structure that allows us to work together across sectors and borders. If One Health is to shape Africa's future, then our partnership must be intentional. Our policies must be implementable, and our systems must be inclusive, from ministers to molecular biologists, from epidemiologists to primary school children, from regional agencies to the most remote farmer tending goats at dawn. A One Health system that does not reach a rural farmer is incomplete. A One Health partnership that excludes youth and women is insufficient. A One Health policy that does not translate into community empowerment is ineffective. As we proceed to today's discussion, I invite us to keep one thought firmly in mind. The future of One Health in Africa will not be defined by the scale of our challenges, but by the strength of our collective response. where the future we speak of becomes the future we build together. The Africa we want begins here in One Health, One Future. Ke a leboga.
Ho leboga rona, Oskile. Gia, thank you so much. That's Dr. Gia giving us her insight into the reflections that we have for yesterday and, of course, what it is that we can look forward to today. What Dr. Gia also highlighted was the fact that we have amazing innovators who have been showcasing their work throughout the last 2 days. And they'll continue to do so today. So much so that we're going to hear from more of these entrepreneurs who are going to tell us more about their innovations that are practical, tangible, and most importantly, inclusive, given the themes that Dr. Gia has highlighted. So we're moving on to that exciting part of the day where we shift gears, offer these innovators an opportunity to make their way onto the stage, and within 3 minutes, give them a countdown to share, reflect on what solutions they bring forward, how they look to partner, and of course, alleviate the challenges we see currently within the One Health ecosystem. I'm told today we've got the timer up on the screen, so for many of our entrepreneurs, they will have a reference as to how the clock down timer is operating. I will stand alongside them just to keep everyone in the room honest. However, failing which, my good colleague Rachel will be assisting us as well with the countdown if need be. But this is where we offer these innovators an opportunity to share their story, and throughout the course of the day, please feel free to make time to visit them at the Innovation Marketplace. There's an opportunity for you to robustly engage, seek more information, and of course partner with them through these conversations. Are we ready? Oh, we don't sound like it. Are we ready? Fantastic. I'd like to call on our first entrepreneur and innovator who's going to join us on stage. We'll have 3 for this particular session. If we could please welcome Ms. Lillian Otiogo, low-cost hygiene and decontamination innovator, to the front of the stage. Let's warmly welcome her up on stage as she makes her way to the podium. Fantastic. Lillian will adjust the mic to make sure you're comfortable. As you are on standby and ready, we also have the 3-minute timer that will be set. If my colleagues could set it up to 3 minutes as a countdown, or moving to 3 minutes, which we'll use to keep you honest. Are you ready? You excited? This is your time to share your innovation with the rest of the world. Your countdown timer, as soon as I get the thumbs up from the team in the back, we are ready. Your 3 minutes starts now.
Distinguished guests, ladies and gentlemen, thank you for the opportunity to share our work. Our innovation focuses on low-cost hygiene and decontamination solutions that are going to make meat safer, especially in low-resource settings, which I believe most of us resonate with. If you've been to a slaughterhouse in rural places, not even in rural, but generally low-resource settings, they are usually dirty, messy, and dangerous. They pose a significant One Health risk, both to the workers and to the consumers who are going to take that meat. So for the workers, they face occupational risk, exposure to zoonotic pathogens, because many lack basic hygiene training, and they also do not have personal protective equipment. For the consumers, the risk they face is foodborne diseases that could come out of the microbial contamination that occurs during slaughter. So to address these risks, our intervention, or rather our innovation, introduces practical, affordable tools. The first tool is to have local veterinarians to go to the slaughterhouses and train the workers on personal hygiene, environmental hygiene, and process hygiene. A short 30 minutes to 1 hour training to the slaughterhouse workers that occurs on site. Afterwards, this is followed up by meat inspectors who constantly remind the workers on what they were trained on, and so that they are able to enforce these behaviors. So this CGR-led project was able to do this, and what we noticed were improvements in uptake of the practices that the workers were trained on. However, even with better practices, like I've said, there was improvement in practices. what we realized was the carcasses that were coming out of these facilities, the slaughter facilities, still came out contamination. And so we still, to protect consumers further, we already saw that even with improved hygiene, because of lack of infrastructure in these slaughter facilities, there needed to be a next step in further decontaminating the meat that is coming out of these slaughter facilities. So we are currently trialing out the use of safe and effective decontamination step using electrolyzed water. This is also known as the hypochlorous acid.
Lillian, unfortunately, your timer has stopped. We've come down to 3 minutes already. But thank you so much for your innovation as well as your insight. Where do we find you? Which stall are you located at?
The first stall at the innovation marketplace, the first innovation market.
Fantastic. Thank you so much. A round of applause, please, for Lillian. Thank you so much, Lillian. We'd like to welcome our next entrepreneur up to the stage, representing One Health units and community conservations. That's Farah Isse Mumin. A warm round of applause, please, to Farah Isse Mumin. Fantastic. Farah, we'll adjust the microphone. We'll get the countdown clock up. You can confirm that you can see the clock. It will count down from 3 minutes, and once it hits red, that means that your timer will stop. Your 3 minutes starts now.
Excellencies, distinguished delegates, colleagues. Today, I want to show you how we move from One Health theory to One Health action. Not in reports, but on the ground. Not someday, but right now. Imagine a system where human health, animal health, and environmental health teams don't work in parallel, but side by side, planning together, delivering services together, and solving problems together. That is the promise of One Health units. Now operating in remote communities in the Horn of Africa, One Health unit brings together human and animal health service providers, environmental and rangeland officers, and community-based actors, coordinating to deliver services like vaccinations, disease surveillance, disease surveillance, and education on environmental hygiene and invasive species management. One Health units have a flexible design for different rural contexts. They strengthen systems, build trust, and expand the service coverage to people often missed by traditional health and veterinary services. Our SOP and training package make it easier for governments to establish and scale One Health units using local staff and existing systems. Which brings me to our second innovation. Even the best designed services can fail without meaningful community engagement. That is why community conversations are so powerful. This dialogue-based approach brings people together to share experiences, reflect, and agree on practical actions to protect their health, their animals, and their livelihood. With vivid illustrations and skilled facilitators, community conversations help communities explore health threats at human, animal, and environment interface, such as zoonotic diseases, antimicrobial resistance, and food safety, identify local actions, and act. Our initial results already show improved understanding and safer practices, and our facilitator guide is ready to use or adapt in rural areas. So both of these innovations offer a scalable blueprint for operationalizing One Health at subnational levels. They can support countries seeking to expand universal health coverage in rural and remote areas and foster pandemic preparedness that is community-owned. Therefore, International Livestock Research Institute invites governments, African Union, SADC Secretariat, development partners, and the World Bank to partner in scaling these proven innovations in Africa and beyond. Together we can bring One Health from concept to action. Thank you very much. And our booth is that side. Thank you very much.
Fantastic. Thank you so much. Covering all these bases, as Farah, giving us some insight into conservation efforts and, of course, enhancing communication in the level of partnership that we see. We've got one more innovator to hear from this morning before we hear from many more throughout the course of the day. Please help us warmly welcome to the front of the stage Ms. Kema Vivian Limas-Tegli, who will be speaking on rodent-proof cover and metal-legged table for storage. Warm round of applause, please, for Ms. Kema Vivian Limas-Tegli. Do you need some assistance? You're fine. If we could adjust the microphone just to make sure that all is in order before we get the countdown timer, which is set and ready, I understand. Fantastic. Kema, you ready?
Yes.
Fantastic. Your 3 minutes starts now.
In a small village in rural Liberia, a group of boys rises early in the morning with handmade traps to hunt rats. For them, it is a tradition passed down by older brothers and village elders. Even though it provides food, income, and entertainment, it places the boys at a higher risk of contracting one of Liberia's deadly diseases, Lassa fever. Lassa fever is a zoonotic disease that can be transmitted from affected rats to humans. Across Liberia, young people bear the greatest burden. From 2016 to 2021, aged 10 to 19 years accounted for 24.5% of all confirmed cases, the highest of any age group. The boys that should be dreaming and learning are the most exposed. But the risk goes beyond the boys. The mothers and the sisters who prepare the rats coming into direct contact with the bodily fluid that may contain the virus. Cultural practices also increase exposure. Families often believe that leaving certain food on cover overnight to catch air is a method of preserving them. What they do not know that the rats come in contact with the food and leave their urine and feces. The Stop Spillover Research Project confirmed Lassa virus in the feces and urine of the rats. To respond, we conducted community engagements. We collaborated with the Ministry of Health to develop youth-friendly and culturally appropriate messages. We conducted door-to-door awareness. We conducted awareness among the youth. We partnered with a TikTok influencer to produce Lassa fever prevention videos and posts on TikTok. Evidence that most Liberian youth, including those that are in the rural area, are active on TikTok. We also partner with the communities to create full covers and table with metal legs to prevent rats from coming in contact with the foods. These initiatives were piloted in 90 homes in 12 communities across 3 counties in Liberia. Now a call to action. I want to call on the World Bank and all developmental partners in this room to help us scale out this effective SBC approach in all of our counties in Liberia. My booth is outside there, just in case you want to learn more about these innovations. You can please reach me. Thank you.
Thank you so much, Kema. Another round of applause, still with a good 10 seconds to spare. Congratulations, Kema, and well done. Well done to all our innovators as well as entrepreneurs who are showcasing their work. Lillian, Farah, and Kema, we certainly look forward to seeing more of your innovations and, of course, many more of the innovators who have been present here today. A gentle reminder to please ensure that as you interact with the innovators and entrepreneurs, ensure that there are avenues of participation that we can move forward on, right? That's what we're here for, to understand how we shift the narrative and understand how we unlock the partnerships they require, give them access to markets, and most importantly, like with all innovations, unlock capital. And this probably sets the great segue for our next panel discussion. We're all very well aware that given the most recent pandemics that we've faced, epidemics as well in certain markets, that many economies in sub-Saharan Africa had to tap into their debt reserves, accessing opportunities in international markets to make sure that they had the necessary funds to keep their sovereign states resilient, but also respond with the necessary funding that was required on the back of healthcare scares. But what are we doing now to prevent this particular theme and ensure that as we face the threat and potential of future pandemics, that we're adequately prepared, our budgets can handle it, that we have the funds that can be unlocked to ensure that not only are there preventative measures in place, but there are also avenues within which we can respond appropriately as a region. Show me the money is a line Tom Cruise says in a movie. Our next panel is going to show us the money, or at least how to get there and unlocking the potential for capital. This particular panel will be addressing the ongoing concerns regarding resilience in the investment dialogue and understanding how we align investments from a regional perspective. We'll hear from development finance institutions, hear from countries and entities who themselves have started pandemic funds, and most importantly, understanding some of the nuances that we need to be mindful of. De-risking projects, having capital that we can mobilize, directing that capital into the right and most appropriate avenues. And our moderator for this particular session is someone who is no stranger to the healthcare environment in sub-Saharan Africa. Just shy of 4 decades of experience within the healthcare fraternity, she has spent her life researching, providing insight, technical tools, operations, measured outcomes, and evaluations into tropical medicine and epidemiology. She's designed programs, led strategies, and most importantly, remained a key advocate for ensuring that healthcare, specifically garnered and focused around HIV at a particular time in her career, and of course through other spheres of healthcare interventions, have been prioritized not only in her home country of Zambia, but even in markets like the UK and with her global counterparts. Ladies and gentlemen, please warmly welcome the moderator of this particular session. She will then introduce her panelists who will give us some insight into the themes and conversations that they will underscore. Global health expert, Dr. Chewe Leo.
Thank you. And welcome to this important dialogue on health resilience in aligning global investments for regional impact. In October this year, Africa CDC, with the government of South Africa, convened a meeting in Durban for the International Conference on Public Health in Africa in collaboration with Africa Bio Convention. The conversations that took place in Durban with about 17,000 delegates attending in person and virtually were very similar to this. And one of the outcomes of the meeting, which is articulated in what we're calling the Durban Promise, was about predictable and sustainable financing. We were reminded in Durban that since 2022, Africa has seen many outbreaks, at a critical time in moment where we're also seeing sharp declines in external health financing. We are indebted, and we are seeing the impact of debt service on our health programs. But we're also seeing, and we talk about ministries of finance all the time, and they're not in this room, but there are fiscal constraints, especially when it comes to delivery in our countries. This stark reality then means we have to do much better with the money that we already have. And as we think about the future, we need to also be better coordinated in what we are doing in terms of value for money. So looking at what we have today, from yesterday, I was sitting there and listening, trying to figure out the magnitude of stuff that's going on One Health, which is both encouraging and promising, but I also felt, how is all this coming together in terms of the impact that we need to have? So this morning, we're going to try and unpack some of that in terms of the investments and the finances that we have. And the representation of my panel will look at both global and regional, but also bring it down to country in terms of how these efforts are working. And I think what is important as we sit here, again, if I go back to Durban, there was a lot of nice presentations around how some of these global financing mechanisms have impacted health in Africa. HIV is a good one. The Global Fund has really made a huge difference on this continent. We know that we're doing the same with malaria. But a lot of these things are closing in. So it's now about what we do as a continent in terms of how we lead these efforts with efficiency and effectiveness. So I'm going to call my panelists now. We have 5 panelists representing global, regional, and country level. So the first speaker will be Dr. Espen from the Pandemic Fund. If you can come up. Yes, I see him there. The second speaker will be Dr. Roma Chilengi that we listened to yesterday, and the minister elaborated on some of the excellent work that's happening in Zambia. If you can come up front, Dr. Chilengi. Professor Chilengi, actually. The third speaker will be Ms. Taimi Amambo from Namibia, the Deputy Executive Director of Health, leading important work in leveraging sectors and Ministry of Finance to make sure that the One Health agenda is a priority in Namibia. The fourth speaker will be Mr. Pushpam, from Chief Program Manager from the UN Environment Program, UNEP in Nairobi. They've just become a new implementing partner for the Pandemic Fund. And the final speaker will be Dr. Ramesh from the World Bank, and is the acting practice manager at the World Bank and has been leading a lot of the One Health and also pandemic preparedness and response at the World Bank. So let me sit here to start the dialogue. So I'll start with you, Dr. Espen, and thank you for being here. We're very privileged to have you here today. But if you can tell us in 5 minutes what this catalytic funding is about in terms of how the money is helping accelerate country and regional progress in preparedness and resilience of systems. But if you can also elaborate some of the experiences to date in terms of what country investments can create a foundation for building these systems.
Thank you so much, Your Excellencies, colleagues in the panel. So the Pandemic Fund was established 3 years ago on the shoulders of the COVID-19. And it was established by the G20. And it is first of its kind, focusing on catalytic finance in a multilateral mechanism with pandemic preparedness, response, and prevention as key items. It is formed to build capacity on a local level, a regional level, and a global level, with a strong focus on low and middle income countries. And the fund supports projects, and they are all country-led and country-driven, which means everything starts on ground, everything is implemented on ground, and capacity is built on ground. And typically, it is driven by the country that applies for funding at the Pandemic Fund, but we have also regional projects like the Africa CDC and the AU IBAR that both just received $40 million from the Pandemic Fund. So projects can be single country, projects can be multi-country, and then they can be regional. And a good example of this is our multi-sectoral project here in Zambia that supports laboratory capacity, which has received around $18.9 million from the fund, and then raised co-financing on $12 million or $12.5 million. So how does it work in practice? Well, when we have approved a project and the grant is ready to be paid out, we funnel the funding through implementing entities, and we have 14 of those. So we have the WHO and UNICEF, UNEP, and we have FAO from the UN agencies. We have the World Bank and the other multilateral development banks, and then we have Gavi, CEPI, and the Global Fund. So they are using their governance setup and their coordinating mechanism and also on-ground expertise to be an implementing entity together with the beneficiaries of our funding. And we have, and that is really the innovative part of this in a very positive way, we have a 1:7 catalytic ratio. So through 3 calls for proposals, the Pandemic Fund has had 3 envelopes, as we call it, with $1.35 billion US. This is set to mobilize a total of $11 billion, reaching 98 countries so far in 6 regions. And there are 3 main objectives for the grants. So the first is really the laboratory systems for human and animal. The second is our early warning and disease surveillance systems. And the third is workforce development and capacity building. We want our grants to sustain the country or the regional entity in continue a positive development when the grant is over. And then we have community engagement with all sorts of stakeholders, from faith-based organizations to all sorts of other organizations on ground that can do a lot of service and a lot of capacity building that is not possible from a government office or an entity based in Washington, D.C. And for you as audience, I've left the best bite for last, and that is, of course, that everything is One Health in operation, with a very strong focus on antimicrobial resistance as a challenge to how we successfully build One Health projects. So One Health is really the bread and butter. It is cross-sectoral. It is focused, for example, via our capacity building on human health, animal health, and environmental health, and so forth. So I hope this gives you a good understanding of how we work with the countries and regional entities, and how we multiply the money we are given to grants into projects.
Oh, thank you, and excellent. And thank you for highlighting the principles of the Pandemic Fund, including the fact that the responses have to be country-driven and country-led, the partnerships around it, and the focus, laboratories, surveillance, and also capacity development for human capital. Excellent. I think with that, I'll move on to Professor Chilengi. You've heard what Dr. Espen has said, but tell us the reality on the ground and how this is working.
Thank you, moderator. It's a pleasure to be here. I want to begin by saying that ourselves as Zambia have been privileged to be among the first recipients of the Pandemic Fund. And I think that privilege really comes, I want to say, not by chance. I think the saying that opportunity comes to those who are prepared, I think is incredibly important for a conversation like this for the region. For us in Zambia, we're privileged really to have a very clear enabling environment for the work that we do in public health, which is a very clear mandate established in the law that establishes an institution as a health security and disease intelligence arm of government. And I think that sets us with a very clear framework in which to operate. And it also clearly gives us mandates around work on surveillance, our work on emergency preparedness, our work on coordination of AMR work, our work on coordination of One Health. Now, with that mandate, we basically have been operating in a frame for, like many developing countries, where you are saying, look, we don't have enough financing. But the coming of the pandemic fund converges with a structure and a framework that is already established. And therefore, the only missing link becomes the financing, which then flows through that framework that was already established. So we're privileged to really having received the first of the pandemic fund support, and we are now completing a couple of years with that financing. And our proposal to the pandemic fund when we responded was very clear. We were already working with two of the implementing entities. This is, for us, is the Food Agriculture Organization, FAO, and WHO on the other hand. And we were actually kind of separately engaged with these implementing entities. And so the pandemic fund, again, gives us an opportunity to bring, the sectors which almost never met together previously into one sort of frame to operate together. So we've been running a number of programs, and I think one that I'll speak to a couple, I'm mindful of the time. For the strengthening of laboratories in a context like ours, we are increasingly moving towards a One Health approach, especially for the remote areas, where we are thinking that we don't have enough resources to duplicate things. So why would we need a PCR machine for human health and a PCR machine for animal health? So can't we come up with a process and procedure, because DNA is DNA? So can't we come up with a procedure that, whether the sample is from human health or animal health, that you can be able to generate the needed results? And I think that that is one of the programs we are moving forward with, especially in the more peripheral and distant areas, to really harmonize and bring efficiency in the operations of the One Health sector. But I think that something else that the pandemic fund very quickly has helped us, in earlier this year, we had a problem with aflatoxinosis, which it was a public health emergency. I want to give a context that, we running our surveillance system together with our colleagues in the animal health received a signal that animals have died suddenly in a short time. And in investigating that, we quickly realized that there's one common denominator, which is a brand of feed that those animals ate. And when that was examined, found to have very high aflatoxin content. And then we realized the manufacturers of this product also manufacture human food. So we then began to look into the human side of that and found substantial aflatoxin. Then we asked ourselves, what about the other brands and other manufacturers? When we looked, we found. So basically speaking to the interconnectedness between animals and humans, and that when we do have systems, we'll be able to quickly identify the problem, find solutions, and put measures to, in the interest of public health. And I think that is kind of a key critical example of how we are intercoordinated in the space of One Health. Thank you.
Just as a follow-up question before I summarize what you've just said. So you are the National Public Health Institute.
Yes.
And any sort of reflections of how critical that is to be able to leverage effectively other sectors?
Thank you so much. I think that our own history in Zambia, I think is very similar to many other African countries, and certainly those in the region, which is our health system was designed for curative purposes. Categorically so. So our health systems were not designed for the public health and emergency preparedness and surveillance actions as we understand them today. And so I think it is really critical for countries to figure out how to legally establish frameworks in which you have agencies in whatever context it might work in your countries. I think it is important that there's a very clear mandate which is backed by an appropriate legal mandate, because it is that then that empowers that agency to be able to have especially the coordination function. In most African countries, the challenge is the vertical approach and the silos that exist. And we still have a bit of that, and we're trying to deal with that. I think it is really critical. Yeah.
No, thank you. And thank you for highlighting the importance of having structure, the ability to coordinate, and also to position yourself as the intelligence unit of the Ministry of Health, and being able to then foster new ideas, like this integration you're talking about for PCR, I think is extremely important in terms of improving efficiency. We'll move on to Namibia. And Taimi, you work for the Ministry of Health as the Deputy Executive Director, a very senior position, but you're also mandated to respond to One Health, meaning that you have to work with other sectors, you have to work with the Ministry of Finance to leverage them to make sure that you have the resources to do what you need to do, especially around prevention and disease surveillance, prevention and response. Tell us how it's working in Namibia and what's the future.
Good. No, thank you, Madam Moderator, for having me here on the panel and fellow panelists. Mm-hmm. So, yeah, definitely. 2 years ago, when Namibia adopted this One Health strategy through a tripartite agreement with key stakeholders like agriculture, environment, and others, it was very clear that there is no way as a country we'll be able to really create this resilient health in silos. But we need to be coordinated. Hence, we use this as a blueprint for us to enhance coordinated prevention, preparedness, and response. And I should say that we do have a very conducive environment in country, especially within the legal frameworks. For example, our National Disaster Risk Management Committee is positioned within the Office of Prime Minister, where the budget allocation for that committee is also allocated. But also, at this platform where we have this National Stakeholders Committee, this is where you also have all these One Health stakeholders, including the ministry and all the others. And when we talk about really disaster risk management, is part of that. The interfaces within the One Health that we have is really across all these. And the aim is really to ensure that there is no disruption of livelihoods. For example, when you speak about drought or floods, whether it's localized floods or whatever, it needs to be well managed, and we need to be able to protect health. And it's through those coordinated mechanisms at the highest government institution where it's needed to be coordinated. But we also have what we call the National Emergency Committee, where we now, as a Ministry of Health, with our stakeholders in One Health from the One Health strategy, not just prepare, but also coordinate resources to be able to do that. But it's also very good to hear that Namibia is also a recipient of the pandemic fund through this multi-country funding. So we were able really to harness and receive that support, especially the principles that were outlined there, especially when it comes to workforce capacity enhancement, issues around collaborating with other laboratory in the vet systems, and also issues around joint surveillance. Mind you, I think Namibia is bordering 5 other countries. And those cross-border initiatives are also important, because when we have what we have seen, when we have regional economic committees collaborating through joint surveillance, for example, sharing early warning data. That's very important for countries to be able to share that, but also to be able to be ready to respond. It's like the same analogy we use in the fishermen. When the sea is rough, the fishermen, when they can't go to sea, they prepare, right? They mend their nets, they prepare their boats, so that when the sea break, they are ready to do that. And it's the same response. We are expected to really be rather proactive as opposed to be reactive, especially when it comes to financing, but to have those predictable financing that rather sustainable, but with a complementarity of the pandemic fund from catalytic funding from Africa CDC, WHO, including technical assistance. We were able also to develop and operationalize a national multi-hazard plan, which also prioritize zoonotic events, which is also really a very important priority within government to see that more than ever, we need to increase our allocation to the ministry, to the One Health strategy. For example, in Namibia, the Ministry of Health received the second largest budget. 11% of the national budget go to the Ministry of Health. And of course, that's not meeting the Abuja Declaration, but we are getting there, especially just during and after COVID pandemic. We realize that government are increasingly allocating these resources, not just to protect our health, but also the interfaces we see between human, animal, environmental systems. And that's what we really need to go to be able to do. And we want to really ensure that our governments and our regional economic committees really move towards a stronger and stringent, harmonized regulatory frameworks, and also joint resource mobilization is very important for us to really to have these resilient communities and protect not just our economies, but also tourism, and get investor confidence in our countries. Thank you.
No, but thank you, Tammy. I think this is excellent. I think you illustrate how thinking One Health can help bring sectors together and better coordination, not just within sectors, but as you say, the disaster management. A lot of what goes on in there is exactly what you're also trying to deal with. So I think that's extremely important, but also highlighting how the catalytic fund is helping you in terms of strengthening systems, developing capacity, thinking about cross-border surveillance, and I think that is all critical. And then bringing this dialogue up to the regional bodies to say this is important and we have to work across countries. I think that's excellent. I would like to move to Pushpam from UNEP to now tell us, we've been hearing a lot about One Health, including environment, and your agency deals with environment. We want to make sure that we are inclusive of environment. So give us the pitch around how we do this effectively and some of the work that you're doing at UNEP.
Thank you very much, Dr. Loy, fellow panelists, excellencies, and fellow participants. So 3-4 things I would like to share with you. I hope I'm audible. Number one, if we take 3 factors like climate, biodiversity, pollution, including chemicals and plastics, all these 3 sectors are impacting human life badly. And if you see some of the trends, mega trend, we are nowhere near 1.5 degrees Celsius as we agreed in 2015 in Paris. Most probably we are landing near 3.2 degrees Celsius. And what it means? Heat waves, weather disruptions, drought, land degradation, so on and so forth, bleaching of corals included. Second is biodiversity. We all know by now that 1 million species are under extinction as per IPBES, Intergovernmental Panel on Biodiversity and Ecosystem Services. Third, chemicals are impacting human life. 7% of GDP is washed away by air pollution alone. And today, pollution is killing maximum. The human life is washed away not by terror, not by extreme events, but by pollution alone. One can go on. I mean, plastic is one thing. And that means that each of this climate, biodiversity, pollution needs investment. Investment is not coming. It is coming. The target for climate is 100 billion. We are not even 15 billion annual. 500 billion is biodiversity fund requirement as per the Kunming-Montreal Protocol, GBF, but we are very, very low right now. And similarly for chemicals, although last year we had a chemicals intergovernmental panel in Uruguay, that is where all the governments agree. Still money is not coming. So what is happening here? There is a better way to reflect what the nature can do. It is not a question of being inclusive and including nature here. Without nature, we cease to exist. We all are embedded in the nature. Right, so it is not, sorry to disagree with you. We are UNEP, so we are thinking from that lens that without nature, we can't exist on the earth. Very simple. Now, in Africa, for example, we know, health is one part. If we include in the environmental management, whether it is climate, chemicals, or biodiversity, there is a better possibility to attract fund, including through the blended finance. And that is still in a very rudimentary stage because the nexus is clear. The epidemiologists, public health experts are very clear that climate, human health, biodiversity, vector-borne disease, chemicals, very obviously mortality and morbidity route are impacting human life. And that means human capital too. Human capital is one type of capital besides the productive capital, that is machine, equipment, buildings, natural capital, renewable, non-renewable, and human capital, that is education, skill, plus health. Now, what is happening? Last year, UNEP estimated the wealth of Africa for 51 countries out of 54. And we found that more than half of the wealth in Africa is human capital. And that in fact, 54% is human capital. Rest is natural and produced capital. And that human capital is being impacted. And that augurs very well for the future of Africa if we don't focus on the health and how environmental factors are creating havoc for human health. And that is one of the agenda under One Health too. Now, when we talk about progress, well-being of the nations, we have to move beyond GDP. And that is where wealth must be discussed. Wealth must be part of financial and economic discourse. And that is where you have better chance to entice and attract investment in this sector. That is not happening. You see, Africa has grown in last 70 years at the rate of 1.6% GDP per annum. But in terms of wealth, only 0.6%. So what does it tell you? It tells you that we are doing very bad economics. We are mixing income with wealth. And that is bad economics because we are eating away the wealth and treating them as income, and we are doing well. We are not doing well. And that is one point. And that could be a question of measurement and metrics. But please remember, when we all die, we don't pass GDP, we pass wealth. So it is better to keep track of the wealth and change of wealth. If we don't keep track of wealth, we are not doing well in terms of monitoring, measuring, and managing our assets, including human capital. One more thing here. Africa still is not able to attract investment, only 5% investment in natural capital of the global is coming to Africa. And because we are not able to reflect return on investment in programs and policies and projects, especially in Africa. See Great Green Wall. Great Green Wall for 9+ countries, the return is very high, but return in practice is showing low. If you include human health part, you will find that if you invest $1, you get $18 return. But that is not how the conventional metrics is giving you the number. And that is where the private sector get discouraged to bring the finance. Similarly, whether it is restoration finance, whether it is biodiversity funding, whether it is climate finance, loss and damage, human health aspects and animal health, that benefit is not entering. So we need to change the way we evaluate projects and policies. Once we do that, we have better chance to succeed. There are metrics, there are measurements, but implementation part is poor. I mean, there are other aspects, social and political, we can talk about it, but improving the return on investment by including human capital aspects into the metrics is the first milestone to attract investment which this sector needs. The sector, One Health. So I will stop here.
No, thank you. 54% of Africa's health is human capital. You've made the argument. We have the data on the return on investment. We just need to do it. We just need to put more money on this area. So thank you. I'll move to Ramesh from the World Bank. Ramesh, the World Bank has been working in this area for some time. Tell us what you're learning and where we need to go in terms of building these systems.
Thank you very much, Dr. Chue. I hope I'm audible. I'd like to take this opportunity to thank the organizers for giving me this opportunity. Financial sustainability is certainly becoming a challenge, particularly in the current environment with decreasing external assistance. I'd like to make 5 points, but I'll make it quickly since the World Bank often advocates for efficiency. I'll try to make the 5 points efficiently. The first and foremost, and this is a case that has been made by my fellow panelists, is the need to embed One Health within national policies and strategies. And equally important to make sure that there is an effective national platform within which health, environment, agriculture all come together, but within which we also need to bring in the central ministries like finance, planning, trade, and so on if we are to succeed. Secondly, there is certainly a case to be made for more money for health security and One Health. I think these budgets are woefully underfunded across the world, including in Africa. And we need to commit to strong domestic and regional financing as the foundation for health security and resilience. And this includes efforts to promote health sovereignty and self-sufficiency in the face of these global political shifts. But even as we make the case to ministries of finance for more money for health security, there is also a case to be made for more health security for the money that we actually get. When line ministries return monies that have been allocated to them, that is not a viable option going forward. And therefore, it is important to make sure that the monies that are allocated are used both efficiently and equitably. It's wonderful to see all the partners congregated in this meeting and the influx of external funding. But it is equally important for us to make sure that all of this funding is actually on budget. This is a problem that many national governments struggle with. And it's important to make sure that all of these various revenue streams are well aligned and coordinated under the leadership of national governments within established national planning and budgeting and financial management processes. And then the final point I would like to make is that traditional financing can only take us so far. I think it's important for us to embrace new catalytic innovative funding, which will enable us to mobilize the full spectrum of partners, and particularly the private sector, which is a critical player in this space. These models blend public and private capital They de-risk investments, in this agenda, and demonstrate that health resilience is not only a moral imperative, but an investable one. And there are a variety of options, and it is in this context that I wanted to mention the One World Bank Group agenda, which is a very strong commitment to bringing together IDA and IBRD, which traditionally work with national governments on the one hand, and IFC and MEGA, which has the private sector as its counterparts, and using financing, trust funds, guarantees, as well as technical support in a single coordinated engine for impact. Let me stop there.
No, thank you, and thank you for bringing out some of these models that, we are, trying to operationalize on the ground, and how that comes together when you talk about investments and financing. I'm just wondering, we heard that for a lot of countries, they have these plans, but they haven't really moved beyond the policy dialogue in terms of embedding them in their, especially financing instruments. How can the bank, based on the experience with the different projects that you're implementing, HEPS, HEPA, Redise, how can you help Dr. Chilengi or Ms. Tami move forward with the Ministry of Finance on some of these?
Thank you very much. I was hoping that in addition to Dr. Chilengi mentioning the pandemic fund, that he would have also mentioned the HEPA program, for which Zambia is also a recipient. But I think we have learned a lot, particularly from the Redise program, which invested 660 million across 16 countries in Africa. And we learned a lot of lessons from the implementation of that project, which also enabled us to navigate better crises such as Ebola and COVID. And on the basis of which we now have 2 regional programs, which focus both on national priorities as well as regional priorities. One, as Dr. Chue mentioned, HEPA, which supports Eastern and Southern Africa. It's a $1.5 billion investment that currently supports 11 countries with the possibility of a 12th one joining. And then the HESP project, which supports countries in West Africa, which is an investment of about 700 million and supports, I think, roughly about 8 countries. And I think some of the lessons that we learned from the implementation of these ongoing and completed projects is a very important one. This is a lesson that even the US, which one would think would be well sort of capacitated to handle health emergencies, learned during COVID, that it is important to recognize that health security and health system strengthening are not 2 separate agendas. And there are basically 2 sides of the same coin. And if we want to move forward, we need to bring these 2 agendas together. The second, I think, which has been emphasized over the course of these 2 days, is very important for us to make sure that animal and environmental priorities not get left behind, even as we move forward on human health. The third thing, and this is one reason why both HESP and HEPA focus much more on regionality, in addition, perhaps much more so than we did in Redise. It is important to recognize that since health emergencies do not recognize geographical borders, as we have heard on a number of occasions, that cross-border regional collaboration, policy harmonization, financial support are all brought together in order to enhance scale, efficiency, and collective strength. By the same token, the participation of regional entities becomes critically important. And in this, I'm including the AU, obviously, as the entity which brings the entire continent together, but also Africa CDC, WHO Afro, AUDA NEPAD, EXA-HC, the regional economic communities, all of which need to come together if you have to enhance the effectiveness of these One Health programs. And then the last point that I will make is, and this is a lesson that we learned painfully during Redise, very important for us to have a regional and national monitoring and evaluation framework within which we can assess progress towards the desired impact. And having such a framework can promote better decision-making, strengthen the implementation of programs, and ultimately augment their impact. So I think these are a few lessons. I could go on, but I see the clock ticking down, so I'll stop here.
Any addition to that, Espen?
Yeah, I think maybe just building on what the World Bank said, one thing that is free of charge is countries following up on their global commitment when it comes to national health plans or national action plans on AMR. It's free to actually make a legislative setup that is also being implemented. And we can see, for example, on the AMR action plans that only 10% is financed and less than 20% are actually being regulated. So working together, for example, with the implementing entities, the World Bank, the IMF on its policy implementation, to secure in national governments that we have the commitment, the implementation and the finance is a very important prerequisite for us to battle these global challenges. And then just a huge shout out, you know, it has been such a joy to both hear the innovations, but also the contributions from the panelists and in the room on this commitment to One Health, because that's really the starting point to be able to change this challenge that we all face, not only in Africa, but across the globe.
No, thank you for mentioning that. And I think this is a good segue to Professor Chilengi and also Tammy. There are areas of work that are really difficult sometimes to shift in terms of legislation and policy. And maybe the regional entities can help with that. So when you think about regional coordination, and you mentioned the power of, you know, having regional surveillance or cross-country surveillance, but are there other areas that you feel strengthening regional bodies and coordination would help you in moving some of this policy dialogue within your countries?
Well, thank you very much. I think that the conversation around One Health is clearly so broad and so complex. And I think that initiatives that bring us together and begin to have us recognize, because even when you've done a good job within your boundaries, you are still at risk from your neighbors.
Yeah.
You are still at risk from within your countries. When you've done a good job in health, you are still at risk from other sectors. So the message, I think, is clear. We have to be very open to how broad and complex the challenges for public health we face, and One Health gives us a step in that direction. I think that within countries, we need to organize ourselves across sectors, lobby, negotiate, and network, and create a common theme around One Health so that people are willing to work towards that goal at the national level, but also at the regional level. And I think that we are making strides in that regard. What I think is also critical is to look at the opportunities that exist with the concept of blended financing, and to realize that you're not going to fix this thing with any one source of funding, and therefore you've got to position yourselves within networks, within collaborations, so we can work together in order to achieve a common goal that is for common good.
Thank you. Tammy, last word?
Yes, just building on the concept of blended financing, very important. But I think we also probably also have to explore deeper how we sensitize and how we leverage from the private sector. Because often, especially when it comes to One Health, because often I think, even in my own country, I think we need to do it very intentional and purposeful to not just sensitize, but also to leverage from their skills and resources as part of the issue around blended financing. But also, when you look at the regional, as a regional economic hub, how do you do that better, bringing in not just about public-private financing, but also the indigenous private sector who may have other resources and skills to leverage and drive this entire One Health strategy forward. Thank you.
No, thank you. We've come to the end, but I just wanted to give you a second to say something about this in terms of what you see as the future.
Thank you.
When it comes to environment.
When we talk about, there are plenty of studies, and we have been hearing about antimicrobial resistance in last 1.5 days. and the benefits of action exceeds the cost of action by 6 times. That is what the study says, where UNEP was also involved. UNEP also did that how planetary management improves mental health, and then the saving in terms of depression, anxiety, and other kind of disorders avoided by having a better climate, better green pasture, better pollution management, is of $40 billion annual. What I'm trying to say here, that all the criteria of project appraisal tells you that benefit is much higher. Why investment is not coming? Number one, we have to be clear from this mindset that this is expenditure, what Ramesh highlighted. This is investment in the health sector. So it should, any spending should be considered as investment, not expenditure. Second, when we do cost effectiveness analysis or any NPV or IRR or benefit cost ratio, we must include the benefit, co-benefits on human health.
Right.
That is not happening. Third, we must have integration of this One Health criteria into fiscal and financial models of the national government. That is not happening fully. And we have to develop a community of practitioners like this, and that is why this kind of meetings are needed. And finally, lot of data needs to be generated, and exchange of views, sharing challenges in data and information will strengthen the agenda of One Health in a big way. I will stop.
No, thank you, and thank you. Help me thank the panel. Excellent. From what they've been presenting, a lot is happening. We know what to do. The modalities of engagement are changing. Countries are taking leadership. They know what they want. Partners are rallying behind what countries are doing. So thank you, and good luck with everything. And I know it's a question of time. One Health is going to be the way to go in terms of improving efficiency and effectiveness of our programs and impacting positively on human capital, as you have said, Pushpam. Thank you.
A round of applause, please, for all the panelists. That was certainly a conversation that could go on for hours and hours on end. And I love the intersection that we're tying in terms of making sure that in terms of economic policies, financial ratios, structures, that it's part of the planning and it is incorporated there. We'll build up on several of the themes that have been mentioned by all of the panelists in terms of access to markets, making sure that there's sharing and exchange of data, and most importantly, incorporating these metrics to ensure that the private sector comes on board. So that's a panel discussion that we'll go into just a second to ensure that we have more insight and information that will be shared. But before we do that, we want to continue to highlight the amazing innovations that have come through from many of the participants in the innovators market. So we're going to spend just the next 6 to 10 minutes ensuring that we do have representation of these entrepreneurs and innovators who will be making their way up on stage. Again, the brief is clear. 3 minutes. You tell us more about your innovation, what problem you are solving for, and of course, where we can find you. So we'll start off with our first innovator for this particular session. If we could warmly welcome to the front of the stage, Dr. Nikki Adams of nanopore sequencing technology. It can have a little bit more energy to boost her up. Fantastic. Go ahead. We'll double check with my colleague's microphone is comfortable and audible. You can confirm you can see the countdown timer.
I can.
Fantastic. Dr. Adams, your 3 minutes starts now.
Perfect. What if the next pandemic starts tomorrow? Will we see it coming, or will we be caught off guard again? A few months ago, the Democratic Republic of Congo faced its 16th Ebola outbreak. Remote villages, limited infrastructure, a deadly virus spreading fast. Traditional lab systems could not keep up. Innovation changed the story. Oxford Nanopore's portable sequencing technology enabled real-time genomic analysis at the outbreak site. Within hours, not days, health teams identified the strain, tracked its transmission, and guided targeted interventions. combined with rapid surveillance and vaccinations. This outbreak, 64 cases, 45 deaths, was contained. Speed saved lives. This example reveals a critical truth. Innovation is not just about gadgets, it's about resilience. It's about giving every health system, no matter how remote, the power to see threats as they emerge and not after they spread. Global health security has a growing challenge. Transboundary diseases that cross borders, threatening livestock, wildlife, and animals. Traditional diagnostics fail to deliver timely, scalable, and field-ready solutions, leaving critical gaps in surveillance and response. Oxford Nanopore has a transformative approach. Our real-time portable sequencing platforms enable rapid detection, genomic characterization, which allows us to identify pathogens at the outbreak site. We need to enable not only remote farms or border checkpoints, but even outbreak hotspots to be able to identify these issues. The integration of ultra-portable devices, cloud-based analytics, and adaptive workflows support One Health strategies, bridging human, animal, and environmental health to mitigate cross-species transmission. So what if the next pandemic starts tomorrow? With the right tools, we won't only see it coming, we'll stop it in its tracks.
Fantastic. Dr. Adams, thank you so much. Job well done. Where do we find you? Where's your store?
Our booth is on the way to the lunch, so please pop on before you go there.
Fantastic. Thank you so much. Congratulations to Dr. Adams. We'll keep these innovations going and make sure we do interact with them. On to our next innovator, representing Vercap-Sec and development autogenous bivalent vaccine for tilapia. I actually had to Google if you could actually vaccinate fish. It seemed like an interesting concept, taking an animal out of water only to vaccinate it. But someone who's going to tell us more about this is Dr. Lavelle Chinyama Munga, joining us on stage. A warm welcome, please, to Dr. Lavelle. Next time we have some tilapia, I'll be wondering if it's been vaccinated. But we'll know that you are the man to trust for it. Happy for you to adjust your mic just to make sure you're comfortable. You can confirm the timer on the screen.
Oh, thank you.
Fantastic. Your 3 minutes starts now.
Thank you very much, and thank you very much, moderator, for the introduction. Unfortunately, to disappoint the most, I'm going to talk about Vercap-Sec, which is a virus capture sequencing assay for pre-pandemic detection of viruses and other pathogens. The innovation for fish vaccine, you can find it at our booth because we are the two of us. So infectious diseases, they continue to remind us of one critical truth, that pandemics do not just occur or when we see them at the hospitals. These pathogens, they continue to circulate among wild animals, which move across borders, as well as the peri-domestic animals, such as the rats and the rodents, as the innovator from Liberia taught us. Now, these peri-domestic and wild animals, they carry various pathogens, which some of them we know, some of them we don't know. Therefore, we need to attack and detect those pandemics way before they come into the human populations. So our team utilized a model which is called Vercap-Sec, or virus capture sequencing technology, which can be actually modified to detect either bacterial pathogens as well as the protozoan parasites. So this model detected quite a wide variety of viruses, be it paramyxoviruses, parvoviruses, and the other unknown as well as novel viruses, as well as some of them which have never been reported in Zambia, and some of which are closely related to those that are known to cause disease in humans. Therefore, this model proved two concepts. One, rodents have a more viral diversity, more diverse viruses as compared to what we have known before. So most of the times, actually, when it comes to these pandemics, we concentrate much on bats as the reservoirs for these pathogens, but actually rodents carry quite diverse viruses. And most importantly, capture sequencing methods, which is a metagenomic method for detection of pathogens, whether it be viruses, bacteria, and so on and so forth, proved to be a powerful tool for early detection of threats, for us to be prepared early enough and be able to stop the outbreak before it reaches our populations. Thank you very much. Our booth is right near the T station on the right side. Thank you very much.
Thank you so much, Dr. Munga. Appreciate your efforts and, of course, clarity as well that you provided around the different types of innovation that you bring to the fore. We move on to our next innovator before getting ready for our panel discussion to help us understand more about cold chain free low-cost poultry vaccine, Dr. Tibesh Kamacharya. A round of applause, please, for Dr. Tibesh joining us. Dr. Tibesh Kamacharya. Happy for you to adjust your mic. You can confirm you can see the timer.
I confirm.
Fantastic.
Thank you.
Your 3 minutes starts now.
Thank you. Good morning, dear Excellencies, One Health experts, and One Health champions. My name is Tibesh Kamacharya. I am founder, CEO of a biotech company in Nepal called BioVac Nepal, and it specializes in animal vaccine R&D and manufacturing. I'm here to share our story about chicken. Chicken are important. Chicken are important everywhere. So chicken farming in Nepal is a 4% GDP industry. Half of it is being contributed by the commercial chicken farmers, and the other half from backyard chicken. One of the big challenges in poultry is diseases, especially viral diseases. Among them, Newcastle disease is one of the major diseases. So we, as a biotech scientist, try to address that challenge, and vaccine is an effective way of preventing that disease. Problem is most of the vaccines are imported from outside, and they're not thermostable. So Nepal, being a very developing country with very difficult terrain, access to vaccine, cold chain logistics is a huge problem. So keeping that in mind, we made an effort of coming up with a tablet vaccine, a cold chain-free tablet vaccine that is room temperature stable for 30 days, meaning you can take anywhere and use it, and it will be good for 30 days. So this is a bit of a paradigm shift in terms of how we improve the access to vaccine. But I'm here to not talk about just the tablet vaccine. I'm here to tell you that I'm very motivated and excited about how things are moving here in Africa. I know very little about. One Health is a major force, it seems like. And one of the big things that we learned from our COVID experience is surveillance, diagnostics, and vaccines are important. And access to vaccine in each and every country is a big challenge. And so I'm here to say that it is possible to make a modular vaccine facility with innovative tools and technologies to address the challenges. Thank you. And my booth is right outside, so if you have any question, please feel free to visit. Thank you.
Thank you so much, Dr. Dimesh. Appreciate your insight. This is what we're here for, right? We constantly talk about making sure that we shift the needle forward. Our previous panel quoted significant numbers on the sums of capital that need to be deployed, how we need to structure the capital to make sure that there's a partnership that takes place between the government as well as the private sector, and even understanding how this needs to be underscored by policy. So once we tick all those boxes, right, this is where the private sector comes into play. The enablers who move quickly and swiftly, implement the innovation as need be while still complying with the necessary governance and controls. But this next panel discussion is going to give us some insight into exactly that. We're building up on the themes that have been set by our previous panel, and most importantly also echoing the sentiments of the innovators within the innovation marketplace, how they are coming to the party to help us fast track the solutions we want to implement when it comes to One Health. So this next panel discussion will take place over the next 35 minutes. So we'll do our best to make sure that we share as much information as possible in the interest of time. And these particular speakers will be joining me up on stage, also taking a brief opportunity to address any of your key questions, but most importantly, helping us understand how through investment, innovation, and collaboration, we mobilize and we very quickly implement the solutions that we've discussed. Please allow me to welcome to the front of the stage. I'll introduce my speakers individually, starting off with the speaker who occupy the second seat to my left-hand side. Mr. James Milanzi, Country Director for the Zambia Regional Management of Africa Parks. If we could warmly welcome him up on stage. He'll be followed by Mr. Wayne Barnes, Partner Account Manager for Southern Africa at Illumina. A round of applause, please, for him. Ms. Zinhle Chikwe, the CEO of GS1 South Africa, joining us today. Please give her a round of applause. Dr. Mariam Mohammed, Director of the Nigeria National Veterinary Research Institute. Please give her a round of applause as she joins us up on stage. And Mr. Hope Tariro Pachena, Operations Manager for Manufacturing, Agribusiness and Services in Africa for the IFC, International Finance Corporation. Please give him a warm round of applause, and for all of my panelists. Now, this is potentially the panel discussion that really puts things into the next gear, building up on a series of themes and concepts that have been shared by various speakers and previous panelists. I'm going to give each of them themes and understanding into questions that we will address, and most importantly, an opportunity for you too to share your feedback and interact with them. But perhaps without further ado, one thing that we do need to recognize that has been echoed by the previous panelists is that the threat and the concern and reality of a potential pandemic facing us is highly likely. So it's no longer a question as to when, but how best prepared we actually are. Coupled with that, we also need to make sure that there's a heightened level of investment that does take place. And annually, the World Bank, who have on record that we need to spend at least annually about 33 billion rand in terms of this level of preparedness. The previous panel spoke about how we unlock that capital, but let's talk about how the private sector plays a role in within this capital as well as the innovation to shift things forward. And perhaps, James, this is where I'd like to start off with you, because you have played a very pertinent role in leveraging the power of PPPs, public-private partnerships, specifically within the space that you serve. You started off as an ecologist, you take care of the African national parks within Zambia, and most importantly, post the pandemic, you've cooperated with private sector participants and the government to make sure that you shift the narrative when it comes to the sustainability, the profitability, and even ensuring the eco-safety of the national parks in Zambia specifically. I'm quite keen for you to share your lessons that we can learn when it comes to leveraging leveraging the potential of PPPs to explore the kind of growth that we'd like to see.
Thank you very much. First of all, I would like to correct the misnomer that when you are looking after national parks or protected areas, we're just looking after wildlife.
Mm-hmm.
These are ecological, biological biodiversity hotspots. These are headwaters, sources of headwaters. These are large areas that contain forests and sources of rivers, and therefore they modify the climate. They different changes of climate and weather depend on the protection of these ecosystems.
Yep.
And if we don't look after them, they're definitely going to cause a lot of these problems that we're talking about. Immediate changes, rapid changes in climate, and changes in temperatures, which lead to all these pandemics.
Mm-hmm.
Therefore, African Parks is following up on the call for the 40% of the world to be reserved for conservation. And most countries have done that. The biggest challenge is financing.
Mm-hmm.
For example, Zambia has about 40% set aside for wildlife and forest, but the challenge is how you manage these areas.
Mm-hmm.
And hence, African Parks came up with an innovative model where we partner with governments, we partner with the local communities, and then we source for funds from donors and anthropologists, work with these people, and ensure that these areas are secured, not only for biodiversity, but socio-economic potential for the communities as well.
Got you. And maybe that's an important point to elaborate on even further, right? Because you drove in just yesterday, 3 hours from Kafue, one of the biggest and largest potentials in terms of African parks that we have on the continent. And this also has opportunities for a multiply effect. Through conservation, you're able to create jobs. That in itself boosts the wildlife, that capacity we have. That in itself boosts tourism. Tourism boosts spending, creates jobs, pays taxes. So we need to actually elaborate further on the multiply effect and why it's a great incentive, not only for governments, but also for the private sector to participate.
Exactly. I mean, what we normally do is, as African Parks, we leave ourselves with the protection of the area. But when it comes to the communities, we are not experts. So the private sector would like to invite them so that we start creating innovative ideas or interventions with the community to build a local economy. Remember that the local communities around these national parks, they depend on the natural resources.
Mm-hmm.
So when we get into that area, we would like to have either farmers that are going to bring in smart agriculture.
Mm-hmm.
If there are pastoralists or people that look after cattle, we like them to look after cattle specifically very well so that they don't suffer in terms of diseases and stuff like that. So this is where now we try and look after other NGOs that can work with that because they are experts at that.
100%. We'll come back to that pointer in just a moment because there's many other themes from your fellow panelists that really do echo that sentiment, especially when it comes to tracing the development of diseases, outbreaks, and even the livestock and animals that we have within our nature reserves. But Wayne, I'd like to come to you because you sit at the precipice of amazing innovations, especially in genomic studies. A few years ago, during the pandemic, there was a heightened level of awareness in understanding the importance of genomes, pathology, and all the testing that goes on behind it. We have rested on our laurels, but some nations have actually stepped forward, participated actively in making sure that there's a clear accord for the private sector to come on board and assist in the preparedness that we have for future pandemics. Talk to us about some of the innovations you've brought through, but most importantly, how governments, through their policies and regulatory frameworks, have actually opened up the sector for participation from a private sector player like yourselves.
Absolutely. Thank you. I think you're quite rightly, during the height of COVID, we had all countries needing to be doing surveillance, to be doing testing. And we realized that, we can't be sending samples out of countries. We need to capacitate countries to be doing their own surveillance, to run their own sequencing programs.
Mm-hmm.
And through partnerships, really, we've been able to leverage through the Africa PGI initiative and what we've done with Africa CDC, an initiative called Africa PGI, where Illumina has come to the party and invested $20 million to set up local, regional genomics workforce in countries. This is during lockdowns where goods couldn't really travel across borders. So it was definitely an opportunity during this pandemic to see and develop that necessary capacity of building a workforce from ground level. Countries such as Zambia has really gone forward with that and have implemented national strategies involving genomics at the cornerstone of that. So policies and framework they have developed incorporates genomics in it, in the Zambia Genomics Sequencing Consortium that was formed. And through this consortium, they are really working cross laboratories with sequencing capacity to not repeat lessons that needs to be repeated, to work more effectively to identify what are those critical key steps that is needed. From an industry perspective, we are there to support, to set up these laboratories, to make sure they have the necessary support, to help with shaping those policies and advising what that can look like before the next pandemic does come to fore.
Got you.
The other opportunity it brought for us was looking at the human genome. And I think the potential of unlocking the power of the human genome is our mission. It is what we do, it's what we live, it's what we breathe, to improve human health, to improve animal health, which is really the cornerstone of what the discussions, the deliberations is about here. So absolutely, I think we have seen this as an opportunity from industry to invest. I think as a next step, it is now taking that country ownership and saying, we will not be sending our samples overseas to the global north, the global east or west. Let us do this in Africa for Africa.
This is an important point that you highlight, and perhaps I'd like us just to emphasize on it a little more, because it speaks to how the private sector is keen to mobilize on the continent, in country, in region, and then perhaps ties into a theme that, Mariam, you can also build up on, specifically when it comes to vaccinations. Because you're saying we have the opportunity to actually protect the IP, protect the studies that we have, and actually innovate for them locally. Wayne, let's start with you as we hear your perspective on this one, as to how it speaks to the full ownership of the value chain, or at least active participation therein. And Mariam, I'm keen for you to add your views and insight, specifically focused on your key area of expertise, given how this speaks then to vaccination.
Yeah, absolutely.
Yes, it's still on.
Oh, sorry. Absolutely, and I think it speaks to the role of government here as well, right? In terms of policies and frameworks that needs to be developed, that will sort of really give confidence and drive that investment in terms of what companies would require to be doing further investments in Africa. Once those critical building blocks in terms of stability, in terms of frameworks, regulatory frameworks that needs to be formed, access of goods to credit across borders, tax exemptions, which is really for this type of work an absolute must. So we can't be bringing the innovation and developing it at a speed of light, and it takes us 2 years to get the innovation into the country. So I think, yes, this gives the opportunity for taking that local ownership, but before that can happen, those policies, those frameworks, and the stability that needs to be formed in country needs to be proven and shaped through all these stakeholders.
100%. Dr. Mohammed, Mariam, if we could get your views and insight into this, because you set at a beautiful interface where not only do you play in the role of public-private partnerships, as James has alluded to, but also in the space of laboratories and crafting the genomic testing and understanding the risks that prevail, but also then speaking to the interface of the development and distribution of these vaccinations. Private sector, as a participant, leveraging partnerships, how critical is it that we continue to create an enabling environment, and what has worked specifically in a market like Nigeria?
I think it's, thank you, I think it's critical that we have an agency or a partner like Illumina that is able to keep the genomics and the genomic materials in Africa. That means that we can take control and ownership. And this benefit sharing is important between the private sector and the public sector. But we have to do that within certain sets of protocols. For example, I'm thinking about the Nagoya protocols, where you're talking about genetic materials and also talking about how you share the benefits. And it is important that from the get-go, these protocols are understood and that government provides the enabling environment for the private sector to come in, provide the data, keep the genomic materials within Africa, but to be able to use it, for instance, for vaccine production.
100%. Maybe if you can build up on that theme as well, because so often the assumption is that Government and the private sector would be at loggerheads as to how to use this data. And I'm quite keen just to reference your experience as to how you've seen both the public sector and the private sector working hand in hand to ensure that there's still protection and sovereignty, not only of the information, but classified or critical information that remains sensitive, but still leveraging off of the partnerships that you've embarked upon, given your experience within the region of ECOWAS. Quite keen to get your feedback there. As Rachel adjusts your mic. Thank you so much, Rachel.
Thank you, Rachel. I think it's about ensuring that from the get-go, there is an arrangement for material transfers.
Mm-hmm.
There should be contracts in place where the private sector is comfortable enough to work on the data and to work on the genomics and the genetic materials and be able to benefit from it for a period of time, because there is a commercial interest to be met. And those have to be worked into arrangements so that the private sector is comfortable enough to bring in its capacities into making sure that whatever product is produced out of these genetic materials, there is benefit sharing that is open and available for everyone.
Got you. Thank you for that. And I love where you're going with this particular story, because in a moment you'll tell that there's a theme and a trend that we're building up on here, that these frameworks need to be understood by all participants involved. It needs to be baked into the system to ensure that as the private sector unlocks its innovation, they understand the parameters within which they're operating in. They also have an opportunity to be as flexible, to be as agile as the system and the environment actually requires them to be, and making sure that we have everyone participating. Zinhle, this makes me want to come to you, but before I come to you to build up on many of these themes, I don't want to leave you out hope, because you also play in a space where not only do you find the balance between private sector participation, but of course ensuring that there's a unified approach with the public sector, but making sure that we're able to mobilize this capital. I want to focus this in specifically into making sure that everyone is involved into the supply chain. This has typically been an area of interest for you throughout your career. We're focused on agriculture specifically. You incorporate the multiple players to ensure that they're all part of that ecosystem. What have been some of the positive examples that have actually assisted and enabled this level of growth and partnership? Hope, if I can start with you.
Okay, so as I have seen, I think it's good I'll give context. We have realized that...
if we could please move the microphone slightly closer to you, sir. There we go.
As I have seen, I think it's important to recognize that the livestock sector is one of the critical sectors for us. Why? As you know, the population is going to grow by 25% to 10 billion in 2050. And with that, with rising incomes and changing diets and increasing global populations, which I have mentioned, there is going to be an increase in demand for livestock products. And also important to note that trade in live animals and animal products contributes 40% of the global value of agricultural output. So it's an important sector. So with that in mind, I think it's important that to note that as IFC, we've made investments in South Africa, for example, BioVac, which manufactures vaccines for humans, which is critical also to that value chain. And in Zambia, which we are here in the country, I think we have invested in Zambeef. And it's important to note that as we invest in livestock operations, as IFC, we have developed IFC practices for sustainable investment in the private private sector livestock operations. And in these practices, actually, we take into account the One Health concept. And in every business that we invest, we would want to make sure that they comply with those practices which cover One Health. And I also have to bring another example as of we have invested in a dairy operation in Uganda. So it's just to give you a context that it's a sector which we're really very interested in. And as we invest in companies. Of course, they won't be meeting those practices which cover One Health, but we work with them to make sure within 3 years of us investing in those companies, they comply with those practices.
100%. And these examples that you allude to are very practical because they do speak to other sectors that can be involved. This takes me then to a theme that I want us to build up on that has been set from the various speakers. Whether we're talking about livestock, of course, wildlife as well, vaccinations, testing, and laboratories. Ultimately, these are all aspects that form part of a critical process in addressing the One Health needs. But beyond that, as was echoed in the panel regarding finance, and yesterday in a panel discussion facilitated by Dr. Mulumba that spoke about trade, ultimately what we're trying to do is ensure that as a region, we're able to trade information and insight on the genomic testing, to trade information, insight, and innovation on the vaccinations we produce, on the wildlife that is able to provide dynamic tourism for our sectors, and even the capital that needs to be explored, and vaccinations and preventative solutions. I want to challenge you as audience members for a moment, and this is part of the process to get to our next speaker. If you take a look at the bottle of water on your table, you can do this with me. Take a look at the barcode. You would read that this also is also manufactured in Zambia. You can do the same with the mints that are on the table. If you read behind the pamphlet, not only are these products that are actively produced in Zambia, but you have detailed information and insight on who produced them, the address of where these particular products were manufactured. And what we're ultimately trying to do is that how we can track and trace the water, the mint, the chocolate, the animal, the vaccination, the beef, the chicken portion, the tilapia, I can go on and on. We want to ensure that this is also part of a processing and tracking and tracing that we can implement as well when it comes to One Health. Zinhle, this is where you come in. And I think this is where you have the opportunity to help us amplify an understanding as to how, whether we're talking vaccination, wildlife, water, or even the vaccinations that we deploy within our environments regarding One Health, we need to ensure that from source right through to deployment, we are able to adequately track who produced these goods to ensure that not only do we facilitate trade, we have the right partnerships in place, there's a level of accountability, protection of that data as well. Help us understand how as GS1, you essentially help amplify and support these structures.
Thank you, Gugu. I think Gugu has covered me. I'm not sure why I'm here, because she's got everything covered. So GS1 is a global standards organization. We're a neutral organization. We provide unique identifiers. We operate globally in 25 sectors. And this particular discussion today of One Health is really important because it's cutting across 3 sectors, which is obviously health for humans, animal, as well as environment, with the ability to provide the unique identification of each and every process within the value chain. We are able to say this product can be trusted as a foundation because we cannot have data sitting in different systems that are not interoperable, number one. Number 2, that are priority, that are just sitting in your organization or are just sitting in your country. Whenever you're doing cross-trade or cross-border trade or international trade, it's not going to be visible in the same manner. So what GS1 does is a foundation of how this information or how this data is captured in the different systems that your organization with. We work with different solution providers to make sure that there is a global visibility, whether from a customs, as Gugu has said, from farm to fork for food to enhance food safety. And if there's mistakes that have been picked up in all the critical incidents that have been captured, we are able to react faster. We reduce errors. We are operating in the health sector currently, and there's really big developments that are happening there. We just happy to announce that currently GS1 as well as Google have partnered to make sure when you go to your Google lenses, you can track and trace, and literally when you use your camera, not only have to have an app now, you can with Google Lens, you can scan it, and then it's going to lead you correctly to the right registry where that product is. And now you can confirm who's the brand owner, where is it manufactured, because we also track and trace locations, we identify locations, we identify machines, we identify tools, we identify products. So GS1 is a foundation. As we've been listening here today, all the solution providers that the innovators have had, the standard that government, businesses, as well as funders need to have, so that how this information is captured, how this information is shared, is GS1.
Got you. An important point that you're highlighting here, Zinhle, and that has been echoed by Wayne and, of course, as Mariam, is the fact that we want to develop and innovate these solutions here. But it does seem as though there's a challenge in finding alignment to make sure that the vaccines, the livestock, the wildlife, the solutions we implement in Angola, in Seychelles, in Eswatini, need to speak to each other. So as a continent, as a region, are we finding any solutions to make sure that the codes, the standards, the governance are aligned, but also that there's a heightened awareness of the protection of the sovereignty of our data?
Definitely.
I'm keen for you to address this. Wayne, if you've got some feedback, please do share. But let's start with Zinhle, and we'll come to you shortly.
Definitely, as Africa, we are growing into that, but we have to really embrace the global standard. Currently, South Africa has about 33% coverage, so we have a big task to do from a global standard and how we really are capturing this information. So it's important that governments come and align with us as private sector, so that we can all work towards the same goal, because we're not only trading in our countries, we are trading regionally, we are trading continentally from an African perspective as well as globally. Europe, if you are trading in Europe, you're exporting there, they want something is called the digital product passport. Similar to like when we entered a couple of days ago in Zambia, you produce your passport, which has also a digital twin. That's what governments want for each and every product to have a digital twin, which is going to help with customs, it's going to help with cross-border trade. We have the African Continental Free Trade Area.
Mm-hmm.
That's how we enable it. Because we cannot, in each and every country, capture information differently. That's going to just slow things down at the borders. It's going to make sure that, because in South Africa, what we have done, we have calculated how many papers a driver needs to take from South Africa to Zimbabwe or to Botswana. 600-page document that they have to physically have. And that should not be the case. With our system, working with different EPR systems or service providers and partners, you can have visibility of this at just the press of a button, definitely.
Got you. Just to go next. So Wayne, your perspective, given your operations across the region?
Yes. Thank you. I think when it comes to genomic data, it is a very, very sensitive topic, specifically around human genomic data. So from a supplier perspective, we have obviously created the research environment for these workflows to store and house that data. But it's really up to the in-country policies and steering committees to discuss and formulate what that policies needs to look like. And I think this is where protection of data is very, very important. Mm-hmm. And we are seeing a lot of collaboration between countries in shaping genomics policies. And I'm not talking only from an infectious diseases perspective, but also in terms of human genomics. And this is really where initiatives such as H3 Africa, which used another technology we call genotyping. We have developed a custom product there, and they've genotyped more than 70,000 samples. Now you can imagine that vast majority of data. Yeah. And there was a specific focus and steering committee around involving multi-countries to discuss how that data can be accessed, how that can be stored, who can access the data, and all the sort of T's and C's involved in that.
Wayne, take us further here, because clearly you were privy to some interesting conversations. There are government leaders here in the room who actually influence that type of policy. You have their ear. If you could make a suggestion or a recommendation as to what to consider in terms of protecting information, but still allowing it to be shared regionally, what are some of the recommendations that came through?
Thank you, Gugu. I think it comes to really identifying who are the experts in your country, right? And I think if there's one thing that we've seen through the Africa Union, lift as we rise, right? And I think that sort of is the whole Ubuntu spirit. Reach out to your in-country, build that capacity in-country. Don't be dependent on other people. Build that knowledge, build that databases in-country, and then bring in your thought leaders, help them shape and develop. And we have already done a lot of that. Use the examples from other regions and other programs that have used and done this already. See where they have failed, or what can be improved, and then use that to set your own standards. And only by that, it can help us shape and develop that. And also then, for sharing that data, there needs to be a uniform process that can be applied and saying, well, this is what we consider that framework if you want to do genomic research in Africa. And there I can really call out the great work that Nigeria has been doing by the Institute of Prof. Happy, that has really led to say, guys, we are not sending samples. If you want to work with us, you do work with us as pharma companies, as private, but it will be on our terms. They will be there to follow the principles and the guidelines that has been set up by the countries. Yes.
Got you. Appreciate the practical examples, because now we know which partners to speak to in terms of learning some lessons. Mariam, given the reference to Nigeria and of course some lessons that have been learned in terms of positive implementation of policies to enable the private sector, are there additional examples that are practical that you can share with us as an audience?
Yeah, specifically for vaccines, I think the harmonization of documentation and registration of vaccines across regions will make the private sector more encouraged to get involved. Because you do not have to get the same 6,000-page documents across every country. Once it is articulated and polished in one country, it can be used in all of the region. So it makes registration for vaccines, for example, much easier than having it done. So you can do it on a regional basis. And so exporting vaccines across borders, it makes it easier. And you know where the vaccine seeds are, but also the documentation is much easier for the customs to allow vaccines to go through instead of them sitting somewhere.
And is that not therein where the solution then lies for regionalization, for us to amplify our efforts as a region to make sure that if we are speaking the same language as a region, as a continent, as a globe, then we're able to fast-track our responsiveness to any potential pandemics, epidemics, and healthcare challenges. Dr. Mariam, but happy for the panel or anyone else to actually share their views. If you can expand.
You could have stockpiles in one country, and then you have the outbreak in another country. But if these registrations are harmonized, it's much easier to move products across borders, across the continent. I think that is something that needs to be looked at both the AU level and at the regional levels to see how to ease the movement of those biologics, because you have to also bring in the infrastructure that is required.
Yes.
Cold chains have to be put in place and to be able to move vaccines very easily, and in the potential that they do not get destroyed while they are moving to other parts of the continent.
100%. This is exactly the point that we want to continue to flesh out in the conversation, how we approach this as a region. And from what we understand and gather from this particular panel discussion, the private sector is keen, ready, and able. They don't mind playing according to the rules, but make the rules clear. And then we understand how, as partners, we are able to collaborate and operate in partnership to ensure that all the major challenges get addressed from a regional point of view and addressing them appropriately. We have about 5 minutes left for the panel, and I'd like us to squeeze in just at least 2 questions, if we may, from the audience members. A few of you as experts in genomics were nodding your head and agreeing to some of the comments that were shared by Wayne. Some of you in the finance arena also sharing some of your feedback, as we heard from Hope. And of course, curiosity in terms of tracking, tracing, and leading a level of accountability to ensuring that whatever it is that we produce within the One Health ecosystem can be tracked. So we're happy to take your questions, 2 questions or 3 from the floor.
Sorry, Boog.
Go
Just
ahead,
to clarify, I think, for the audience, that IFC stands for International Finance Corporation. We're a sister organization to the World Bank Group.
Yes.
So my colleagues, I think one of the colleagues was sitting here from the World Bank. Thank you. For those who don't know IFC. Yeah.
You should know. Is there anyone who didn't know? If not, then please have lunch with Hope today. He'll be a good friend, partner, and collaborator in unlocking a lot more opportunities that exist. But we're quite keen to get your questions. We've got about 4 minutes for them, just cognizant of time. Ma'am, your hand has been raised. If you could kindly please stand up. It's just easier for my colleagues to identify you, to give you the mic. If there's anyone else with a question, please feel free to raise your hand. Fantastic. Dr. Helen, we see you as well. We'll come to you. And then a 3rd question. We'll take one more just to squeeze it in. If I fail to see you, the team will alert me. But we'll start with yourself and then go to Professor Helen. If you push up, let's see. Speak into the mic, it might work. Not yet. Fantastic, you've got a backup mic. If you push up, let's try. I'll tell you what, as we work on getting a mic that is audible to you, Dr. Helen, do you have a mic? Yours is working. We'll start with your question and then move on to our colleague.
Thank you so much, and thank you to the panel for the good discussion. My question is really for GSI and maybe other people who can add to that, thinking about interoperability across the sectors. I see one of the biggest issues we have is being able to connect the human health, the animal health, the environmental health with surveillance data. You know, like in human health, we have the DSI system, but most of the time the animal health, environmental health are left behind. Are you working at that level? Because if we can't do that at country level, be able to get, for example, Rift Valley fever, we have human diseases, we have animals dying, and we have insects as well in entomology. If we can get all that data into one system, then we can act faster. So are you working at that level? And is that something countries can adopt?
Definitely.
Fantastic question. Thank you so much, Prof. Helen. We'll come to it in a moment, Zinhle. In the interest of time, I'd like us to get our second question to address it as well. Please go ahead, ma'am.
Well, thank you so much. My question is to the gentleman in the middle.
Wayne.
Yes, Wayne.
Illumina.
You did mention that genomic data is a very sensitive area to work in. And with the pandemic agreement that just was concluded this year, it's one of the contentious issues within the agreement. Where does genomic or pathogen and benefit sharing comes in? Because from the African perspective, we want to have in-house capabilities to use the genomic data to benefit us now, but we still are not there yet. So there is a lot of benefit that comes from a manufacturing perspective, the product manufactured as a result of the genetic data that you get from Africa. Where does the benefit sharing coming in this conversation?
Fantastic question. Thank you so much. Last round for any other question or any additional question we have in the room? Fantastic. Okay, well, let's address the first two questions, and we'll start off with Professor Helen. Zinhle, this one is for you. Surveillance data. Are you working at the level of plant, environment, and animal, and finding an intersection between all of them?
Definitely, Dr. Helen, I must reassure you that we are doing that. GS1 operates currently. We have agriculture upward and upstream and downstream. We're doing that. In South Africa in particular, we're working with the red meat industry. We are locating farms. We are locating animals. We are locating feedlots. We are locating and tracking and tagging these animals as they move along in the value chain to abattoir level, so that we can capture all the critical incidents that happens to that, not only from an animal perspective, also from from an apparel perspective. We are tracking wool from Cape Wool that is already being sold. We can show a T-shirt that was tracked from South Africa with the wool that was from a ship that was shredded from South Africa, and now that product is available in Europe. So we are really tracking all the value chains. Mining, we're working in the mining sector to the earths that are precious earths that we are tracking that. We are tracking substandard electrical appliances. We are finding that homes are banned because of substandard electrical appliances that are not properly tested and assured by different Bureau of Standards in each and every country. So GS1 standard is exactly that, because it's what, okay, I just want to say this one. One health, one global standard.
There we go. One future, there we go. Wayne, your response to the question that we had, a critical one, just in terms of the opportunities that might lie and concerns we need to be mindful of in the sharing of data regarding genomics.
Yeah, absolutely. I think I just want to make a clear distinction here that the data and the genomic data that's not something we as industry control or regulate in that aspect, right? It is really up to the ministries, the government to really drive that in terms of keeping that data. And then there is policies and frameworks that are being developed by institutions such as Africa CDC that is setting out, when we talk about pandemic responses and strengthening surveillance systems, the benefit sharing there would be strengthening those surveillance systems and making sure that you can do near real-time monitoring whether the measures you've incorporated is working and controlling those borders, etc. So yeah, there are frameworks and policies needed to define that in country, and I think institutions such as Africa CDC play a pivotal role in building and shaping those discussions and policies.
Got you. Thank you so much for that response in terms of the concerns there. Hope it does suit your needs in terms of the benefit sharing that we need to be mindful of, but it is a much deeper conversation that does need to be had. The screen is flashing red. I'm going to give you 20 seconds each, and perhaps this is for both James and Hope, just to conclude and share your closing remarks. Perhaps, James, if we can just start off with you to say, a message to key participants. We want to be excited to understand that there's opportunities for us to partner with. What are the opportunities we need to tap into within the short term? 6 to 18 months, what's practical, and what opportunities can we explore within your field and area of expertise?
Yeah, in wildlife, I think we would like to partner with everybody else that is out there. We need the funding. Because this is exactly where the challenge is. We need the funding and to ensure that these areas are well protected and there's nothing that is going to come out of the parks that is going to endanger us.
Fantastic. And maybe we can even track them to know where that rhino is and how it got to a particular water source that might have contaminated the water supply of the water manufacturer. That might be the water that you're drinking in a particular vicinity. So there's so many interconnected themes here that we need to be mindful of. Hope, to close off with you. As we've heard, the capital is there. It's able to be deployed. The private sector is keen and ready. Your closing remarks as to some of the sectors, the fields and industries that are really attracting a heightened level of attention and that should be invested in right now.
Thank you. I think, as I mentioned earlier, the demand for animal protein is going to increase. The growth is phenomenal. So that presents opportunities and more problems in terms of zoonotics, One Health that we are mentioning about. As IFC, I think it's a sector that we are very keen to invest in, this One Health and the livestock sector. As the private sector arm of the World Bank, we have systems in place to even help the private sector also implement this One Health in their operations. As I've mentioned, I think we've got IFC practices for sustainable investment in livestock operations. So we are keen to invest in all the sectors, vaccines, diagnostics, we invest in all those sectors. So yeah, I would say the challenge is there, the opportunity is there, and we are there to offer solutions, sustainable solutions, private sector solutions to these challenges. Thank you.
Thank you so much, James, Dr. Mariam, Zinhle, Wayne, and James. We appreciate the time and feedback that you've shared with us and for setting the context quite clearly that the private sector is key. And not only are they a key enabler in terms of processing a lot of growth that we require, but they are also key participants and partners in shifting the narrative forward. So the capital is there, it's able to be unlocked. The private sector is ready to participate, happy to abide by the rules and the controls, but let's all play on an even field where there's clarity around the rules and the context we operate in. Thank you so much to my panelists. Thoroughly enjoyed this conversation. A round of applause for them, please, as they make their way off stage. Thank you so much to all my panelists. Thank you for your feedback and insight. Please do feel free as well to continue interacting with each other for ongoing feedback into the conversations that we've been having, not just for this panel, but all of them throughout the course of the day to actually build up on the information that has been shared. So on that note, I'm going to ask all of you just to be upstanding for 2 seconds, if we may. Please be upstanding, ladies and gentlemen, and join me. Yesterday we had an aerobics class, today we are doing it again. So perhaps if we could just shake out our hands for a second, stretch out, stretch out, stretch out. Ministers too. We're prioritizing your health. Move your shoulders around as well to ease off the tension, right? There's people around you, but just keep your elbows close enough not to knock anyone over. Are we ready for the jumping jacks? Well, I heard a yes. Fantastic. If you can, you're more than welcome to do some jumping jacks. Fantastic. That's just to make sure that our blood continues flowing. Your health is also a priority as we talk about the health of the rest of the region. Thank you so much for indulging me, ladies and gentlemen. Please feel free to have a seat. This is as we're going to continue with the program. We are changing the program slightly to make sure that we do keep to time. A reminder that there is coffee and some refreshments available just outside as you make your way to the innovation marketplace and interacting with the entrepreneurs for some feedback. So if you feel like you need to stretch your legs or get a refreshment, please do feel free to make your way to the coffee area, but we also want you back in the room. So do be sure to come back as we'd like your feedback. We're going to follow through with the theme regarding the innovator pitch and hearing from more entrepreneurs and innovators in this regard. So we're building up on this before moving on to our next panel discussion. And for that, I'd like to warmly welcome our next entrepreneur who joins us on the stage, the Alert Serious Game from CIRAD, Dr. Anne Conan, who joins us up on stage. Dr. Anne, a warm round of applause to you. Fantastic. We'll adjust your mic, make sure you're comfortable.
Should be good.
Do you need us to display your, anything you need to display?
No.
You're comfortable?
I am.
You can confirm you can see the timer?
Yes, I see it.
Fantastic. Your 3 minutes starts now.
Thank you. Good day, everybody. Dear colleagues, I would like to introduce you today to the Alert game. So it's an innovative and participatory tool created by CIRAD, and it's a serious game. So a serious game, like Alert, are transforming the way that we engage with communities, but also it deepens our understanding of One Health surveillance. One Health integrated surveillance aims to detect and respond swiftly to the undetected diseases and other One Health crises. To be effective, it must involve all stakeholders at all levels, from the community and the frontline health worker to the national authorities. Yet, too often, these stakeholders struggle to grasp their own role and the role of others in the flow of information of surveillance systems. And that slows down the response times. So raising awareness among these stakeholders is critical. At CIRAD, we see serious games as a powerful way to strengthen multi-sectoral coordination, to promote system thinking, to bridge knowledge gaps, and to engage youth and civil society in the One Health agenda. So Alert is one of our games, but we have also other games linked to One Health. So that's why we created these games, Alert, in collaboration with HOA, IRD, and Pasteur Institute. And with this game, the players can actually see and explore all the information flows in surveillance systems, how the risk identified, and how coordinated action can prevent and mitigate zoonosis events. So this game builds trust between stakeholders and improves risk communication, and it fosters shared responsibilities across sectors. The game is versatile. It can be used locally with a training program. It can be used at a national level for capacity building. It can also be used regionally between different stakeholders. CIRAD researchers, like myself, are already using Alert in French and in English through different projects across Africa. And we really hope that you and your team will join us in becoming Alert facilitators and to promote One Health and improve One Health surveillance. Thank you very much.
Thank you, Dr. Conan. Merci beaucoup. Your store, where do we find it?
Just the last one.
The last one out here. Fantastic. Thank you so much. Dr. Conan elaborating more on the Alert Serious Game. So, one that should be taken very seriously. Our next entrepreneur and innovator joins us from Wildlife Health Watch. That is Dr. Charlene Angweni. Dr. Charlene, a warm welcome to you in the front of the stage. The podium is all yours. Fantastic. Happy for you to adjust your mic. You can confirm you can see the timer?
All clear.
All clear. Your 3 minutes starts now.
Thank you very much. Good morning, everyone. As we know, diseases are the wildlife-livestock-human interface, pose growing threats to biodiversity, community livelihoods, and public health across Africa. Yet, many early signals of these events appear first in wildlife, where formal surveillance systems are the weakest. Despite rangers and community scouts being the first to encounter unusual wildlife health events, their observations rarely reach veterinarians and public health authorities. This gap in early detection limits our ability to prevent outbreaks, protect endangered species, and strengthen One Health. Wildlife Health Watch is a community-driven surveillance platform that reduces the time between the detection of and response to wildlife health threats by connecting these frontline observations to public health decision-making. Wildlife Health Watch achieves this by leveraging the Earth Ranger platform to enable rangers to record wildlife mortalities and disease syndromes, and this is supported also by photographs, GPS coordinates, and decision prompts. Once entered, these reports feed into a centralized dashboard that is accessible to wildlife veterinarians, conservancy managers, and public health authorities as well. What this does is enable real-time mapping as well as rapid triage of events and coordinated cross-sector responses. The platform is also leveraging machine learning and AI to support the interpretation of data. Over time, this will generate long-term wildlife health baselines to guide conservation management and support the prediction of emerging risks. Wildlife Health Watch so far has been piloted across 20 conservancies and reserves in Kenya, and rangers have reported greater confidence in their ability to recognize and report animal health events, while the authorities have gained clearer visibility into wildlife health and disease events. It is scheduled to be handed over to the Kenya Wildlife Service in 2026, where it will function as their primary wildlife health monitoring platform. Earth Ranger, the platform that we use, is already in use in over 900 protected areas across the world. This includes, luckily for us, all Eastern African countries, as well as over 90% of the SADC countries, making Wildlife Health Watch perfectly positioned for scaling. Strategic partnerships and investments will enable us to reach people and wildlife in more ecosystems. This even includes marine wildlife. And this will help us deliver timely, high-quality wildlife health intelligence. We invite you to visit our booth on the furthest right, just outside this conference hall. Thank you very much.
Dr. Angwenyi, thank you so much. Congratulations on a great presentation, and of course, interesting insight that we continue to learn from many of our innovators. Our next innovator joining us to tell us more about farmers' hands, Mr. Jofet Njiru. Mr. Jofet Njiru joining us to tell us more. A round of applause, please, for Mr. Njiru. Happy for you to adjust your mic and get comfortable.
Good to go.
You can confirm you can see the timer?
Yes, I do.
Fantastic. Your 3 minutes starts now.
Good morning. All protocol observed. We are here talking about farming. I wear in two hats this morning, being a farmer and being an innovator. Our solution, as we have mentioned, or been mentioned, is a farmer's hand. Every farmer has two hands. But we have developed a software whereby a farmer is using another extra digital hand. This, our solution, is helping a farmer identify early disease detection, because every disease has its own incubation period. Our solution is able to detect early signs and symptoms of diseases from a cow, from a calf. Most of farmers doesn't understand that really our livestock really communicate, but our solution is able to explain and elaborate further on the communication of the animal. For instance, when it comes for a calf, how many times does a calf suckle her mother? The lest, the temperature, and above all, the eating and rumination. Most of our dairy farming and farmers don't know that every cow, whatever it eats, it must digest, and the movement of the rumination. Most of our dairy farmers, They are very stressed because we don't have much of the production. But the production is affected by not understanding what type of an animal are we having in our sheds or in our farms. But our solution is solving all those problems. Number one, understanding how long does your cow take feeding, sitting, and standing. All this technology was first introduced in Korea. Currently is now working in Nigeria, Uganda, and other countries. I urge each and every person in this place, the targeted person is the farmer. That unless we help the farmer, the innovation that we are having, the new techniques and the vaccines we are trying to introduce to help the farmer, I am a farmer, and I'm talking on the side of a farmer. Everybody in this house, we work together and we are going to win. And our solution is working and is able to transform our nation, which is Africa. And I conclude by saying, farmer's hand, it's an extra hand helping the farmer. Even if I'm here, you can work with your farm, whereby all the information is stored in your mobile phone. We have a platform whereby you can come and we can train you, and we expound more and train our farmers on how we can be able to protect diseases by early detection. Thank you so much, and be blessed. And our stance is on the first side of the first link. Thank you very much.
Thank you so much, Mr. Njiru. Farmers' Hands telling us more there about their innovative success and, of course, data and information sharing. I can imagine as a farmer, you're also familiar with the farmer's prayer when things get tough and, of course, navigating the business environment. We're joined now by our next innovator, Mr. Festus Zulu, who's going to tell us about data for nature and people. Can we warmly welcome Festus Zulu to the front of the stage, who'll join us to tell us more about their innovation. A warm round of applause, please, to Mr. Zulu. The podium is all yours. Excited to hear more about your innovation. Thank you. You can confirm you can see the timer? To your left-hand side, Mr. Zulu? Yeah, just to ensure you're comfortable. Great. You're ready?
Ready.
Your 3 minutes starts now.
The Nature Conservancy is working with people to foster new approaches conserving wildlife, habitat, and the people in Kafue National Park. This involves collecting and using data with national and local partners to inform our strategies. Through One Health approach, this information can be further used to enhance assessment of health risk, health assets, and inform our management options. TNC and partners would like to showcase how wildlife population monitoring and the landscape, even reporting systems such as Earth Ranger, are providing essential information for wildlife tracking and assessing human, animal, ecosystem health threat in the national parks and game management areas. Drawing on programs in Zambia and Kenya, we highlight work in 3 contexts of One Health action: health, animal-wildlife coexistence, monitoring the movement of elephant, cheetahs, and other species across their range and migration corridors to keep people and endangered wildlife safe, reduce risk of poaching, diseases, and livestock risk, and enhance crop protection measures. Sustainable fisheries, monitoring fish population, fish catches, to guide safeguarding fishing practices, to support community livelihood, access to high potential nutrition resources. Biodiversity and health connection, assess community health assets, including connection to biodiversity such as traditional medicine and water resources. These examples demonstrate a range of conservation and community-based data knowledge and workforces that can be integrated in One Health initiative to support health
and well-being outcome and around conservation areas. With national parks and game management areas spanning 30% of Zambia land area, there are ample opportunities for increasing data connectivity under One Health lens to guide solutions for biodiversity and people. To reach its full One Health potential, the capacity of One Health approach by users can be strengthened and information generated from the system can be integrated with data system. Thank you.
Thank you so much, Mr. Zulu. We'll allow you to squeeze in where your podium actually is, where your marquee or...
OSC standing number 6 behind here. Please visit us.
Fantastic. Thank you so much, Mr. Festus Zulu. I think we can add a little bit more energy than that. Thank you kindly. Appreciate your feedback and, of course, the appreciation and acknowledgement that for many of our entrepreneurs, this is really months and weeks of preparation and training to adequately communicate their innovations that they're sharing with us today. A reminder that you're more than welcome to interact and engage with them throughout the course of today. As we look at our program, time-wise, it is 54 minutes after 11, so we've got about 6 minutes before we hit midday. Just to give you clarity on the program and the structure that we're running with for the remainder of the day, we are aiming to have lunch for about an hour between 1 and 2 o'clock, or at least for 45 minutes between 1:15 and 2 p.m. In the meantime, we have 2 more panel discussions that we'd like to share with you, which really build up on the context of the themes that were highlighted earlier this morning. Our first panel discussion will fully look at the theme of scale and scalability. It came through as a question earlier today regarding the pandemic accord, and in previous conversations, it's quite clear that we want to address the concerns we have as a region, but we need to make sure that there's a clear understanding on how we move forward with a sense of unity, but also prioritize the levels of security and sovereignty where they matter. Coupled with that, we'll also then hear around success stories, stories that have truly made an impact across the continent and a region. How farmers have been positively impacted and developed, communities have changed, where capital has been adequately deployed, and there's tangible results and returns in terms of the outcomes there. So these are just 2 of the panels that we'd like to get through, so both of them will be between 35 minutes each. We'll do our best to have the moderators incorporate questions and answers. If not, we more than welcome you to interact with the various speakers when they are available after lunch. But before we get there, perhaps just a quick litmus test to see if we're all comfortable and if there are any key themes that you'd like to have addressed in just a moment before the conversations do take over. I'm aware that we've got roving mics on the table. Yesterday, I took over this part of the room on my right-hand side. Not too sure perhaps if I can explore on the left to gauge your thoughts. Everyone is avoiding eye contact today. It's as though you know. Well, I'll tell you what, we'll ensure that we do solicit your feedback a little after lunch, and that might be a way for you to be able to consolidate your thoughts before you share your feedback with us. Moving on to our next panel discussion, which will continue for the next 35 minutes. This is a key conversation that will be moderated and sharing expertise and insight from one of the members of the Quadripartite Alliance. We're going to hear feedback here as to how best it is that we fully unpack the issue of scale. Evidence-based solutions as to how we build scalability in health and sustainability. This conversation will be moderated by a very familiar face and voice to all of you. I'm making sure she's in the room, but Ms. Priska Mugabe is going to join us. Professor Priska Mugabe is going to join us as the host and, of course, president of PREZODE Africa and COHESA. As we warmly welcome her up and allow her the opportunity to also introduce her panelists, perhaps we can warmly give her another round of applause to ensure that she's comfortable. Thank you so much. The floor is yours, ma'am. You'll introduce your panel and, of course, guide us through the conversation.
Thank you very much. Good morning. So today, maybe I'll first I'll first invite our panel to the podium, and then we'll look at what we are going to be doing. May I invite Advocate Rachel Otu Amposta, please to come over. Thank you, Advocate. And another familiar face, Dr. Papasek from PREZODE. Advocate Rachel is from ACT Africa. Dr. Papasek from PREZODE, please. Yes, thank you very much. We have Dr. Masika Sophie from WFA, World Foundation for Animals, and then we have Dr. Mary Mbole Kariuki, another familiar face from AU IBA. We have Dr. Inocencio Chongo, One Health Coordinator from Mozambique. And then another great guy, Dr. Raymond Hamunga, One Health Coordinator from Zambia. Thank you very much, Dr. Raymond. So just to give you the context of why we are gathered here as a panel, the issue is that there is a wealth, there is already a wealth, a great wealth of knowledge that is accumulated in the field of One Health, both to better institutionalize One Health at regional, national, or subnational levels, and to operationalize One Health for the final diverse beneficiaries. Already we've heard about the issue of scale. However, it seems that this new knowledge, continuously accumulated knowledge, is not sufficiently reflected in the implementation of One Health. So we wonder why. In order to overcome this challenge, we need to explore success stories and opportunities and understand the gaps and barriers for the One Health approach at the science policy interface as well as at the grassroots levels. So our panelists today here with multi-level experience from One Health platforms, from regional institutions and initiatives, and from global initiatives, and more importantly, from community initiatives, will share their multi-scale experiences in order to shed a bit more light on this issue of saying why are we not taking up the diverse knowledge that we have into the implementation of One Health. So perhaps I'll go and sit and join with them. Not in the order of sitting. Can you hear me? Yes. Not in the order of sitting. I'll start with the success stories. We decided we want to share what makes us feel good first. So, Dr. Papa, in the context of One Health, how has the global PREZODE initiative developed successful applied framework for policy? You have 2 minutes.
Thank you very much.
Thank you. Yeah.
Thank you very much, Professor. I would like first to start by telling that from our side, PREZODE, we have managed to really move from silence to silence for silent to action. Our approach is based on the co-construction mechanism, and as we organize our initiative, you have governments, sanitary government, engaged government, we have 30, but also we have other members, which are university, research institute, but also NGO, representing the communities, etc. So PREZODE is bridging really the communities to the decision makers, and through different projects undergoing throughout the world. In Africa here, we have AFRICAM, but also in South Asia, we have ASIN and so on. So as I highlighted yesterday, We have we work here in this region with COHESA, but also we just launched Avika, which will be a very impactful program for this region. And I would like to hand this talk by saying that we are also working with global communities. PREZODE took a real role in the negotiation for the pandemic treaty, and we push behind to be able really to incorporate the One Health approach in the pandemic treaty. And so far, we are also involved in the IGWIC negotiation, which is pertaining the PAPS, Annex Pathogen Action and Benefit Sharing. And we are pushing behind also to be able really to make member states well aware about the need to incorporate the One Health approach in the PAPS Annex.
Thank you.
Over to you.
Thank you very much. Over to you, Dr. Inocencio. We've heard that PREZODE really focuses on core construction. So, Dr. Inocencio, can you share with us some successes you've had with One Health implementation in Mozambique?
Thank you. Good morning, everyone. First of all, I would like to thank this opportunity, and I would like to extend my greetings to the Excellence Minister of different African countries and the Permanent Secretariat. Mozambique, we do have a One Health platform, well organized, and it's working. I'm going to share it in the next panel. So let me focus on some of success story. In different success story that I have, I can take this outbreak response. We do have a One Health group that is taking care for outbreak response. Recently, on 23 October, the Minister of Agriculture was notified of any occurrence of a suspected outbreak of avian influenza. So immediately they contacted the One Health platform. So this One Health platform was able to put all the stakeholders on the same table, where we started to discuss the preparation to response for this outbreak, following our contingency plan for avian influenza. So we created a team that went to the field to visit the layers farmers, and from there we start to collect the samples using this joint group, animal health, human health. Unfortunately,
so if I get you right, are you then saying your platform then became the hub for coordination?
Yes.
Of the response?
Yes.
Thank you very
Our
much.
platform coordinated all the stakeholders and put all the stakeholders that were involved, the Minister of Health, Minister of Agriculture, and academia and research institutions.
Thank
so we
you.
started the response activity where we collected the samples, and we test the samples, so the samples were positive. And this is very important because even outside of country, we succeeded to contact other colleagues for the cross surveillance to understand the role of this suspected from South Africa. And we were able to put in contact the Minister of Agriculture and the Minister of Agriculture from Mozambique and from South Africa.
I would like to.
Yeah, thank you.
For us to, so, but what I hear most importantly is you need that coordination.
Yes.
You need that focal coordination in terms of response. Thank you very
Thank
much.
you so much.
And multi-sectoral center. We move over to Dr. Mary from AU IBA. From the African regional perspective, what would you say is the key catalyst to strengthening science policy interface in One Health?
Okay, so thank you. Is this working? I believe so. Okay, I hope you can hear me.
Yes.
All right. So first we recognize our distinguished ministers. Thank you so much for
sorry, just can we hear her? Are we okay?
Am I yeah?
Yeah, okay.
They can? Okay.
Yeah.
Thank you so much. So really from the regional perspective, allow me just to focus on what has been going on over and over and over. And if you listen keenly, there's only one key catalyst that can push the regional agenda forward in terms of One Health. And this is really value for data. You know, we keep on talking about data, but we don't talk about value for data. You can continually collect data, but if it means nothing to the end user, then we are really just wasting much of our resources, unfortunately. Data can speak differently. It speaks differently to a scientist, and it speaks totally differently to the farmer, and it speaks totally differently to the policymaker.
Yeah.
So one of the key catalysts for us is value for data, and we've been asking ourselves, why do scientists continue moving forward without really focusing on action research? Action research will inform value for data.
Yes.
Because you have a certain thing that you're moving towards, a certain target that you're moving towards that will change lives and as well as influence policy. So if we look at the science policy interface, if action for research is not triggered, then the policy interface, I mean, the move to policy will not be, you know, realized. And that really gives a big empty space for us. So this is the catalyst that we need to look at. And AU-IBA has really taken this very seriously by putting together an African Union Digital One Health platform.
Okay.
And this platform is an innovation that we are really saying, bring forth all your data wherever you're seated. And we have 3 different modules. First, data integration and sharing. We are not asking, you know, come and start all over again sharing data, but share data. What do you have? What can it inform? Then build capacities. Can we build capacities in terms of data analytics, looking at predictions, looking at disease risk analysis, something that will make value? And then the decision situation room for our ministers, really driving an agenda that will inform them in a very simple and basic way. That will be the catalyst that will bring change in the science and policy.
I really like your emphasis on value for data. We have to be purposeful.
Absolutely.
But we are also innovating in terms of how to make this digitally possible. Thank you very much. Dr. Masika, from your extensive experience, including the crafting of the pandemic agreement, very global, what would you say are the opportunities presented at this global scale for One Health institutionalization and operationalization at the science policy interface? Thank you, Doc.
Thank you so much, Prof. I hope I'm audible, yes. So from the pandemic agreement, and I think Papa Sek has already mentioned the work that we did for the last 3 years to ensure that One Health is integrated as an article, as a standalone article within the pandemic agreement. So I look at this as one of the biggest success of global health in the last few years. And this is because One Health is now incorporated in a legally binding instrument. A treaty is a legally binding agreement between member states, and member states have to, within the accountability mechanisms, implement this. So that means member states, when they're developing their pandemic prevention plans, they have to do it with a One Health approach. I think that's a really huge success for One Health. And in terms of the opportunities, and before I mention opportunities, it was a very uphill task to incorporate One Health as a standalone article within the pandemic agreement, and we'll talk about why. It's not for lack of knowledge of the importance of One Health. There are many other political things around it. In terms of opportunities, and let me ride on what my colleague said yesterday, the 4 pillars of One Health. For implementation of global policies, the implementation is at the national level. So it is up to national governments to determine how they want to implement their national action plans on pandemic prevention with One Health in a way that fits their national context. So what does coordination look like in Liberia, for instance? It's different from how it looks like in Kenya. What does communication, what is the best form of communication in Eswatini? What is the best form of collaboration in Egypt? What does capacity building mean for a different country in a different part of Africa? So global policies still hand back the mandate to national governments to do it in a way that benefits their people most within their own national context, I would say, is the greatest opportunity.
Thank you. I hear you saying one of the things that really mattered for you was that binding instrument for commitment and accountability. But however, you also talk about contextualizing even the elements of One Health implementation, the coordination, collaboration, they still have to be contextualized. Thank you very much. Finally, Dr. Rachel from ACT Africa. Advocates. This one is an advocate. So what successes would you want to share with us in One Health institutionalization and operationalization from local communities' perspective?
Okay, thank you very much. And I'm standing on already existing protocols. So I work with the African Coalition on TB, where we work with grassroots, local leaders, communities. What we do is that we work through country partners, and as the name says, African Coalition, meaning that we are all over Africa. Now, I cannot talk about the success without talking about a project we implemented that was supported by the Global Fund, and it was basically on community engagement in pandemic preparedness and response. And so what this project sought to do was basically to provide knowledge to the grassroots, to communities, to last mile populations on the various platforms that exist at the country level, at their national level. We worked in 5 African countries at their national levels around pandemic preparedness and response, and how they can come up with advocacy agendas or advocacy themes to ensure that they are not being left behind in these conversations. And so the success story is that out of these PPR, pandemic preparedness and response trainings that we did by providing tools and resources to the communities at the local level, in Taraba, in the northern part of Nigeria, there was an incident around Lassa fever, and I think one of the innovators from Liberia spoke around it, which was basically around rats and consumption of rats and all that. So it was through our country partner, who is also based in the northern part of Nigeria, who was able to bring together the various resources, the various people on board to ensure that training is had in various local dialects for these communities, local leaders, and also to provide jingles like knowledge sharing in local languages, and this was circulated around. And so before the intervention from our country partners, they had recorded like 20 deaths, but afterwards they recorded no death. And so that is our greatest success from this implementation.
Thank you. I hear you emphasizing the importance of knowledge sharing, appropriate knowledge sharing. But we'll come back to you later, because knowledge, what is it? How does that relate to their own local knowledge? So perhaps for the next round we can address that one. Now we want to move to the barriers and gaps that confront us as we try to operationalize One Health, starting with Dr. Raymond. As a national coordinator of the One Health platform in Zambia, what barriers to One Health institutionalization and operationalization have you encountered? I just want to pull your leg, because we had an example. you were made a case example yesterday. So what barriers have you encountered? Yeah.
Thank you very much. Allow me, Priska, to ride on the protocol already established by my colleagues and recognize our dignitaries. When we talk about some of the things that are serving as barriers for us to operationalize and institutionalize One Health, in summary, I can think of 2 things. The first one is that it's an inherent design problem that we have as various sectors and ministries. Ministries were designed specifically to oversee specific mandates. And those mandates, they had the responsibility to ensure that it's executed, as well as if everything goes wrong, it falls back on them. So this was a good thing initially. I think all governments started like that. But due to the increase in urbanization, globalization, you can be here today, Priska, tomorrow you're probably having your dinner in Doha. It means that this end user, the service provider, has to access the various mandates of the various line ministries across the country and also across the globe at the same time. Unfortunately, I think we're playing catch-up. Our legislation is also playing catch-up, which is the second issue. Our legislation is also streamlined in a way that it looks at us as saying, this is a mandate for fisheries and livestock or in agriculture, and therefore they're responsible for it. But the increased interconnectedness of the world we live in right now demands that our legislation needs to speak to one another.
Thank you very much.
Yeah.
You avoided the word silo, but I kind of hear it because we believe in who we are primarily. We move over to Mary. At the Africa regional level, how do One Health implementation barriers present themselves?
Okay, thank you, Prof. I think it's really what it spells down to the national level. I mean, we leverage on the national level and then we move upwards. And if there is no coordination because of that silo mentality, then that trickles over to the continental level.
Yeah.
So I think one of the key barriers is a lack of regional coordination, especially cross-border coordination.
Yeah.
So when we get up to the continental level, cross-border coordination is struggling. And if you look at even the governance structures, I think we have a One Health strategy for SADC. We also have the ESC, and ECOWAS has done one. And now the African Union did put together something with Africa CDC and AU-IBA, the African Union One Health Zoonotic Diseases strategy for prevention and control. So that is good. We are trying to bring things together, but we are not coordinated.
Okay.
But when you look at it from the science and policy arm, it is clearly a drive of the lack of co-creation.
Okay.
As long as we are not co-creating, we will never be able to push the implementation or institutionalization of One Health, because science drives what needs to be done, the interventions that need to be done. So the lack of co-creation, being more donor-driven, or this is a challenge. And allow me, Prof, if I may, you know, the pandemic fund really has given us a good foundation. They keep asking, what are the needs of the country? You go to the PVS, you go to the JE, and you give particular clear direction, not what we think or what we perceive, and that has really helped.
We need to really be able to articulate those needs. Thank you very much. Dr. Masika, what are your reflections on the peculiarities of One Health implementation barriers presented by such important agreements as the pandemic? What's peculiar? What peculiar barriers do you encounter at that level?
Thank you, Prof. I would like to highlight that when we are formulating global policies, the idea is that they provide a level of guidance to the regional level and the national level. It's more like a lighthouse. The global policy provides a lighthouse, and with the lighthouse analogy, the idea is to ensure that as many people as possible are able to spot the light in whichever direction, in whichever height of on the ground, whether they're on a skyscraper or within a savanna forest, they should be able to see the direction and follow that direction from a global perspective. But with One Health in mind, the sheer diversity that we have as a continent, yes, and looking at it from a global perspective, it's really, really difficult to compress all this diversity into one global direction, and that is what we faced during the pandemic agreement. And that brings me to the second point, or the second barrier, trust. We worked in an environment where there was complete mistrust between countries, between regions, given the historical injustice during COVID-19 with vaccines. So the geopolitical divide between the North and the South created an environment where there was a lot of pretense, there was a lot of underlying nuances behind the texts that are being proposed. Most of the time, there was nationalism rather than multilateralism, which is supposed to guide global health issues or global health policies. And we did struggle with that a lot, to bring parties together to look at this as a global problem rather than an individual problem.
Yeah, I think it's very sobering when you present those to us, because sometimes we seem to romanticize these global issues, but you're saying you are a lighthouse, you want to provide that lighthouse, but is there enough trust? And should we really be glossing over the diversities. So thank you very much for bringing that. In this round, the last one to comment on barriers would be Advocate Mary.
Rachel.
Oh, did I repeat? Sorry, yes, it's Rachel. I have Rachel here. How can we leverage on indigenous knowledge in relation to these barriers?
I think that at the community level, local level, they do their things differently. And usually they are not even aware that these coordinating platforms exist. And we cannot move with One Health without the community, without the locals.
Yeah.
Because if anything should happen around One Health, around animals, it usually happens at the local level because they are also keeping poultry at the local level. So I think the only way out is to create awareness, to sensitize them, to build their knowledge, to build their capacity so that they are aware. And even those who are aware, the coordinating platforms are defunct or are not working, or for some reason they are working but communities are not involved.
So would you say then we have a barrier in terms of connecting to those local systems, local indigenous systems?
Definitely we do have a barrier. And the only way to break the barrier is to get a representative who is part of the locals to be as a liaison between the nationals and then the locals.
So perhaps speaking towards co-design even and co-creation with the communities. Thank you very much. We've had quite a lot in terms of opportunities of success stories. We want to quickly now go through each of our panelists, and please, as we conclude this discussion, I'll give you 1 minute to share one lesson that you have learned either at the science policy interface or at the One Health operationalization level. I'll start with the advocate. I think advocates, you are familiar with time, or you lose your case. So,
okay. So I'll say that One Health succeeds only when communities stop being beneficiaries and start being co-creators. Thank you.
Thank you very much. Over to you, Dr. Papa. Yeah.
Yes. I would like to say that evidence only becomes impactful when it is co-produced with those who must act on it. What does it mean? It means that we need to have scientists, researchers, policies, but also communities join together and work and build the co-construct together to be able really to be very impactful for everyone.
So you also emphasize on co-production.
Yeah.
Yes, Dr. Masika?
Thank you. It's hard to do this in 1 minute. I will try.
Yeah.
So for me, from the global policy perspective, my takeaway is that technical expertise alone does not shift positions, because during the pandemic agreement, we all knew what pandemic prevention is. We all knew what One Health is, but the negotiation was based on political advantage and disadvantage. So for Africa, it is important that we put forward technical expertise, but also diplomacy in the same process, because diplomacy is what brings coalitions together. Yeah. It's what builds bridges, and it's what ensures Africa is positioned in a strategic way, but not isolated.
Thank you very much. Yes. Now I'm getting my
Mary.
Dr. Mary from AU.
Yeah, thank
yes.
you, Prof. Yeah,
yes.
We are many here. All right. So I think I'll just leverage on what I said earlier. You know, just science for diplomacy is what really needs to drive the agenda. We need just to sit in the space that we can speak to each other in a way that can build systems that will really change the avenue, especially the space of One Health. And if you look at COVID-19, that's what played the game. That's what made the interventions work, because there was a lot of trust, there was a lot of cross-talking, there's a lot of science. You know, South Africa put themselves on the spot by bringing out Omicron and saying there's something going on, which was based on their science. So this is really good for One Health. AMR issues need to be looked into, climate change issues need to be looked into, and all. So that's what we need to do. But also community engagement, very critical and core. Thank you.
Thank you very much. Being Africa, she's very rich. So, Dr. Inocencio, what
Thank-
do you have to share with us in terms of one critical lesson that you've learned?
Thank you so much. I think that to implement One Health, as One Health we can define it in one word as a synergy, we need a real leadership that will take a place as a champion, because you are dealing with different stakeholders. And finally, we have to involve all the stakeholders from all the levels, from the planning to the implementation. Because the big mistake that we used to have, we are involving people in implementation without involving them in planning. Thank you.
Thank you very much. Finally, Dr. Raymond, one key lesson that you think you've learned.
Thank you. And I'll carry over all the leftover minutes from the previous speakers. Yeah, thank you very much, Priska. I think we need to start by sometimes take a step back and acknowledge where we're coming from. I think before, just a few years back, it was very impossible to have agriculturists, mining people sitting in the same room with doctors, with vets. I think let's take a time to step back.
And rangeland ecologists.
And rangeland ecologists. There's even a push for soil health now. Okay. So I think one thing I'm taking away from these conversations is that really we are living in an incredibly complex world, and everyone has a role to play. We need to come back and learn what is the critical role that each stakeholder has, respect it, and see how that integrates for the well-being of the planet. Thank you.
Thank you very much. Yes, I think I can just give each one of you just like 15 seconds if there's anything that you think wasn't heard that you really wanted to say before we give our concluding remarks. Advocate.
Well, as a network, African Coalition Network that works with the grassroots, if there are any, I think it would be great to have collaborations since we have a lot of stakeholders in the room. So I'll be at the back there for further partnerships.
She's open for more collaborations. Papa, any?
Yes, just want to say that PREZODE is not only in Africa, in Asia, we are also in Europe.
Yeah.
And the Belgian PREZODE working group is giving very important recommendation to the state to based on their studies on the interface human-animal and environment interface to include One Health approach in the national strategy to be able to tackle emerging and infectious disease. Thank you.
So PREZODE is in all the regions of the world. So please visit the website. Yes. Dr. Masika.
I would like to acknowledge the efforts that Africa CDC has played with the pandemic agreement.
Yes.
They did bring together all the health ministers from the African continent to develop an Africa position and continuously shifted that position depending on how the negotiations are going. And that really highlights the importance of our regional bodies in international agreements.
Kudos to our leading partners. Yes. Dr. Mary?
Yeah, Prof, thank you. I think for me it's really just to advocate more and create more awareness for the animal health sector. And I really want to speak to Illumina, just seeing that we can also sit in that space of genome sequencing for the animal issues. This will really be good so that it can also speak to what is going on with the Africa CDC.
Yeah.
That collaboration needs to be really driven forward in a very strong way. So I just commend, that kind of collaboration.
And I like the Elias
animals.
session earlier that said, why should we be sequencing separately?
Exactly.
Shouldn't we bring everything together?
Exactly.
Dr. In a sense,
yes. Sorry. We should have an African Union genomic database.
Exactly.
That is for One Health.
Thank you very
Completely
much.
clear, yeah.
Innocencio, I'm scared of you. You've got like 10 seconds.
Okay, fine, no problem. No, I would like to thank and COHESA and the different organizations for changing their mind now, going for action. The project is to bring the solution. So it's what I would like to thank and to invite other institutions, not thinking only producing problems.
Yeah.
We have to take the problems and bring the solutions. Thank you.
So we are mindful and grateful for those partners who come and help us to facilitate our coming together. Finally, Dr. Raymond.
Thank you very much, Priska. For me, the last thing I'd like to add to the conversations and submissions is maybe to recognize our leadership that's present here, because ultimately, all this falls on our political will. And I think it's very gratifying to have representation of our leaders, and I feel we feel like we do have ambassadors and champions who will be able to have these conversations on our behalf in rooms that we cannot access. So that should be one thing that we need to ride on, I think, as technocrats. Thank you.
Yes, there are rooms that we can't go enter. Only you can enter, so we are relying on you. Ladies and gentlemen, I had something very important in this session, issue of co-creation, co-production, not just technical alone. Look at the political and also diplomacy. And science diplomacy is emphasized. So finally, just to share the thoughts that we had in terms of the lessons that we are carrying forward from this panel and beyond, the issue of education is very important and a key fundamental factor for all actors. You have a diversity of actors at diverse levels. So let's emphasize on advocacy. And also, the integrative and holistic One Health approach offers opportunities to bridge the gaps and strengthen linkages. And finally, One Health operationalization should be co-designed across scientific and indigenous knowledge systems, but as we had, even across the political, science, society interfaces, we need that bringing together of the knowledge systems. Thank you very much. Let's thank our wonderful panel for a very rich discussion. And yes, ma'am, we are done. Thank you very much.
Am I audible? There we are. A round of applause, please, for all the panelists who have given us some insight. I must say, building up on so many of the themes that you've highlighted, Dr. Mugabe, there are so many areas of interconnectedness. And this panel really brought to life an understanding as to how it is that we ensure that we build the levels of sustainability that we require. If there's anything from today's session so far, I think it's quite clear that next year and in the years to come, we need to invite more people into the room. From the finance ministers, the innovators when it comes to fiscal policy, those who are at the front line of ensuring that we have the appropriate security and safety and protocol within our atmospheres and spaces, but also the innovators, those who control the data centers that we keep so much of our data in, controlling systems and processes to make sure that fundamentally we are aligned with the strategies that we need to deploy. And coupled with that, we also need to make sure that we invite more of colleagues in the media industry. I say this deliberately because as we were hearing the conversation around storytelling and perhaps to highlight the next panel discussion we're going into, the only way we can truly amplify the knowledge of One Health is to share the outcomes with the rest of the world. And whether that's the story of rangers who are at the front line of making sure that rhino poaching is no longer a threat to our ecosystems. Maybe that might be speaking to the veterinarians to understand where there might be a correlation between any kind of waterborne diseases, the impact it might have on our livestock, on our poultry, and even further down the consumer value chain. Whether that's understanding the latest technologies and solutions that are implemented to make sure that there's consumer awareness, industry awareness, transparency and disclosure around the innovations that we implement, or even just understanding how government leaders, through their policies and institutions, are helping to mobilize the capital that we require. We need to share these stories by having more of you on the front line and more of us. Let me include myself there because I'd like to believe I'm one of you now. Might not have a PhD in veterinary science, but I think I make a great intern. And that's what we do need to amplify. Our next panel discussion comes to this particular conclusion in terms of measuring stories of impact. And this does allow us to have some speakers who will give us some insight into just how exactly, through their initiatives, through their work on the ground, through the organizations that they're aligned with, they're able to amplify the details, the sharing of academic research and data whether into genomics, whether understanding the impact that we have on the ground, the solutions that are brought to the fore, or even the capital that's being unlocked. And that very same capital does need to be dispersed in favorable terms to ensure that it doesn't drag down the growth of the economies we talk to. Speaking of that growth, we want to build wealth, as was eloquently put in an earlier panel discussion. But for this particular session, we'll have a few panelists join us on board. They're going to participate in conversation for 35 to 40 minutes. They'll incorporate a Q&A in this particular session, and we strongly encourage you to participate and share your thoughts and your views. I will introduce our panel moderator on stage, and she will introduce our panelists who will then be joining us in conversation. I'd like us to give a warm round of applause as we prepare to hear some insight into making sure that we have One Health in action. We share the journey going forward. We monitor and measure the output as well as progress. I'd like to welcome the moderator for this particular conversation, who is a senior expert, senior livestock specialist at the World Bank Group, joining us in conversation, and will from there introduce her panelists. Ms. Laurie Weber-Wenzel, who's joining us on stage, senior livestock specialist at the World Bank Group. A warm round of applause for her, please.
Thank you, Madam MC. Your Excellencies, dear colleagues, a very good afternoon, because I believe we reached the afternoon. It's a huge honor for me to be here with you in Zambia today, to be joining this amazing gathering of One Health champions. But it's also a pleasure to moderate this special session. Special in many sense, but mainly because I'm a very practical person, and I do believe, or I feel inspired when I hear new stories, concrete stories, good examples of things that have happened. They may be successful, they may not be. That's not a big deal, but we get to learn how things can work. In these 2 days, or 1 day and a half, we have explored challenges, solutions. We have discovered amazing innovations. We have basically enriched our knowledge of what can be done with One Health, or to operationalize One Health. And all this is adding up to all the information, tools, evidences we had already collected, developed over the past years and decades. And I don't know for you, but after 1 day and a half, it's a bit overwhelming. And thank you very much for the organizer to keep the coffee coming. It really helped staying focused and not losing anything from the presentation. But this to be said, as the idiom says, reality may be sometimes too complex. And a good story can help finding it a shape. So I think it's the reason why we have this session today, trying to hear about this example, to learn from these examples, because sometimes we just need to know how. How can I do this? How can I implement One Health? We have heard a lot of good innovations, good techniques, but how can I concretely do it? And how can I use these different examples and try to see if and how they can be adjusted in my situation, in your context. So before welcoming on the stage our fourth storyteller, I would like just to say that I mentioned earlier that I feel inspired when I hear good stories, but it's not only about inspiration. Good stories are also an amazing tool for advocacy, for communication, because we do all love a good story. So with this, please help me welcoming our fourth storyteller. So first, we will have Dr. Shaline Angweni. You have already seen her presenting her innovation on Wildlife Health Watch. She's a Kenyan wildlife vet and National Geographic explorer, working closely with rangers and communities to improve real-time wildlife disease reporting. Thank you. We will also welcome Joseph Chizimu. He's the National Antimicrobial Resistance Coordinator for Zambia, where he leads the country's multisectoral response to AMR, Welcome, Dr. Joseph Chizimu. Our third storyteller will be Shara Mangesha. She's a component leader and implementation manager at GIZ, both in Germany and in the African Union. She leads and coordinates teams collaborating on and implementing activities on pandemic prevention, preparedness and response, and One Health governance with partners at all levels, global, regional and national. And our last storyteller, will be Dr. Magrecia Oziku. She's the Chief Veterinary under the Directorate of Veterinary Services of Namibia. She serves as the One Health focal person at the Ministry of Agriculture, Fisheries, Water, and Land Reform. So, this is story time, I guess. We will start with you, Dr. Shalin. You will share a story to show how empowering frontline observers with simple digital tools can transform early warning systems at the wildlife, livestock, and human interface. Thank you. The floor is yours.
Check, there we go. All right. Thank you very much for the opportunity. Really excited about this session. I'll start my story with a story. So, a couple of months ago, I was invited to assist in a clinical intervention in treating a rhino that was injured. Cool photos, and you can't tell me I don't have the coolest job in the world. After doing the treatment on the animal, it had just been seen limping for a while, and the rangers who were in charge of the area that this rhino was in, one of them decided that he needed to speak up during the debrief that we were having after the treatment. And what he said stayed with me. He said that the way he takes care of those rhinos and all the other wildlife in his areas is the same way he cares for his family back home, his children, his wife, his livestock. That's what the wildlife that he takes care of means to him. And this reminded me one important thing, that the wildlife is not just there for the rangers to monitor. They genuinely care about the species. Yet, most of the time, their observations are rarely connected to wider public health decisions and actions, as well as the veterinarians who need to take care of this wildlife. He expressed his happiness in the fact that he was able to report what was happening on the ground and that there was an actual response to his report. Across Africa, not just in Kenya, where I come from, wildlife is monitored on the daily by wildlife rangers, as well as community scouts, and they know the land better than anyone else. They understand when something is wrong in their ecosystems. However, as I just mentioned, their observations are rarely connected to wider decision making. And this is the gap that the Wildlife Health Watch is trying to fill. So we train the rangers to be able to, one, identify and recognize the disease syndromes specifically, and be able to report this to public health decision makers and wildlife veterinarians in the different areas that we practice, because who knows the land better than they do. We use the Earth Ranger platform that's used across the world in over 900 sites, and this ensures that the data that would have gone undocumented is now being visible and actionable across the different landscapes that the wildlife exist in. Once the rangers input their reports on the Earth Ranger platform, it's easy to visualize on a dashboard. And this enables the various decision makers, the wildlife veterinarians, the conservation managers, to be able to, one, visualize what's happening on a landscape level, but on top of that, they can do real-time mapping of disease risks, understand emerging disease syndromes, as well as now prevent outbreaks and ensure that we're protecting our endangered species, our communities, the community livelihoods, and the people and general ecosystems that are in these areas. So wildlife is an important part of these rangers' lives because the health of this wildlife is intertwined with their livelihoods, with tourism, with livestock, as well as zoonotic disease risks. We have piloted this in Kenya in about 20 conservancies across the different landscapes that we have, and the impact has been profound. The rangers have reported that they are now more confident in reporting and identifying disease syndromes, not just in wildlife, but they're able to take this back home to their livestock and ensure that they're doing what they can to prevent diseases occurring at the interface of wildlife and humans and the livestock. Additionally, this has not just transformed how we're doing disease surveillance, it has also transformed me. So I came into this field as a clinical wildlife veterinarian, as introverted as can be, hoping for a career that will make sure I deal with as few people as possible. However, now I have to say that my greatest joys are definitely standing in front of all these rangers for hours at a time, training them, sharing knowledge, and making sure that we are all on the same page when it comes to the health of our ecosystems and our lands. Now we are trying to make sure that we can push and scale what we're doing in Kenya across not just Kenya, but Africa and even the global world. We're trying to make sure that the vets and the conservation teams on the ground are gaining visibility into the different disease syndromes and health events that are happening across their landscapes. Ensuring that the reports that are coming in are informing the conservation management activities that are happening across the different landscapes and enabling us all to understand and recognize what's happening with our wildlife across our different areas. Perhaps we should also think about how we're stretching this out to marine wildlife, a topic that most of us may not be too experienced in, but definitely a direction that we should be able to take. As we are expanding this, the one thing that stays true is the people who are closest to the wildlife are the key to ensuring that One Health is sustainable and being carried forward. And the people who are able to support this provide the tools and the systems for the observations at the front line to have impact and spark action at the people in this very room. So as Wildlife Health Watch, we are ensuring that we are impacting One Health by creating awareness with the people on the ground. And even more importantly, we are building and strengthening One Health from the ground up. Thank you.
Thank you very much, Dr. Shaleen, to be the driver of such a change, including your personal growth. What I kept from your presentation, a lot of things, including good pictures, but how you have been managed to create a connection between the local actors and the decision makers, and I think that is pretty amazing. So this is at the end just a tool, but this is achieving a lot of things. It's a multi-purpose tool, but it's quite an interesting story indeed. Thank you. Dr. Joseph, I think you will be sharing a story about how Zambia successfully introduced antimicrobial stewardship in lower level health facilities, and by doing so demonstrating that impactful and sustainable EMR solutions are achievable even in resource limited settings. So we had a lot of discussion about finance, how to get finance, but I think what you will share is interesting on the fact that even with limited resources, you can achieve a lot. The floor is yours.
Thank you so much. Allow me just to ride on the protocols already observed. I'll be speaking on integrating antimicrobial stewardship programs in the health facilities. As you know, when you are reading literature, you find that these are things which have been implemented in the Western world. So you wonder, can this be a reality in a country like Zambia? So with support from ICAS, we introduced 2 programs, one in the human health, 2 in the animal health. In the human health, we are looking at the bloodstream infections and also the urinary tract infections specifically, because these are the infections, common infections, where we abuse these antimicrobials a lot. Then in the animal health, we were looking at specifically at poultry, and we are putting in interventions through the farmer field schools. While the program on the human health is complete, we are still implementing the program in the on the animal health sector. We have done the baseline and we have done the activities. We are yet to do the end line. So for this discussion specifically, I'm talking more on the human health sector. So from the national side, we developed the National Action Plan, which we have been implementing. We developed the standard treatment guidelines. We ensure that the governance system is well established. But when we look at the way we are treating our patients in facilities, this was still a challenge. We are still abusing or misusing these antimicrobials, especially for these 2 common infections I've mentioned. So what we did, we said, let's try to pilot antimicrobial stewardship program in these facilities, 2 tertiary facilities, to be supported also by the lower facilities. We used the hub and spoke model to ensure that these bigger facilities support the lower facilities in terms of capacity building, in terms of other interventions which they need, these lower facilities which they are unable to implement. Then from the implementation of these activities, we had several activities we were implementing in these facilities. We realized that there was reduction in terms of polypharmacy. Instead of finding patients where we are finding a patient on maybe 3 or 4 drugs, there was improvement. The clinicians were able to stick to the standard treatment guidelines in these facilities. And then we realized that in terms of when you look at our standard treatment guidelines, initially you find that most of the clinicians, they will just treat their patients based on what they think like, or based on what they read somewhere else without using the local or the facility-developed treatment guidelines. But after this program, we saw that most of our clinicians were sticking to the local or national treatment guidelines. So this demonstrated that antimicrobial stewardship is achievable and sustainable even in a country like Zambia. So what we have planned now is to scale up this. Let's move from these 6 facilities to more facilities so that we can promote the quality of care which we are giving to our patients. So what began as a demonstration project is now transforming into a nationwide vision to ensure that our patients across the country are receiving the quality of care. Thank you so much.
Thank you very much, Dr. Joseph. I have just a brief questions before moving to the next storyteller. What, in your opinion, what made the success of this approach, this stewardship, and what will be the main element you will keep when implementing this to animal health sector?
So when we did our baseline assessment, the key things which came out were leadership commitment. Leadership commitment and also in terms of infrastructure challenges which are there. So during our implementation, we ensure that there was full involvement of the facility leadership, the provincial leadership. Because we made sure that they built the ownership of this program and they were able to support the junior facilities, they were able to support the junior officers when they're implementing these activities. And so when we look at the animal health, you find that the people who are actually implementing these activities in lower facilities, most of them, even the trainings, are the ones we expose to these trainings. But we need the leadership also in the animal health sector to ensure that they are fully aware of the actual programs which are going on in the ground, on the ground. Once they are fully aware of that, they'll be able to support that program, and the program will be a success. So leadership commitment, leadership involvement is key in this program implementation. Thank you.
Thank you very much. So I guess we are lucky to have some leaders with us today. Let's go to our third storyteller, Sarah. Sarah, your story is about food safety in Cameroon, showcasing the importance of context-specific, community-level engagements for change in a One Health spirit. The floor is yours.
Great, thank you so much. Allow me to stay seated maybe, if this is okay for everyone.
As you prefer.
Great. Great. Good afternoon, everyone. I stand on all protocols. I bring a story from Cameroon, where we have been working together with our colleagues and partners on different topics and also focusing on livestock markets. This is where this picture is coming from. However, I want to bring you a story specifically on food safety and how we contributed and worked together to come to behavior change on markets. So I want to talk about something very tangible for all of us, which is food and markets. We heard it also yesterday. Markets are central to daily life of many of us and people we interact with, but they are also crucial One Health contact points and interfaces that have a variety of challenges. So together with our colleagues from the National One Health platform, we started discussing the challenges that they faced, that they heard about, and this is where food safety came up. So we had a solid foundation in the country. There is the National One Health platform established, a One Health action plan, and we built on that, of course. And additionally, we supported then the country to translate the One Health Joint Plan of Action to the national context and extend on those priorities under food safety as well. So we had a good ground, and then we thought, good, now what do we do? What do we focus on? And we had a round of conversations with stakeholders, heard their stories, and thought, okay, let's look at food safety behavior change related aspects on markets. And we wanted this to be community driven. So we did what would you think we did? We invited them to play. And what we did with that is we, in a collaborative approach with the stakeholders and the markets, we designed a gamification model called the Quality Challenge. And the Quality Challenge was based on an experience the country had already in health facilities. So we used that model and adapted it to markets. And how that looked like was that we leveraged on the existing structures that existed on markets, for example, hygiene focal points, as well as local municipalities that were there managing the markets. And together with them, we established or we expanded on their multi-sectoral committees. So we then implemented this further and developed the model design for these markets. We selected the markets, we invited vendors to team up, and different categories of vendors then basically represented their market in a competition. So we invited them to look at their own challenges they faced after having received from local NGOs that were already in the market sensitization materials and information. So they looked at their own challenges and they came up with their own improvement plans. And they were guided by a technical committee that was already in place in the markets, as well as coaching teams. So a lot has happened. This really went beyond what we expected. So there was a lot of creative approaches on how to reorganize the markets and how to involve other actors who would previously not talk to each other, different vendors. So they came up with color codes for different products. They systematically organized waste management. They expanded access to safe water. They had little cards that they distributed amongst each other to understand who is where and who has which resources. So this was a proper scramble, which we appreciated a lot. And what happened is, out of this, we had different rounds of criteria assessments. What happened is, we were able to see significant improvements in best practices or good practices for hygiene, as well as food safety measures. And you can see this in an example here, where one of our colleagues who participated in the competition, her name is Fanta, she rearranged her whole stand, and this she did in a collaborative approach with vendors around her. So we saw that through this competition, first of all, a lot of creativity was able to be used, and the vendors amongst each other were able to engage no matter which products they were selling, on a joint approach. And this really helped to reshape many of the market's sections, even those that were not part of the competition, actually. So that was a really nice thing to see. We did this together, like I said, with the National One Health platform, as well as their sub-national structures that were on the markets, as well as 2 local NGOs that were already engaged in One Health topics. And I think this collaboration was really great to see. If you give communities the space to engage, they will do that. And they, as we also heard many times, and I don't think I need to stress this in this room, but we always need to be mindful, of course, if those people who are closest to the risk are given the space, they will come up with a solution that works best for them. And I think this is what we saw here very well. Thank you.
Thank you very much, Sarah. This is really inspiring to see how a game, how creativity can bring such a change. It's clearly much more fun than the HACCP method. So thank you for sharing this with us. Well, I take note as well that it was not only the game, there were strong foundations in the country, but still, that was really driving a change. So thank you for sharing. Dr. Magrecia, this is now your turn. You will share a story on the use of One Health approach, or basically the operationalization on One Health, on rabies and transboundary animal disease. Thank you.
Thank you. Thank you once again for having me back on this prestigious platform. I'm honored to present the success story of Namibia's implementation of the rabies elimination program using the One Health intervention. Okay, so rabies is endemic in Namibia, and the hotspot areas were identified in the northern communal areas of the country. And prior to the implementation of this project, there was the cases or reported positive and high mortality cases in both humans and animals were very marked. And this led to Namibia developing a national rabies control strategy, which was endorsed by the minister and signed by the Minister of Agriculture, Environment, as well as Health. So the interventions that really helped with the success of this project included mass dog vaccination campaign. Through collaborating with the Ministry of Education, we were able to conduct mass vaccinations during school holidays. We usually target school holidays, although it's ongoing throughout the year. What we also do as a directorate is to target and combine these vaccinations with the annual vaccinations in cattle against foot and mouth disease and contagious bovine pleural pneumonia. We also managed to secure support with getting oral rabies vaccine, and this was given to feral or very aggressive animals, or dogs rather. And we were able to track our vaccination campaign progress by using mobile phone technology. And this would give us real-life visualization of the vaccination coverage, where we need to prioritize, or areas where we need to target, type of animals that we are vaccinating species-wise, gender, etc. And it really helped us to track progress. So another key intervention with the rabies project was through capacity building and community engagement. This was very instrumental in ensuring that key role players were capacitated when it came to disease surveillance, laboratory capacity, enhancements, as well as being able to report on the disease. So medical professionals, as well as veterinarians, community health workers, and so forth were trained to be able to facilitate and ensure that we have a good system, a reporting system that's functional. What we also made sure was to engage the community leaders and traditional authorities. This was really just to ensure that they take ownership of this project, and these were stewards of ensuring that the community would participate when we would conduct mass vaccination campaigns. We also ensured that we continue annually and we target school with education awareness programs. And what we also did was to ensure that we train the principals and life skill teachers. We covered about 90% of the schools in the northern communal areas. These were trained in the rabies protection and prevention protocol. We have a manual that we've developed, and how to recognize the disease, how to respond, when an animal has bitten them, how to recognize and make sure that this training is also carried and implemented at various schools. So what we made sure was the training of trainers or training of teachers. We always ensure to target a specific number of schools. And what we also make sure is we actually select what we refer to as rabies ambassadors in the learners, and they really facilitate and make sure that there is good participation when it comes to these vaccine programs. Because of these interventions, we were able to witness a marked decrease in dog-mediated rabies in the northern communal areas. So what started out as a red sea of positive cases gradually declined in the positive cases of dog-mediated rabies in both humans and animals. And what we can witness today is really a marked reduction of rabies reported in both humans and animals. Here we can also just appreciate over the span of time how the positive cases in animals had reduced with the vaccination campaigns and interventions that were employed. And what we can really appreciate from this is the reduction in human deaths. So the deaths that were reported as high as 23 in 2015 has reduced remarkably to a death case that was reported only 1 in human. And that to us is a success. It's a 96% reduction in human deaths due to dog-mediated rabies. And what we can also appreciate here is that since the project started, over 800,000 dogs have been vaccinated. So the coverage has increased with 61%. And this really led to the reduction of exposure of animals to rabies. So through this intervention, the successful implementation of this project was really demonstrated through strong One Health approach by unifying veterinarians, medical professionals, community workers, the community, the educational institutions, and international partnership. And this really showed that through these approaches and continuous engagement and collaboration, that we can achieve a successful reduction in rabies in humans as well as in animals. Thank you very much.
Thank you very much for choosing this story to tell, because rabies is often considered as the disease that really deserve a One Health approach. It's really at the interface between wildlife, livestock, or animals, pets, dogs, and humans. And not only you have chosen the disease we like using as an example, but also you have talked about collaboration, cooperation, communication, capacity building. We have all the 4 C's of the One Health approach. So thank you very much for showing this. And indeed, in your text, what I really liked is how you have involved communities, and not any communities, also schools, teachers, which we have seen also in other countries, in other regions, how important it is to target this population. So thank you for sharing this story, which with an incredible impact. Only 1 human case. That's a success. Congratulations.
Thank you.
Before giving you the floor, I would like to offer the storyteller if they want to react to the stories you have heard while being on the podium.
Mic is on. Which mic? Okay. It's okay. All right, thanks. Yes, sure, I can go first. Something that I've seen or rather heard that's a common, there we go, that's a common theme, I guess, in most of our stories is the importance of co-designing a lot of these innovations that we're doing with the people who actually need them and the people who use them. So not sitting in workshops and conferences and discussing these things, but going to the ground and having discussions with the people on the ground from the designing to the implementation phases. So in terms of ensuring understanding of these things, so for instance, with diseases, making sure that when we are responding to different diseases that are happening across our different interfaces, that the people on the ground are actually understanding the diseases themselves. And that goes into the sustainability of the things that we're doing and the work that we're doing. So even beyond us, if we're not on the ground, we know that the work will continue being done on the ground, which also helps everyone in the long run and everyone wins. So yeah, I liked seeing that.
Well, thank you, because we do realize you are someone boots on the ground. Thank you for being here with us and sharing your story. Does anyone else have a reaction or a comment or a question to one of your co-storytellers?
Just like to echo this, on the human health, antimicrobial stewardship looks to be straightforward, but it's interesting on the animal health sector. Human health, you are seated in a ward in a hospital, patients are following you. On the other side, it's very interesting. Instead of 1 standard treatment guideline, we have developed about 5 of them per species. So it's an area which sounds so interesting, and we look forward to sharing our results on the animal health side. Thank you.
I look forward to it.
Yes, thank you. I think our stories showed that there are many different ways of going about things at different levels and in different system levels also. So I think it shows we can all do our part, we can all contribute, and if we do what we can, where we can reach, I think if that is a huge collective action we can already take, and that will multiply if we all do our parts in our communities, in our system levels that we can reach.
Thank you for sharing this. Margaret?
Yes, I think these storytellings were very interesting, considering they're very different, but relevant to all our countries with regards to food system, antimicrobial resistance, and so forth. But what is key that I've noticed is involvement, not to have a blueprint from top down, but really to start from grassroots level up and ensuring that there's continuous understanding and evolution in these interventions, that so that once they are applied, they're sustained and they have results that can speak for themselves. So I'm quite excited to know or to hear about these stories, especially with the antimicrobial resistance in animals. It is a topic that's a hot topic currently under discussion, and how we can actually do proper surveillance of these antimicrobial use in animals. And with regards to the food safety systems, really, I think that was a good initiative, and maybe we can just see on how we can assess where the community is, but also to improve the hygiene and of these products that are being sold, because this is what results in foodborne disease outbreaks should we not adhere to specific international codex alimentarius type of measures. So it's exciting to see that in the community, when they are being engaged in forming their market access, that they can also employ where they can without it being too capital intensive, these measures to make sure it's really safe. Yeah. Sorry, I like talking.
No, thank you. No, but, and indeed, you did part of my job, because I really wanted to react on, despite the fact that your stories were very different, you all had a common point, and this was this engagement at community level, and having people really understanding, being actors of it. That was really a common point of all your stories, and basically, I was wondering if in these 4 stories there will be something in common, and I'm very happy about it. So you may have comments or questions for the storytellers, either reacting on what they've shared or asking for more information if you are interested in what they have implemented to try to see if it would be valuable for your country. So please let me know if you want to raise something, a comment, a question. And because of the lights, I barely see you, so I understand why you were asking people to stand up. Yeah, please.
Good afternoon. Okay. Good afternoon. My name is Dr. Nancy Kasongo, and I'm from the Levi Mwanawasa University Teaching Hospital under the Ministry of Health. My question would be to Mr. Chizimu. So my hospital is actually one of the hospitals that was part of the AMR stewardship, and I would like to talk very highly of the impact, though I was not one of the people that was trained on the stewardship, but I got to interact with some of the people that are in the leadership. And I currently work in the dermatology department, which works closely with infectious disease, in which we might see patients with Kaposi sarcoma and HIV, and then sepsis, and that becomes really challenging. So with the antimicrobial stewardship program at our hospital, they actually do grand rounds. They've also transformed the drug chart to the point where the clinician must put their name and phone number, state if they're doing a culture, and that makes me highly responsible over what medication I'm prescribing and following up to the lab. So it has moved the clinician from the wards to actually go to the lab to request for tests they need. And I also have to advocate for changes in antimicrobials. If I'm moving to a higher class, so now I have to go to pharmacy to prove why my patient needs a change, because that's what's required. So my question is, beyond the research project, what efforts are you making to integrate this type of training into our current activities, given our resources? Thank you.
Okay, it's now on. Thank you so much for that comment, and also for the question. So basically, we have been training the staff who are in service, the health workers, the vets, the paravets who are already working. But we looked at that to be not that sustainable. So our main option now is to ensure that we incorporate this AMR IPC training in the in the pre-service curriculum. We develop the curriculum and make sure that it's incorporated in the pre-service trainings in these tertiary universities. So starting next year, we have targeted 2 universities to pilot. One which will be the Levi Medical University, that's for human health, And then for animal health, it will be the veterinary school, that's at the University of Zambia. This is to ensure that the cadres who are being trained, they are well equipped with issues regarding antimicrobial resistance and antimicrobial stewardship. We feel that will be a more sustainable way than the in-trainings or the trainings of the in-service. Thank you so much.
Thank you. Does anyone else have a question? Or yeah, please, ma'am.
Yeah, thank you so much. Thank you so much. Yeah, my not really question, but it's more of just thoughts from Namibia. I like the topic you talked about, rabies control. Is something that is in my heart that yes, we can control rabies, but we really need to work together. And for me, it's more of what are your thoughts in terms of engaging more stakeholders. I'm thinking of what Professor Helen talked about yesterday, experiential learning. How do we engage the university students, especially if they work together before leaving the university? I think even when they're in the field, they will still work together. What are your thoughts? How do we engage them? But then, in terms of expanding the multi-sectoral team, I'm sure, some countries have worked on the police force. They normally have police dogs, and they do a lot of work. And I think when communities understand that dog does a lot, they know, they value them. How do we engage such people, such sectors? So it's more of, what are your thoughts? Have you thought about engaging beyond, not necessarily only engaging the government people, but what about engaging beyond? Thank you.
Thank you for your question. Magrecia, your thoughts?
Okay. Am I audible? Yes. All right. Thank you so much for that question. With regards to what we can do to ensure we engage universities, what Namibia is currently busy with is we have reviewed our curriculum where we are in the universities, especially there by the faculties of health and veterinary medicine, where we've developed now a One Health master program that can be taken either that can be taken virtually or physically. And what we're also doing is really to integrate programs and try to make it more interactive, whereby these professionals or upcoming professionals are being taught about the importance of One Health, and also how to have interventions at various levels. So the reason why we're starting at lower level is because a lot of the rabies cases and death cases were reported in children, and we did decide to transform or start at that level by engaging the teachers, but curriculum transformation is one of them. With regards to extending the stakeholders, that is definitely possible, depending on the situation that you find yourself in, whether there is a need to engage police force. Obviously, for those who have animals like the canine, we do trainings as well, we do awareness as well, but the reason why focus has been put mostly on the current stakeholders, the education sector, health, environment sector, is because of these interfaces where the disease is mostly reported in. But the ability to extend it would be need-based. You'd have to see the need for why you'd want to extend it to these various stakeholders, and obviously equip them, empower them, capacitate them, so that they can also become champions in their sectors. Yeah, thank you.
Thank you very much. I see the timer is on the red mode. So I would like to check if there's one last question from you, or comment, reaction to the stories that were told. Please, sir. If you could stand up for the colleagues to notice where you are. Yeah, please.
Good afternoon. I'm Andrew Kataba from the University of Zambia, and also representing the Veterinary Association of Zambia. I want to just commend Namibia, I think, for your successful story that you've just shared with us on rabies, and therefore the question comes to you. I'm just wondering, in your project, who got to pay for the vaccine? And I realized that in 2019, you had a slump in the coverage. So I'd like to find out what caused that drop. And maybe going forward, how are you going to ensure that the vaccines remain affordable for the community to ensure that they sustain that coverage that you need for the vaccination? Thank you.
Right. Thank you for that question. All right. Can I display so I can just see which drop he's referring to vaccination coverage-wise? Is it possible for me to get my presentation back? Or
I guess it is.
yeah? All right, so with regards to funding, we have multiple partners that supported the program from inception. We had the German federal government support us financially from 2015 up until till date. Then we also had WOHA provide technical support for the rabies program. 80% of this project is funded by the Directorate of Veterinary Services. And then with regards to the vaccination campaigns, the challenges that we do face is if there are competing priorities. Like last year and early this year, we had a lumpy skin disease outbreak, so we had to split the priorities and the resources to address all of these because lumpy skin is also considered a trade-sensitive disease. So the vaccination teams were reduced in this instance, and the coverage was not as it would be throughout as the previous years. But these are things that we're trying to address. So we do have challenges with vehicles, resources still, because of the vastness of the areas where these communities are located that requires good vehicles and so forth. And we are addressing them by procuring more vehicles. So we do need to ensure that there is government commitment, but 80% of the activities is funded by government. 20% of this funding came from the the German Republic, Federal Republic, and then support from WOHA. We also managed to get some technical support from the Friedrich Loeffler Institute, and they helped with the capacitating the Central Veterinary Laboratories, helped with genome sequencing and so forth. Yes. So in future, really it's about planning and mapping out. Like I said, when we have these various tools available to us, we can prioritize which areas need to be covered to ensure that there's no surge in or re-emergence of these rabies disease in domestic and in dogs as well as in humans. Thank you.
So your presentation is back if you want to see the drop in 2019 on vaccination coverage you were asking for, right?
I think he mentioned that. I'm not sure, but oh yes. So this 2019 incidents also happened because of the lockdown. This was when 2019-2020 was due to COVID lockdown, and a lot of activities were reduced or suspended because of the lockdown in country. So you can see that there was a decline in the activities with regards to vaccination coverage and so forth. But that contributed to the reduced activities.
Okay, well, thank you very much, the four of you. In the discussion, I extracted few keywords: connection, connecting people, leadership commitment, community engagement, but also co-construction, not only engaging them once everything is decided, really co-construction to get them being the actors of the project, and involving more people, more stakeholders. And I'm sure that for this specific point, Madam Master of Ceremony would have a lot of ideas. Thank you very much to the four of you, and please join me in acknowledging their work.
I think they deserve another round of applause, ladies and gentlemen, given their efforts. Thank you so much. Thanks again to our panelists as they prepare to make their way off stage and really responding so favorably to many of your questions, the feedback, and most importantly, hopefully this calls for highlighted participation in making sure that we learn lessons from each other, so that they're clear, cross-country, cross-border activities to make sure that whether we're in Namibia, we can learn something and implement in Mozambique. From Mozambique, we can implement it in Angola. We can shift back to countries like South Africa and even our peers in Nigeria to make sure that as a region, as a continent, we're able to thrive and select some of the partnerships that we're able to implement in our own home countries. Well, this is why we need to keep the conversations going, but most importantly, amplifying those stories to make sure that the impact is understood, the investment and capital is mobilized, and the policies are able to shift. On that note, we appreciate the fact that everybody has been so interactive and sharing their feedback and insights right across the day. We are going to take a 1-hour lunch break. So, we're going to strongly encourage you to join us for lunch, which will be served outside at the main restaurant here on the ground floor. You're more than welcome again to interact with the various innovators that we've been speaking to. The Innovators Market will remain open, and you have an opportunity to ask more questions, probe more ideas, and most importantly, establish a connection. When we're back after lunch, it is 1:34. We're going to return promptly at 2:30. 2:30, we'd like to commence with the following remainder of the program. We have 2 panel discussions where we'll build up on how it is that we ensure that the cross-cultural and cross-border exchange is amplified, and of course, mobilizing more investment. So please enjoy lunch, everybody. Stretch your legs, get some food and some coffee. We'll be back at 2:30 to continue with the closing session of the One Health Regional Conference. Thank you so much. you'd be well aware that we've had our innovation marketplace. Please do feel free to scan the QR code. Oh, that was on screen a few minutes ago. We'll pull it back up on screen. You can scan the QR code to actually share your feedback regarding the innovations marketplace. You've heard from many of these entrepreneurs. You continue to interact with them. And right now, we're going to make sure that you hear from many more of them as they share more of their insight. Just to give you an overview of the program for the remainder of the day, to manage our expectations collectively, we will hear from the innovators. We'll have 2 more panel discussions to help us fully understand how we expand and elaborate on the partnerships and networks that we can develop. And from that, we'll also hear some key highlights regarding the conclusion of the conference, and most importantly, charting a roadmap going forward as to how we shift the needle going forward. What it is that we need to do, essentially helping us understand how we take what we've learned over the last 2 days and implementing it within our organizations. On that note, with everyone comfortable, appreciate you pulling out your phones to scan the QR code and complete the survey. We head back to this interesting time where entrepreneurs and innovators are going to share their feedback and amazing insights and innovations with us here. On that note, I'd like to call up to the front Mr. Ishmael Silla from Better Clinic, Digital Livestock Identification and a Traceability Platform. Mr. Silla, if you could please join us in the front of the stage as you make your way up to the podium. I am aware you are in the building because we did see you earlier today. Fantastic, there we go. You can confirm that you can see your clock. You'll have about 3 minutes.
Okay.
We'll count you down. Happy for you to adjust your mic to make sure that you are fully audible. Because you are
Hello?
a tall man. Indeed. Let's move both of them up. Fantastic. There we go.
Okay, thanks.
You ready? You're comfortable?
Yes.
Fantastic. Your 3 minutes starts now.
Hello, everybody. My name is Ismail Silla. I'm the CEO of Better Click, a tech startup. We develop and design animal, livestock tracking and traceability platform. So currently we are working in Mauritania, Senegal, and Ivory Coast. Why our work matter? Because we, as many of you know, here in Africa, we have lot of issues tracking animals and collecting data about animal, mainly traceability, animal identification, and so on. So that's why we are just here. How we do it is that we are using animal RFID identification in order to identify uniquely each animal, livestock mainly, and also we are tracking animal movement to also integrate this specific aspect of our livestock system in Africa. So that's how we do it. So the traceability, it's from the animal. We are tracking everything about the intervention, vaccine, treatment of animal, but also the movement. So at the end, we can identify animals, also stakeholders, and at the end, certify livestock and animal products in order to be able to empower livestock traits and also protect people, animals, and environment around livestock. So what we are doing currently in mainly countries like Ivory Coast, Senegal, and Mauritania, we have some pilot projects. So as use case, what we can do is, for example, if you can detect zoonotic diseases for an animal, you can track back, thanks to the traceability, GPS traceability, to see where the animal is coming from, and also quarantine if needed some areas. So it's what we are doing in terms of One Health. And in terms of also trades, we are working to integrate blockchains. For example, if some country we want to trade leverage your livestock potential in terms of trade, we can certificate your animals and animal products in order to be tradable outside the continent.
Fantastic. And where's your booth located?
Outside.
Right on this marketplace, perfect.
Yes.
Thank you so much. Mr. Sila, merci beaucoup. Thank you so much for your presentation with some time to spare. So making sure that we fully understand his messaging as well as the traceability and expertise. Please do make sure that you do interact with the innovators and share some of your feedback in terms of the conversations and insight that they'll deliver. Our next innovator joins us from Ration Smart, Dr. Maria Helena de Olivier, joining us to give us her insight and, of course, more details around her innovation. A warm round of applause, please, for Dr. Maria joining us to tell us more.
Hello. Yeah.
Fantastic. You
Thank you
comfortable?
for the introduction. Yeah.
Fantastic.
Is
We can
it
move
okay?
it further down.
Yep. All right.
This should be fine. My colleague William will guide us if I've misplaced the mic. You can confirm you can see the monitor?
Yeah.
Fantastic. Your 3 minutes starts now.
Thank you. Through our project at UC Davis, we kept here the same goal across all farmers we have visited in Africa and Asia. And the goal is they want to increase milk production, they want to increase health of the animals, and they want to increase income, which are very reasonable goals, right? So healthier animals will reduce the risk of disease transmission, as we know, will supply a more stable milk production and consequently better livelihoods for farming families. In Indonesia, specifically, this is a very crucial matter right now. You may have heard about their new school lunch program, because they are aiming now to increase milk supply at schools to improve the health of their children. So, but how can we supply more milk and increase the production of the animals while protecting the environment? Because in this plan, we can consider that they will have to have more cows, up to 1 million more, and with more cows comes more burps, and with more burps, more methane emissions. So, but how can we help them to accomplish that? That's exactly where Ration Smart will fit in. Ration Smart is built around 3 simple ideas: better feed, more milk, and less methane. But how can it do all of those things? Well, let me explain all the elements for you. Methane comes from fermentation, which is the way cows digest their feed. And with fermentation be more inefficient when the diet is unbalanced, which, as all of us know, it's a very possible situation in smallholders, because smallholders, unfortunately, do not have the right tools to formulate the animals' diets. So to address that, right now we are conducting feed ingredient analysis across 16 countries in Africa and Asia, and that will allow the farmers to produce diets with ingredients they already have, like their native grasses and byproducts. So with all of this information in place, Ration Smart formulates the diet behind the scenes and delivers the best diet for the farmer to be able to provide best nutrient for the animals, which will consequently increase the milk production, health of the animals, and income while reducing methane intensity. So better feed, more milk, and less methane, it's not only our slogan. It's actually what happens when we turn feed ingredients into a balanced diet. That's all. Sorry.
Well done. And where is your booth in the marketplace?
It's right next to the registration, just like in the front of registration, turn left.
Fantastic. Thank you so much. Dr. Maria, they're joining us to tell us more about her innovation, and I strongly encourage you to make time and effort, even as we head out at the conclusion of the conference, to connect with these entrepreneurs, as there's a lot of intersection with some of the solutions that we can partner on them with. You've heard from 20 innovators, individuals from across the globe who have given you some insight into the solutions they're bringing to the fore, and this, I think, is really critical and pertinent for us to understand. Here, the developments have been edified, amplified, and of course we can partner with them going forward. We're going to hear from one last innovator who concluded all for us by sharing their particular strategic innovation, specifically focused on Maziwa Plus. Please let's warmly welcome to the front of the stage Dr. Peter Kimeli. Dr. Kimeli, did you come with some of your lunch on stage?
It's a better way to finish this presentation.
It's a better way to finish. Fantastic. You can confirm you can see the countdown monitor?
Yes.
You're comfortable? Okay. We'll give you some time. Do you need a straw for the milk?
I'm okay.
I'm teasing. Your 3 minutes starts now.
Guests, ladies and gentlemen, allow me to introduce to you the Maziwa Plus. Maziwa Plus is an initiative that's going to transform how Kenya understands, how Kenya prevents and manages mastitis in cattle. Maziwa is a Swahili word for milk. And so Maziwa Plus to us means more milk, better quality, and safe for consumption. Kenya government this year embarked on an ambitious approach towards improving the production and doubling it by the year 2030. I know it's easy for all of us to think maybe easy way is to double the number of cows being milked. But again, some will say that will also double the greenhouse gas emissions, right? And so one of the options that government would have on their part, among others, is just to look at the health of the cells that produce milk and possibly prevent the disease that attack them so that the cells can optimally function to produce milk. And so our project is pegged on 3 main pillars that attends to this. One is to make sure to understand first the level of burden of this problem among the farmers. And we're synthesizing all the literature and data from the referral labs that we are accessing through the government of Kenya. The second pillar is again trying to reach out to these farmers and understand and possibly help them look at the level of damage that this disease is causing and quantify it in form of dollars. And that's through economic analysis. We are also interested at looking at their willingness to pay for different interventions. And thirdly, we are working with the farmers, animal health practitioners, and the processors and cooperatives to co-develop some of the interventions that would be useful in reducing the burden. Through that, we will be able, and that will be starting next year, we would be able to pilot over a year and see how that performs, and through that insights, we will be using the information to co-develop one of the first national strategic plan towards control of mastitis in cattle. This is not research, it's a movement. This is not, this is not going to be an ordinary research. We want to partner, we want to engage, and hopefully through this, we'll be able to change the evidence into action, and hopefully action into strategy. Thank you for listening to me.
Thank you so much. If you can please remind us where your store is.
I'm right to the right side of this launch, at the stall number, I'm not sure of the number, but the farthest of the corner.
Fantastic, thank you. Right down the hallway, past the restrooms, and of course, as you get to interact with many other peers. Asante sana. Thank you so much for giving us your presentation and making it practical, right? It makes a lot more sense when you see the output and the impact of the innovations that are being brought to the fore. Well, we're going to shift gears very quickly to make sure we do get to our next panel discussion, but this one really underscores what we're here for. When we registered yesterday, we had confirmation that we had full representation of all 16 member states of SADC. I think I need to say that again. We had full representation of all 16 member states of SADC. This is critical because it underscores why we're here. The Regional Conference on One Health. And it helps us understand that through our individual efforts, through the entities we serve, the nations that we might be based in, but our fundamental focus in operating as a region, we are looking to make sure that whether you're in Zambia, Zimbabwe, Lesotho, Botswana, Namibia, Malawi, Mozambique, DRC, South Africa, even here in Lusaka, Zambia, we want to make sure that we all seek alignment in terms of the collaborative exchanges. And Angola. I kept you for last. So our next panel discussion builds up on this theme to understand how we actually build up on the roadmap going forward. This helps us understand how we seek alignment not only through the regional integration and the interchanges that we need to participate in, but how we make this a national priority in our respective countries. Our next panel discussion will actually speak to leaders from various countries, specifically Zimbabwe, Namibia, South Africa, and getting some perspective from Madagascar. This conversation will be moderated by a key leader and player within the theme of underscoring key partnerships that we have in the healthcare space. Please help me warmly welcome the moderator to the stage, following which the moderator will then introduce their panelists who will be joining them in conversation. And participating in this, you are welcome to join in a Q&A for the duration of the 40-minute conversation of the panel discussion. A warm welcome, please, to Professor Salome Bukachi, joining us from One Health High-Level Expert Panel and the University of Nairobi. A warmer round of applause for her, please.
Good afternoon, everyone, and welcome to the session. Welcome to our panel session on building sectors, national coordination, and governance for integrated systems for One Health in African countries. As we begin, let's reflect on an African proverb. If you want to go fast, go alone. If you want to go far, go together. This reminds us that lasting progress in health security requires collective action, required collective efforts across sectors in the One Health space. As I stand here, I stand as a representative of the One Health High-Level Expert Panel, but I'm going to give my own reflection based on this theme for today's panel. I'll start by giving the definition of OLEP, of what One Health stands for, and is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. It recognizes the health of humans, domestic and wild animals, plants, and the wider environment, including ecosystems, are closely linked and interdependent. The approach mobilizes multiple sectors, disciplines, and communities at varying levels of society to work together to foster well-being and tackle threats to health and ecosystem, while at the same time addressing the collective need for clean water, energy, air, safe and nutritious food, taking action on climate change, and contributing to sustainable development. I bring this because even as we go into the session we're going to discuss, these key components of the One Health definition and the principles will be guiding the discussions that we have. We look at the principles of One Health, which include equity across different sectors, socio-political and multicultural parity, socio-ecological equilibrium, stewardship and transdisciplinarity, and multi-sectoral collaboration. The Quadripartite One Health Joint Plan of Action, Theory of Change, speaks into the pathway for achieving impact through integrated, multi-sectoral collaboration, and outlines how coordination and actions will lead to desired outcomes and ultimately to the overarching goal of improved health for humans, animals, plants, and ecosystem. Today we'll explore how multi-stakeholder engagement and innovative governance can strengthen One Health approaches, integrating human, animals, plants, and the environment's health systems. Our discussions will focus on practical strategies for national coordination, overcoming fragmentation, and building resilient, unified systems that safeguard health and drive sustainable development across the continent, and to effectively prepare, detect, and respond to these diverse threats, there is need for an effective governance and multi-sectoral coordination. So to unpack how countries are dealing with this, I would like to invite different countries, representatives from different National One Health units, to be able to help us unpack this. So join me in welcoming to the stage, from Madagascar, we have Razafimbia Vesore, who is the National Coordinator of the One Health Platform. Let's give her an applause as she comes. Followed by Namibia, we have Yalo Mwananingange, who is the Deputy Director, Epidemiology Division, Ministry of Health and Social Services. Kindly join us to the stage as we give her a round of applause. Next, we have South Africa, being represented by Wayne Ramkrishna from the Department of Health. Another round of applause for him. He's followed by Inocencio Chongo, who will be representing Mozambique. He's from the National Institute of Health. Last but not least, we have Tracy Kudzanai from Zimbabwe. She's the One Health Secretariat from there. Thank you very much. This is working? Are we good? All right. So, ladies and gentlemen, you're welcome to this panel. And I would just like to start with a round of introductions. I'll start with Razafimbia to tell us a bit about your One Health structure at the governance level in Madagascar. A minute to tell us that.
Merci. Permettez-moi de parler en français, s'il vous plaît. Bonjour à tous. Merci beaucoup. Pour Madagascar, la gouvernance pour la plateforme One Health a été décrétée en 2023. Donc, il y avait dans ce décret la constitution de 3 organes, dont le comité de pilotage, sous tutelle du secrétaire général du gouvernement comme président, et les 3 secrétaires généraux du ministère de la Santé humaine, Santé animale et Santé de l'environnement comme adjoints, et les secrétaires généraux de tous les autres ministères, ainsi que les représentants de PDF et des organisations de société civile comme membres de ce comité de pilotage. Ensuite, le deuxième organe, c'est le comité technique de coordination, dont il y a 3 points focaux des 3 secteurs toujours de la santé, avec des groupes thématiques de travail qui sont au nombre de 8 actuellement, dont le groupe thématique de zoonose, groupe thématique de travail et sécurité sanitaire des animaux, groupe thématique de travail en surveillance, laboratoire, résistance aux antimicrobiens, des événements liés au changement climatique et des recherches, formations et ressources humaines. Et enfin, le secrétaire permanent, qui est le secrétaire général du ministère de la Santé publique. Voilà donc la structure dans le décret. Et la situation actuelle, c'est que il y a ce cadre législatif, mais le pays a élaboré également un projet d'arrêté qui va décrire le rôle et les attributions de ces membres de la plateforme One Health, qui est en cours de validation. Et à part cela, les groupes thématiques de travail sont déjà opérationnels, parce que Madagascar, à part cette officialisation, institutionnalisation, est membre aussi du réseau de surveillance épidémiologique et de gestion d'alerte de la COI, du Commission de l'Océan Indien. Depuis longtemps, nous avons déjà fait beaucoup de travail en collaboration entre les secteurs en santé humaine et en santé animale depuis longtemps. Et donc, les groupes thématiques de travail sont déjà opérationnels et qui font des travaux ensemble et qui planifient ensemble leurs activités. Et nous avons eu de la chance aussi, grâce aux appuis de la Banque mondiale, dans le cadre d'un projet qui s'appelle Projet de préparation pandémique et aux amélioration des prestations des services de soins de santé de base, qui nous a octroyé beaucoup d'opportunités pour l'opérationnalisation de la plateforme One Health. La Banque mondiale nous a soutenus à travers de réhabilitation d'un bâtiment dédié pour la plateforme où tous les groupes thématiques de travail font leurs réunions et toutes les planifications de leur travail. Et beaucoup d'activités sont soutenues par les partenaires techniques financiers également. Donc, c'est comme ça la plateforme One Health pour Madagascar jusqu'à ce jour. Comme défi, c'est l'appropriation nationale, c'est vraiment l'orientation globale aussi, parce que nous sommes encore en cours d'élaboration de cadres techniques, les documents cadres techniques, le plan d'action conjoint national, le manuel de gouvernance, le manuel pour la surveillance et le partage d'informations, parce que c'est très capital en termes de One Health, la communication, les partages d'informations. Donc, c'est ça notre grand défi et à peu près, c'est ça la gouvernance à Madagascar. Merci.
Thank you so much for sharing about the Madagascar experience. And good to note that you have different institutions involved. You've brought out a challenge in relation to the legislations that require these different sectors to work together. And I think we'll hear more about that. Let's move on to Namibia. And Dr. Iyalo, maybe you can share with us how your national platform or your national One Health unit is working there.
Thank you, it's Miss Iyalo. Okay, yes, in Namibia we are having tripartite ministries who are implementing One Health interventions. And I can say that those interventions have been there for years. It's only the formalization or governance structure that was not in place. So by nature of executing different mandates across different ministries, different line ministries are actually working together, they are collaborating. Like One Health is jointly implemented by Ministry of Health, Ministry of Agriculture, Water, Fisheries and Land Reforms, and also by Ministry of Environment, Forestry and Tourism. What is interesting is across all those three ministries, you'll find that the disease control is in all three ministries. You'll find that plant health is in two ministries, both in environment and agriculture, food safety, IMR. So those interventions and those units in those ministries are gluing together that structure. Another enabling factor for One Health interventions in Namibia and for solidifying the structure is we are having a National Disaster Risk Management Unit, which is at the office of the Prime Minister, where all the line ministries are reporting to. So even in event of public health emergencies, that unit coordinates the public health response across different ministries, particularly when we are having zoonotic events. And this is cascaded to the National Health Emergency Management Committee. We are, at this moment, we are having what we call a technical working group, and which is coordinating the interventions around One Health. But it's still work in progress in terms of the formalization. Last year, we have just launched our One Health strategy. And in that one strategy, it's where we have the structures are being established, in terms of references are there. But nevertheless, different structures that we are having already, like the IHR National Focal Point, IMR, and many others, they are serving as a foundation for formalization of the One Health structure in Namibia.
Thank you very much. What I hear is that the structure already exists. It's about now how you formalize that structure to have it anchored in more of a formal policy going forward. Thank you for that. So now we are going to move to South Africa. And Dr. Wine, you're going to tell us about the South African experience and your structure in relation to the One Health coordinating unit. Thank you.
Good afternoon. In South Africa, we drafted our One Health strategy, or One Health we developed a One Health steering committee in 2014. And the main members or the leads in that committee was from the Department of Health, Department of Agriculture, and the Department of Environment. And then we also established the One Health Forum in the same year. And the One Health Forum was made up of a broader group of One Health stakeholders, and it largely encompassed all stakeholders that were interested in One Health and implementing One Health through collaboration, coordination, and communication. So that was working well, but there was a lot of room for improvement. And during the time with those structures, we've engaged in several One Health initiatives. Like we conducted a prioritization exercise, we conducted the National Bridging Workshop, we've released several newsletters and webinars and so on. But still, we felt there was a gap because some stakeholders did not really find the space in the One Health steering committee or the forum. And this was our colleagues from environment mainly, but other areas, because our One Health steering committee and structures were focused largely on zoonotic diseases, and areas such as AMR were not fully integrated. So there was an opportunity with the release of the Global One Health Joint Plan of Action. And with those 6 action tracks, we've managed to broaden the scope of One Health. So at the moment, we are finalizing our One Health framework. And the great part of this new approach is that environment as a action track on its own, and focus would be on that action track as well as all the others, including AMR also has an action track on its own. So there's a much bigger scope for engagement and integration and so on. Thank you.
Thank you very much, and for bringing out the aspects on your initial and interesting perspective, and also good to note that environment was a weak link. And throughout all our countries, as we're talking about the One Health approach, we've noted that environment has been a weak link within the One Health structure. And so it will just be important to see how different countries are working towards embedding environment and pulling them along even within the structures. And so we'd like to hear from Mozambique, Dr. Inocencio.
Thank you. Thank you. Hello. Thank you, everyone. Good afternoon. Mozambique, we do have a One Health platform. We started to work as a One Health platform since 2013. In the beginning, we were working only with zoonotic disease. So from 2016, we added MR and food security. So in terms of framework, we have 2 main ministers that are involved, Minister of Health and the Minister of Agriculture. The Minister of Agriculture is composed by the livestock, environment, and the fishery sector. So we involve the academia and the research institutions and the civil society. In terms of what we did, we applied together for the GEE, and from the GEE we succeeded to develop the National Action Plan for Health Security. That it's a kind of umbrella in Mozambique. All the partner, all the donors, all the fundings that we received, we use this tool where we prioritize 16 work package. We are now finalizing our One Health strategy plan with the help coming from CDC Africa. We prioritize our zoonotic disease in 2018. So we planned to reprioritize, to do the reprioritization of the zoonotic disease by next year, March. What I would like to share is this One Health group. We have any focal point. That's myself. I'm based in MOH. And in each ministry, we have a focal point that we keep contacting with them using email, phone. And formally, our relation is based in a memoir of understanding. I think it's that. Sometimes the English is going away. So we do joint planning and a joint implementation of different activities. So in terms of recently, we did co-application for global funding, pandemic funding, and even COHESA we are implementing together. So we succeeded to develop any module for One Health that we are applying for the higher level education for the master in feed epidemiology and public health using this One Health approach. We have a contact in international level that they are contacting the One Health coordinators. So these One Health coordinators have a contact with the focal point in central level. The central level have a contact with the provincial levels. The provincial levels, we have a contact with the district levels. So we have some gaps in the district levels who are not well fixed, but it is what we're trying to fix. So is what we can say from Mozambique. We are trying to do our best. We have some gaps, but we are trying to do our best. Thank you.
And a good place to be able to learn how to fix those gaps by just the sharings that we're having across the different countries to help us build on each of our country experiences. And thank you for also just bringing out the fact that you've used some of the existing tools like the JEE to localize how you run your structure, which is quite a good thing. We'll come back more to listen and hear more on how do you implement, how do you bring in the environment, and how do you work together. But before that, let's go to Tracy.
Thank you so much, Madam Moderator. So Zimbabwe has established a multi-sectoral One Health governance structure. Now this was mainly based on one health issue, which is antimicrobial resistance. But this structure has its coordination anchored at the highest administrative level by the permanent secretaries within the three key ministries across the One Health platform. These permanent secretaries provide policy direction for the One Health structure, and they also ensure that One Health remains a priority within the different sectors. Beneath the permanent secretaries, we have the chief directors. These support and act as the One Health focal points within the different ministries. So you'll have One Health issues being dealt by the different chief directors. Then below the chief directors, we have what we call a One Health core group. This core group consists of directors from the different ministries, again across the One Health platform. These now provide a technical aspect of whatever One Health issue that we have that we will be dealing with. Within that core group, should I say, we also have the One Health Secretariat, which is where I belong. This One Health Secretariat has been formed taking officers from the 3 different ministries again, and this secretariat is housed within the Ministry of Health and Childcare, and that's where these officers operate from on a day-to-day basis. These officers are looking at One Health issues. Like I mentioned earlier on, with a special focus on antimicrobial resistance, because this is the issue that we've been looking at, mainly because of the funding that was coming in. Then below that core group with the One Health Secretariat, we now have the different technical working groups. And these different technical working groups are made up of a multi-sectorial stakeholders that come in depending with their, should I say, with their expertise. But realizing that One Health issues are very dynamic, Zimbabwe has taken strides to then come up with a One Health strategic plan. All thanks to COHESA, we've had support from them, and we managed to come up with a One Health strategic plan. And like Prof. Mugabe alluded to yesterday, this plan is going to be launched next week on the 18th of December. And we are very proud of this plan. Why are we so proud of this plan? It's because it's very inclusive. It has taken on board all the other players that had been left behind. So we are very proud of it, and we know that it's not going to include all One Health issues that had been left behind. And also to add on to this, we also have the formation of the Zimbabwe National Public Health Institute that is also being established. We had our very first meeting, which was all-inclusive, again, taking on board all One Health players. And these are issues that we are very excited on, and we know that these are going to grow our governance structure, like the strategic plan that I just talked about will move the apex part of our governance structure from the permanent secretaries to the office of the president and cabinet. That's where the coordination will be happening from. And below, where we have the technical working groups, we will have all the One Health issues being addressed. You have your food safety, the zoonosis, antimicrobial resistance, and also a special One Health issue that I'm proud of is the communication and advocacy. That is also being included. So we are happy and excited with this one because it moves along with the common mantra in my country that says, leaving no one and no place behind. Thank you.
Thank you, Tracy. And while you still have the mic, I'll get back to you. And congratulations
Thank you.
to Zimbabwe for having come up with this One Health strategic plan that is going to be launched soon. I think that's the way to go, because if the discussions we have are not anchored within a policy framework, then it becomes a shaky ground whenever that structure is not in place. You've talked about all-inclusive, and would like to hear from you. How have you been able to pull everyone to make it all-inclusive so that no one is left behind? How do you make each of the different sectors to feel like they also have an equal place on the table?
Okay, thank you for that. So you'd find that initially, like I was saying, we have the structure starting at the highest level with all the key players involved. We have the permanent secretary from the Ministry of Health and Childcare, the permanent secretary from the Ministry of Lands, Agriculture, Fisheries, and Water and Rural Development, and the Ministry of Environment, Climate and Wildlife. So once you have that coordination from that highest level, it's easier to pull across to get all the stakeholders on board, because you have appreciation by the political leaders at the very highest level. So it will be easier for you to get technical people to come along. So you'll find that our structure becomes all-inclusive because it has pulled along everyone across the sectors. Like I said, all thanks to COHESA, we had some players in the private sector, we also even had some players, even within government, that had been left behind. But when they came in with their financial support, we managed to spot and identify those players that had been left behind. Thank you.
Thank you very much for bringing out that aspect of coordination at the higher levels, and also just bringing about the various partners and the various programs and initiatives, like the COHESA project that has helped really push your country to that level. Innocencia, based on Mozambique's experiences, which enabling factors have been very critical towards helping push these technical platforms to the level where they are today?
Yes. First of all, hello. Yeah. First of all, we face a problem to make other stakeholders to understand the value of working together. So we went through to the international governance instruction, national governance instruction, a reflective, adaptive governance, where we started to develop a meeting, short meeting with the male stakeholders, mainly environment sector that was behind. So we start to develop meeting with the higher level to explain them the value of joining us. So the big problem to make all the people together is to convince the policymaker, mainly the higher level of each minister, that they need to join this One Health platform. So in general is what I can say. We face a lot of difficulty in the beginning, but we started to do directly a specific meeting to explain the higher level why they need to join us. Thank you.
Thank you. So a lot of advocacy that you've had to do to pull everyone together. All right, good. South Africa, what are the main barriers that you have experienced as a country in terms of just rallying these different groups together, especially when you're looking at also the regional policies and how South Africa has been able to pull that together?
Thanks. I think South Africa experiences a similar type of barriers that many other countries have presented over the last 2 days. Common barriers would be funding challenges, human resource constraints, capacity constraints, and so on. But also working across sectors and even within sectors itself, you know. So we're trying to overcome that through more collaboration efforts, you know, more communication, and constant working together. I think on a regional level, we find that there's lots of stakeholders involved, lots of organizations involved, and at times their roles are overlapping, and sometimes the areas of collaboration becomes a bit blurred. And we often hear from partners about what needs to be done, but the how part is not always clear. And I think I've heard that this morning from other colleagues as well, you know. So I think when we're engaging with partners, we need to be clear on what you need to, what priorities that you have and what needs to be met during the engagements. So there's lots of room for engagement. On the cross-border level itself, I think the challenge is that a lot of initiatives happen on a national level, okay? But we should be looking at, for example, cross-border collaboration, maybe looking at more local levels, because the local levels arrangements and initiatives can move faster than the national levels, because, you know, we have to look at all the protocols and so on. But in closing, I would say that we need to keep working together. We need to keep talking, keep engaging. And some of the ways that we need to engage is, for example, simulation exercises, some of the general initiatives. risk assessments, So when we conduct such exercises, we are engaging with the people on the ground rather than the people at the national level. And we are, by doing this, we are working from bottom up rather than moving from a top approach, which is much slower. Okay? So yeah, there's a huge amount of room for engagement, and there's a huge amount of opportunities available. Thank you.
Thank you. Bottom-up approach and the aspect of clear definition of roles and clear definition of needs, as well as working together through simulation exercises to bring people together. And maybe for the case of Namibia, maybe you'll be able to tell us what are some of the strategies that you have used to be able to bring everyone together, especially the sectors that may feel they're a bit left behind, and how do you make everyone feel part of it, given the different role mandates that exist in the different sectors?
Yes, yes. For us, it has also been a journey in terms of bringing all the stakeholders together. But we are lucky to have a COHESA project through University of Namibia, where we did our stakeholders mapping, and we analyzed the level of interventions and interest of different stakeholders. And during that stakeholders mapping, we have realized that we are having a lot of interest groups. And as a government, it has really opened our eyes that we need to work with civil societies, not just the ones that are supporting health, but other sectors. And we really came to appreciate that we are all having common objectives or common understanding in terms of what has to be done to protect, our health and an environment. One of the things that we have also been doing is when we are having resource mobilization, even like with pandemic fund or any other, we bring all the sectors together. And if you are going to train the if you want to strengthen the laboratory capacity, then it has to be across all sectors. The trainings, the advocacy interventions, we are doing it together. We also plan our activities together. And we also, one of the strategies that we've been using is also, we also have to understand, we went through the journey, we have to understand each other's mandates, the environment where different sectors are operating, and to also to appreciate their limitations, like environment. They assess the landscape of the health sector, and vice versa. So that one has also helped us to make us, be able to implement activities in such a way that we understand each other's roles and responsibilities, as well as the limitations. And we also work with different partners that are supporting us as well.
Thank you for that and for bringing out the aspect of the stakeholder mapping, which is very critical at the beginning to be able to understand the different strengths of the different players. Last but not least, we have Madagascar to share with us. Maybe what is the key lesson that you have learned in terms of just bringing different partners together, different sectors together?
Merci. Pour Madagascar, nous avons déjà l'habitude, parce que, comme je dis tout à l'heure, Madagascar avait déjà promu donc, cette approche multisectorielle depuis plusieurs années en termes de la lutte contre la résistance aux antimicrobiens, par exemple. Tous les multisecteurs ont collaboré ensemble à l'élaboration du plan d'action national depuis 2018. Donc la collaboration a été déjà existée entre les différents secteurs. De même pour les autres activités de surveillance et de réponse aux épidémies. Et notre point clé qui a renforcé cette coordination, c'est aussi le renforcement des capacités. Parce que les réseaux SEGA a a promu des formations en épidémiologie de terrain pratique et cet renforcement des capacités de tous les acteurs en termes de gestion des zoonoses, de gestion des maladies à potentiel épidémique a rassemblé naturellement tous les acteurs. Il est vrai que dans le thématique de sécurité sanitaire des aliments, nous avons un peu de difficultés parce que ça n'a pas existé des groupes thématiques auparavant. Mais vu les événements successifs dans notre pays, l'implication de toutes les entités impliquées, le ministère de Commerce, les ministères de Transport et tout, à travers de l'élaboration initiale des feuilles de route et de la gestion des événements, a facilité donc la cohésion de tous les acteurs à réaliser leur travail ensemble. Mais il reste toujours des difficultés pour la coordination, notamment en termes de financement actuellement qui est très dépendant des partenaires techniques financiers. Mais c'est une étape que nous devons franchir bientôt, de faire des plaidoyers pour que l'État s'engage à cette implémentation de l'opérationnalisation de l'approche One Health.
Thank you very much for sharing your experiences. And the key lesson I pick from there is about working with what is already existing and building it up. We have a short time. Maybe we can take one question, a burning question from the audience. A microphone for this, please. Do we have a microphone to be handed over to this corner?
Thank you so much, Esben Lunde Larsen from the Pandemic Fund. So I wanted to ask all of you a question on your legislation and implementation. And it was just said from Madagascar that they lacked some sort of financing. But legislation on the national action plans doesn't cost anything, and implementation is of course more costly than not doing anything. So how do you experience in your countries progress on the legislation work around national action plans for health and AMR in the One Health perspective? What sort of attention does it have from the government side, and do you allocate funding to actually implement it?
Who would like to take that on?
Thank you so much. That's a good question. I'm going through to an example that we used in Mozambique. For example, as I mentioned, we developed the National Action Plan for Health Security. That it's a kind of a guideline, One Health guidelines. It's an umbrella. So what we decided to involve the higher level. So this guideline was approved under the Council of Ministers. So when we did the budgeting of the guideline, where we have the responsibility, we forced the government to take the responsibility to fund a part of those activities. So, and I would like to agree with you that we can use some small fundings to develop guidelines, and we can force the government. So, but to force the government or to convince the government, you need to have data. You need to share the data with themselves, and you need to involve them during all the process of developing this guideline, and you need to leave the government to approve this document. Is what we did. It's an example that we did in Mozambique. So from now, unfortunately, we don't have any funding coming from the government, but the government is aware that the National Action Plan for Health Security must be funded using local budget. Thank you.
Tracy?
Okay. Maybe to just add on to that, yes, we do have national action plans, but in my country, what's happening is that we are moving towards embedding One Health activities within the different One Health ministries in their budgets. So you'll have, say, the Ministry of Environment, Climate and Wildlife. There are particular activities that pertain to them. They are then supposed to budget for those particular activities. I'll give an example of the antimicrobial resistance National Action Plan. I know that I'm from the Environmental Management Agency. I know that as part of their strategy going forward, they have budgeted for activities to do with surveillance for antimicrobial resistance. So these are some of the initiatives that our governments are taking so that they like include One Health activities within the ministry budgets. Thank you.
Thank you very much to all the panelists for sharing your experiences across the different countries. And this is an opportunity for us to just pick some key learning lessons from each of us to be able to use it to build up on our own systems back home. There's a saying that says that you always think your mother is the best cook until you go out there. So I believe we have also learned from each other that there are some good things out there that we can learn and pick to help strengthen our national One Health governance systems in each country. And in a proverb that says, wisdom is like a baobab tree, no one individual can embrace it. This speaks to the essence of the One Health, that no single sector or actor can tackle the complex health challenges we face alone. And when cobwebs unite, they can tie a lion. So thank you very much, and give a round of applause to the panelists for a good job done. Thank you.
Thank you so much. Another round of applause, please, for the panelists and Professor Bokachi. There's a line that you used that I think all of us are walking away with this afternoon by the end of this conference. The cobwebs connect, right? And at the end of it, they connect to draw a roadmap. And that is what we're actually going to continue to build up on, given the theme that has been highlighted regarding the various and respective countries, what solutions they are implementing, and how this leads us forward as a region. Now that does take us to our next session of the particular part of the program, where not only we will be hearing from representatives of SADC, but we'll also have the opportunity to participate in a panel discussion to hear the feedback again of key partners who are assisting us in adopting these strategies within our policy frameworks, within the entities that we lead, and making it part of the everyday conversation, interaction, allocation of capital, and partnership that we desire. To help us craft a way forward using those cobwebs, Professor Bokachi, we're now going to introduce to the front of the stage to help guide us in a twofold series of conversations, a panel discussion, but also representing and announcing SADC representatives to tell us more. Please warmly welcome to the front of the stage, Senior One Health Specialist at the World Bank, Anna Elizabeth Larson. A round of applause to her, please. Thank you so much. All yours.
Thank you, Gugu. Good afternoon. We are really approaching the last sessions of today, so I hope you're all stocked up on coffee as we are initiating this very important session on the way forward. I've been looking very much forward to this session, and it's therefore also my pleasure to introduce Lampoli, Kumpuneki, and GT from the SADC Secretariat to set the stage by introducing us to a very central element of the joint call to action, which is the presentation of the SADC One Health Roadmap 2026 to 2035. Please come up on stage.
Thank you. Thank you, Anna. I'm going to take you through a short presentation on the SADC road map for One Health. And I can see the counter is already ticking there, so I don't have much time. this presentation will be done in two parts. The first one is going to summarize the roadmap itself, and the second one, we're going to give the feedback on the discussion we had with member states, what has been your feedback, what has been your proposal on how we should implement and what should be the way forward. So on the roadmap, before maybe we start with the roadmap, we just provide a small context of the SADC region. As you know, SADC, it's a regional economic community with 16 member states, first established as the SADC in 1980, which is 45 years ago. And later on, in 1992, we had the treaty of the SADC Treaty. The SADC is based, we have a vision. The vision is mainly anchored into three pillars. The first one speaks to the issues of infrastructures. We have on industrial development and also social and human capital development. The human capital development, all of those structures, all of those pillars, you agree with me, can only be implemented in a context where you have peace and where you also have good governance. That's why you find the peace and the good governance being cross-cutting issues for us and a key pillar to facilitate the implementation of all our programs of development. We, as the SADC region, as I mentioned as well, we are a region, while we're a beautiful region, we also carry a high burden in disease. This is an ecosystem where you have infectious disease, you have non-communicable diseases, because we have countries which have made a lot of progress, where today you see mortality is increasing highly and you have non-communicable disease. But at the same time also, this is an interaction where you have zoonosis, zoonotic diseases which are being transmitted from animal to humans. And that's in that context, we need to work together, and hence you've seen the importance of us being here and talking about the One Health. The One Health agenda for us is key. It's important because of the interaction that we have as a region, as in different sectors, in different areas in the region. When you drive south this country, which is Zambia, you see the beautiful Vic Force, but at the same time, this is a region where you have interaction with 4 countries, where you have elephants crossing from one country to another, but it's not only the elephant, because these are the most popular that we know, but we also know that other wildlife, other animals are crossing, and that's how the interaction is very huge in this region. Hence, we need to work together and collaborate in implementing this One Health strategy. What are the objectives of this strategy? The objective is to have that institutional recognitions. We need to work as an institution to have the One Health. The second point is to strengthen the implementation of the existing. We don't need to work in silo. It has been repeated since for the past days. We need to work together. We need to work together as country, but also in the multi-sectorality approach, which is very, very key in succeeding when you implement any other project. As the SADC region, we have experience of multi-sectorality. We have seen it with the implementation of HIV, TB-related projects. Hence, we have successful stories. One Health is not going to be different. We are going to demonstrate again that political will and continue working in a multi-sectorality approach. In the roadmap, we have also come up with an approach on how would we like to propose the governance, the structure, how do we work, while the SADC Secretariat will be coordinating this approach, but member states also are key players and important, because it has been also discussed here how important global strategies, global policies are, and they can only be implemented at member state level, at national level. That's why we come up with this strategy, where member states are going to implement them, but also ensuring harmonizations among member states. We need to collaborate in the region. While we're implementing those strategies at national level, we also need to look at what is happening in the neighboring countries. How do we address the issue of One Health in Zambia, in Botswana, and what brings us together, what do we have in common to ensure that continuity in the implementation, avoid duplication, and also ensure synergy in terms of the efforts that we are implementing in this region. The strategy is not coming from the blue. It has been inspired by different existing strategy. We have the SADC Vision 2050, as we mentioned initially. We also have the Africa We Want 2063 as a vision, but most importantly, and also not the least, which is embedded, which is our guiding document, is the Quadripartite One Health strategy, which guides and which also inspired more in terms of the implementation or the development of the One Health strategy or the One Health roadmap that we see in the region. And this strategy or the roadmap identifies 6 priorities. The priority, as you can see, are well embedded around the governance. We are also looking at the issue of advanced AMR prevention and control. So those 6 priorities are well defined in the roadmap, and this is what is going to help us to make it more effective in terms of the implementation. In this slide, we are just repeating also the strategy and also the different pathways that we need as a region, what is going to help us to achieve the objective that we have set for ourselves as a region. At the same time, when we move and when we implement, it's important to assess how are we doing and how are we, what progress have we made and where we need to tweak a bit or where we need to harmonize. That's the importance of the monitoring and evaluation framework, which is going to help us. We are going to analyze as a region. We are going to provide advice to our member state on what needs to be done, and also, most importantly, on how do we need to implement those strategies, looking at the experience that we share as a region, looking at the lessons that we would have learned in the process of implementing this, but also learning from other regions which are advanced compared to us in the implementation of a One Health strategy. We also talk was the last slide on the implementation. As I mentioned at the beginning, the implementation is mainly at member state level. Member states are going to. We have, I'm sure yesterday during the discussion, we also heard that COHESA has mentioned that they've supported 8 countries in this region who have the national strategy. We need also to ensure that other member states are coming on board. They have a One Health desk and national strategies which are going to help us to come together to be at par and see in the one direction. Hence the importance of having also the implementation strategy, how we are going to interact with member states and so forth in terms of implementing this strategy. This will be the last slide that I'm going to present. I'm going to hand over to my colleague GT, who is going to take us through the next stage, which is your feedback on the roadmap and what are your views and the priorities based on the discussion we had earlier last month actually online. Thank you. Over to you, GT.
Thank you very much. It's too tall, so. Thank you very much. This part, where do I move the slides? Like what? Yes, this part is just to assure that for the last 2 days we have been listening. We had the lionesses, we had the lions, we had the professors, we had the doctors, even as the Jaywalas we have been heard. And we intend to include all your contributions as well, as we'll show you from the other discussions that we had early November. It was in 2 parts. We had a meeting, a virtual meeting, but there was also a questionnaire that was sent to member states. In terms of the meeting, we had more than 60 people attending the virtual meeting, most of them from member states and regional partners as well. And questionnaire, we received response from 13 of the 16 member states. In terms of the 6 priorities that Dr. Lomboli talked about, the member states validated them, said they were okay. But they also emphasized that there should be more community involvement. We should also consider the inclusion of wildlife disease surveillance, consider climate change as a cross-cutting issue, also collaborative financing and other issues as well. We also three major things came out as major in terms of barriers to One Health. The main one being governance and coordination, as well as financing and data management or information as it comes in relation to One Health implementation. There's the next one was dealing with main barriers to One Health implementation as well, and we look deeper into it, and it ranges from no dedication to national budget from the bottom to we don't know how to go around finding collaborative partnership in finding, and the requirements sometimes are too stringent for us to go through them. And on the right, we are trying to come up with how we can go around those issues. There was also, there's still a discussion on the structure, so I'll skip this slide for now because it needs to be discussed even more. I would prefer you don't take a picture of it because it's likely to change a lot as we go along. In terms of the recommendations that came from there on how to monitor or make sure that we do monitoring, learning, and replanning. The main suggestion from the meeting was that there should be three categories or three areas came out, one on governance and strategic planning, and the other one on surveillance, laboratory, and technical systems, and the other one on preparedness and response capacity. And under governance is making sure that member states have One Health coordination platforms and are also following all the other requirements like legislation and all those to make sure that One Health is there. And also under labs to make sure that laboratory are accredited. They use all the tools that are there, that are available, including monitoring what is necessary to be monitored. And also in terms of preparedness and preparedness and response. I can't read from here. So on the right, so we try to expand on that, align indicators with existing tools, and indicators must reflect the regional context. Also, data standards integration, establish agreed regional data standards, define clear reporting roles across sectors, and promote knowledge sharing and cross-sector data integration. And also make sure that tools are optimized or they can be interoperability between the tools, and also improve coordination and national support, as well as having a regional platform that will ensure the success of One Health in the region. There were items that came from the meeting as well. I think you have seen this in the call of action, and some of you have already signed it, so I would not go into details on those. In terms of the next steps, I always say to people, not all that is SADC is SADC. It sounds a little bit complicated. Not all that is SADC is SADC. Because we can have a SADC meeting, but is it really a SADC meeting? By that I mean that there are certain structures that are outlined in the charter that we have to follow for something to become SADC. So from here, we'll make sure that we'll get the roadmap to be approved and endorsed by the sectoral ministers, particularly the sectoral ministers responsible for health and the sectoral ministers responsible for agriculture and environment, and including all the structures that fall under that before the approval, including consultation with technical committees and other structures of SADC. But also make sure from there then the resource mobilization process will start up. It is very important that we should also think of setting up a regional coordination structure, looking at the staffing situation at SADC, and make sure that after that, make sure that the roadmap is implemented together with the monitoring, learning, and replanning. I guess this is my last slide. But before I push on the last slide, I would like to thank the Oral Bank Group, Sir Govindaraj and his team, Deepti, for having stayed with us along the path until we got to this stage. And also thank Dr. Raymond Hamonga for agreeing to host the meeting. With that, I'd like to say thank you very much.
Thank you so much, GT and Lamboli. Thank you so much for these very important insights into the SADC roadmap, outlining a very important milestone in working towards its endorsement at the ministerial level. With the roadmap now presented, the next discussion will focus on how partners across the region can support countries in moving from commitment towards coordinated implementation of One Health. To initiate this conversation, I want to invite panelists on the stage. I would like to invite Dr. Shamsuddin from FAO Regional Office for Africa, Dr. Wande Alimi, One Health Unit Lead from Africa CDC, Professor Flora Pule Muhlenberg from Botswana University of Agriculture and Natural Resources, and Dr. David Balikova, Senior Livestock Officer from East Africa Community. Okay, can everyone hear me? Perfect. Thank you so much for being here and for agreeing to participate in this forward-looking session. We have all been very excited to hear about your perspectives on the roadmap, as well as also how you see how we can put One Health into action, as this session focuses on priorities, milestones, and partnerships needed to move forward. And Dr. Shamsuddin, I would like to start with posing one question to you. You lead FAO's Africa Regional Program for Animal Production Systems and One Health. You also represent FAO in the Regional Quadripartite Mechanism, and you bring more than 3 decades of experience from work in over 40 countries. The Quadripartite has truly been a key partner in One Health implementation across the world, and has developed many strong technical tools. At the same time, I think many countries can sometimes find it a bit challenging to navigate a lot of the tools available and decide which one to prioritize. So without going into much details on the different singular tools, it would be very interesting to hear your perspectives on how the Quadripartite can help better align tools, guidelines, and standards across sectors. And also hear if you can share practical examples of how this can lead to results under the roadmap.
Thank you, Dr. Elizabeth. Let me just begin that the quadripartite actions are guided by the One Health Joint Plan of Action. And as you know, it has 6 action tracks. I'm not going to read out, but very simply, the first one is the One Health capacity development and the governance. Second one, we call it the preventing the emerging disease, where the pandemic fund falls very well. Third one is the prevention, especially control of the endemic zoonotic disease. Fourth one is the the food safety. Fifth is an AMR, and the 6th is an environment. The reason I'm saying it that our actions are aligned with these key deliveries. So coming to the first one, we deliver this governance and capacity through our partnership with the AU institution. Good to see we have the Africa CDC here, AU IBAR, the REX, and more specifically, we are so thankful that our service were requested by the SADC to draft the framework of the SADC One Health collaboration, which was the predecessor of this today's roadmap. We are so proud to be part of it. Then how we do it, as you said, we use several tools. And again, I'm not going to bore you with the long list. Some of the very specific tools we use, multi-sectoral collaboration and coordination and management. And currently, Quadripartite, led by FAO, is using that and some other tools to develop a One Health action plan for Malawi. And similar action plan will also be developed for it's other part of Africa, for Nigeria and Ghana. We have been working with Kenya to develop a costed One Health investment plan, and again, similarly, one for Senegal. Quadripartite, we work as a it's a multi-sectoral. Most of our works are on the multi-sectoral. And let's say, before I go on the furthers on the detail, I would like to, I'm also careful about the time, first reflect on how our works are aligned with the pandemic fund and with using the pandemic fund opportunities, what this roadmap of SADC can leverage. And I will have 2 points here. Number one, just to mention the scale, 20 of the Eastern and Southern African countries have pandemic fund projects, either single country or part of the multi-country proposal. So it's a good number, and we spoke about the resource, but it's a good resource to start working with. I avoid naming the countries, but if anyone wants to anyone wants to know if their country is included, I'm happy to answer to a question. So, what is in these projects? I mean, it provides the multi-sectoral One Health approach. Reading quickly, we'll all see that, okay, these are to enhance the capacity for surveillance, laboratory capacity, or workforce development. But differences are in the detail. Let me cite an example. The regional project with the Greater Virunga landscape, it is fully captured on the interface between the wildlife and the community. The regional project that is, we hear that it will be funded through the AUIVR, it affected the fragile and the conflict-affected countries. And as you can see, this project will go to the extra mile to deliver. Now, what is the way forward from the pandemic fund projects? I think as the question was raised, this provides a very good platform for partnership, networking, sharing. Sharing data, you call it very simple, but it needed legislation and policy support. And as we know, the legislation can be made with the existing resources. We spoke about the roadmap M&E. These 20 projects will provide a lot of results. So it's time to just fill in it and really get the lesson learned. My last point will be on the AMR. As you know, the AMR, again, through the Quadripartite, we support, or we are working in partnership with African Union institution and supporting 14 countries. What is the lesson learned there? Is the good practices, and is the community engagement, is the capacity for surveillance, is the tools to be used for laboratory assessment and laboratory capacity development. Thanks to the presentation on the Illumina for sequencing. And this one, let me also do a little bit of, from the FAO. The FAO has this Renu Farm, which is called the Reducing Need for Antibiotic on Farm. It provides a platform. It provides a platform neutral platform for everyone, for the civil society, for the government, for the private sector, for farmers. There we can discuss more and bring investment, more upon the domestic investment. So let me stop there. By concluding that we have now the knowledge on the, we have resource, we have the knowledge, the partnership. So it's now to leverage and really put it in a little scale up, putting more on the investment and using that as a seed and moving to the bigger investment. Thank you so much. Let me pause
Thank
here.
you so much, Dr. Shams, for truly outlining how such a roadmap that we are envisioning, including support by projects such as the ones mentioning, funded by the Pandemic Fund, can provide a great foundation to truly work together and utilize the technical tools that you have within the quadripartite and work truly together in a multisectoral way. Thank you. Our next panelist is Dr. Wande Alimi. You are a strong voice for One Health across the continent through your work with both OLEP and also Africa CDC. Africa CDC has, as the African Union's public health agency, supported member states across the continent to strengthen their capacities, to prevent, detect, and respond to public health threats. And in line with the One Health roadmap, how do you see Africa CDC can support countries in strengthening these capacities, as well as help deepening regional collaboration?
Thank you very much. First of all, allow me to congratulate the SADC region. I think we are saying this, first of all, the SADC is one of the regional economic communities of the African Union. So for us, this is our baby, betting a baby. So congratulations to SADC. This is a phenomenal roadmap which aligns with existing strategies such as the animal health strategy, the African Union strategies on zoonotic diseases, AMR, climate change, and of course the various work that we do. I think your question around how will Africa CDC support this initiative. I think one of the most delightful things that has happened is just being in the audience and just listening, and every now and then representatives of member states will highlight the fantastic work the teams I get to coordinate do. So I think first of all, great work by my team, they're doing phenomenal work, but also it highlights the work we are all doing as partners and the investment we are putting in. So I think first of all, we are already supporting this strategy. Even before it came to light, we already anticipated certain needs, and this is what we as technical agencies have been supporting. So a few things that I would really like to talk about in terms of how can we support better in alignment with the regional roadmap that has been developed as Africa CDC. The model is not going to change, but what we want to do is do things better. And that's the basis of the Pandemic Fund. I think a few colleagues have reached out to me, what projects are you doing under the Pandemic Fund? One of the things that I've said is that we are not doing projects, but rather we are going to work in a way where we can institutionalize One Health as an approach, not like a pilot project, a country-specific project, but something that is embedded in the way we work. I'll start first of all with surveillance. I think a few colleagues have already highlighted some work around surveillance, but I think a few things at the Africa CDC level, and I thank my colleagues from Nanopore and Illumina. One of the things we've started strategizing is how can we scale up genomic sequencing, applicable to not just antimicrobial resistance, but exploring things like wastewater environmental surveillance, which is a critical element I don't think that I've heard very much in these conversations, but there's significant work that is already going, for example, in Zimbabwe, in South Africa, around using wastewater surveillance as a bit of an indicator for certain priority diseases. I think beyond that, a few things that I would very much like to highlight is also around regionalism. Every now and then when I come up, I say a lot of things around regionalism, and this really is what the strategy embodies. At Africa CDC, we've been working very closely with the South African government, particularly NICD. What we have launched is what NICD becoming a center of excellence for AML surveillance. So far, we have facilitated 3 peer-to-peer exchange visits for Zimbabwe, Ethiopia, and South Sudan. I think a lot of times when we say, where do we start from as a continent, we want to borrow from global north where it's not really applicable to our setting. But the NICD team has really helped country in terms of understanding, shaping what national AMR surveillance should look like using a One Health approach. And I think the colleagues from Zimbabwe even took it further to have a twinning EQ exchange to strengthen the labs. And these are the examples of how we can really invest in countries to ensure that they're also supporting the neighboring countries around. I think something that jumped out to me is where do we then amplify wildlife surveillance? We're seeing a lot of zoonotic disease spillover, and we already have fantastic existing tools such as the PREZODE, which my colleagues in FAO have been doing. Similarly, at Africa CDC, we have the event-based surveillance tool, which many countries across this region have deployed. The Lioness are doing fantastic work. How do we make sure that they have the right tools to be able to report into what ZMPHI is doing, for example, whereby we can see the data in real time to make informed decisions. I'll go very quickly to preparedness conversations. And I like one of the speakers that said health security and health preparedness and emergency response are two sides of a coin. You cannot have good health security without proper preparedness. And preparedness is not just about having those national action plans in place. It's also about having the right workforce in place. Do we have the right capacity in the veterinary labs, for example, if we have a new pathogen of unknown origin? Do we have the capacity to understand, to test, to report? Do we have those right capacity in terms of the workforce? But I think beyond that is preparedness and resilience is not just about having operational tools, strategies, financing. There's also the conversations around supply chain. For example, our vaccine banks for zoonotic diseases. Do we have enough in stock? Not just for when, but just in case. And this even looks at things like bacteriology capacity. For example, through the Regional Fleming Fund work that we did, we have only 1.3% of laboratories being able to do bacteriology. How can we have AMR surveillance data? How can we make sense out of the AMR data coming from our countries? So I think in addition to that is also some of the opportunities, and I think this did not come out strongly, is the joint simulation exercises. We keep talking about cross-border surveillance, but it's not just about data. How are we equally prepared together for similar pathogens or similar events that occur within our region? And I think lastly, it's around also regional collaboration and implementation. For us at Africa CDC, I'm sure that you're aware that we have regional coordinating centers, and many of the countries within this region have really engaged both with the Eastern Africa RCC, but also the Southern Africa RCC. But beyond that, there are also regional partners. COHESA is doing fantastic work. PREZODE is doing fantastic work. We work very closely with the QPT. We have colleagues who are implementing across various, how do we work together in a way that we are not duplicating. And I'm really proud of the collaboration between the African Union and the regional QPT. We've slightly changed the model of how things are done. We speak in one voice for one Africa. And we really integrate our tools such that we don't overwhelm our member states with strategies or operational tools. What exists? How can we leverage on what exists to do better? So as Africa CDC, what we're going to do is doing what we already do better, by doing it better. The roadmap has already defined where the needs are, where the priorities should go for this region. So what we will do is continue to work with our member states within this region to address the needs they have clearly articulated through this roadmap. Thank you.
Thank you so much, Dr. Okay, yes, let's give a round of applause. Thank you so much. I think this was a very well-stated point, and I think it was also very timely to emphasize that work is ongoing. We are not starting any new process. We are simply moving towards even more coherent approach to implementation of One Health. I really like your points on certain needs to scale up genomic sequencing in wastewater. And it was also great to hear that there are already excellent examples out there that can really support cross-country learning. Also, the point on improved wildlife surveillance, and also a cheer out to our Team Lioness that participated in the opening of our conference. And also to continue working together, working better, but also utilizing new partnership that we might not have made much use of so far. Thank you so much for these points. And with this, I want to go on to our next panelist, Professor Flora Pulle-Mullenberg, that have an excellent taste in colors. And Professor, you are a very strong champion of the joint call to action and have played a very important role in supporting Botswana in establishing and strengthening its One Health coordination platform. Also, you are serving as a connector between government, academia, and the Regional One Health movement. From your experience, how can academia help advise governments on One Health and support delivery of the roadmap by generating evidence, informing policy, and enabling continuous learning?
Thank you. Thank you for inviting me to this meeting, and thank you for asking me to be a panelist. Good afternoon, colleagues. Distinguished colleagues, I relied on earlier on protocols, and the principal role of any academic institution is first and foremost education and training. So in other words, training future workforce, so in this case, One Health workforce, generation of evidence through research, as well as outreach or knowledge transfer. So luckily, 4 years ago, a new project, we've heard about it before, COHESA. COHESA came about, and the objectives of COHESA were nicely, eloquently given by my colleague Priska yesterday. But luckily, these objectives for COHESA, somehow there's an intersection with the roadmap in terms of building capacity in governments, in terms of improving governance, both nationally and internationally or regionally. And at COHESA, we also, because the COHESA was delivered by academic institutions that are called multipliers, as trainers of future workforce. One Health concepts were embedded in curricula. So at the beginning of COHESA, some studies were undertaken, and most of these were baseline studies to establish the status of One Health in all the 12 countries in Southern and Eastern Africa. 8 of these countries are in SADC. So some of the findings from these studies was, in most of the countries, there was a lack of awareness in terms of the One Health approach. And I must mention here that all these countries were actually starting at different levels. Some were deep dive, where countries already had a One Health platform. And I must say most of the countries did not have a One Health platforms. So in terms of academia, there were hardly any courses that mentioned One Health, which means there was no intentionality, if you like. And most of the countries, like I said, didn't have a One Health platform. And in some countries, you found some kind of One Health that was not necessarily called One Health. For example, in Botswana, they were implementing, or they are implementing, something called the Libreville Declaration for Human and Environmental Health. As you can hear from the name, it mentions human health and environmental health, and it makes no mention of animal health. So the Libreville Declaration is chaired by the Ministry of Health and the Ministry of Environment, which is quite peculiar because most of the time environment was a bit left out. So another thing that most of these countries did was do a mapping of all important stakeholders in their countries. And for example, in Botswana, the Ministry of Health was found to be the most influential, followed by the state president ministry. So the interventions that after doing these studies, for example, a lot of staff from government, from academic institutions were capacitated. For example, there was a course that was organized to train staff from different universities, not only those that were involved in COHESA, but universities across these countries on how to develop, for example, One Health courses. There were also a number of benchmarks, especially at graduate level, postgraduate diplomas, and master's degrees that were developed through COHESA. There was a boot camp that was organized also from different institutions for younger people as training as the future workforce. And lately in September, I'm aware that there was a pedagogy training that was organized for also younger scientists that was organized in Namibia. Coming back to Botswana, we organized a short course. We developed a short course that is going to become a yearly, in the Center for In-Service Education at my institution is going to be a yearly offering. And that obviously is a course that is meant for as a continued professional development course for all One Health practitioners coming from all different sectors. So I am also aware that most of the countries developed many policy briefs, obviously trying to influence their governments, where, for example, there's no One Health platform, to establish One Health platforms through at different, at higher level. For example, in Botswana case, we showed that the most influential was Ministry of Health. But is Ministry of Health the right place where this platform should be established? So, for example, there was a meeting with permanent secretaries where all these results were given from all the studies, and also interacting with government to reason why Ministry of Health would probably not be the right place for the One Health platform, even though the results showed that it was the most influential, because the mapping was done as is, not necessarily that it was the right place to be. So, in all of these countries also, there were flagship programs. For example, in Zimbabwe, Botswana, and Zambia, there was a program on rangeland restoration. This is where colleagues went out into the field and interacted with communities to try and restore the rangelands. And this was also done as one of the celebrations. Next year, 2026, is the International Year for Rangeland Restoration and Pastoralists. So that project will be used to celebrate rangeland. In our case in Botswana, we decided to address the issue of beef measles, which is an economic problem as well as a One Health problem. So there, we are trying to co-design and co-develop solutions for open defecation, which is the problem that leads, of course, to beef measles. And we are working with communities in one district. And I'm aware of another program in Mozambique where they are addressing the problem of rabies. And there are many others in different countries. So I think the roadmap, as it is going to build onto these. There's already, we will not be starting from ground zero. We've already advanced in one way or the other. So I think I'll stop here for now. Thank you.
Thank you. Thank you so much. I think this really showed how research can support in developing country analysis and also to inform a little bit the country status and provide great advice on governance structures, on where to start on regulatory and policy frameworks, but also to truly go out into more specific areas that needs support in disease prevention and control. Thank you so much, Flor, for this, from this insight. Our last panelist is Mr. Balikova. You have been leading regional coordination in animal health, transboundary treat disease control, and harmonized policies and standards within the EAC. You have also been a key voice in advancing the EAC Regional One Health strategy, which covers 9 member countries, whereas a few member states are also part of SADC. Given your experience within EAC, I have a 2-part question for you. The first one is what regional enablers needs to be in place to help strengthen implementation of the SADC roadmap? If you have any advice from the EAC region you can provide. And then secondly, how closer regional collaboration can advance regional integration and the broader Africa One Health agenda.
Thank you very much. Thank you. Thank you very much. Huh? Thank you very much, Anne. Let me start by thanking the World Bank and GIZ for supporting my participation in this conference. It's both good for me and for SADC because I'm here to share lessons. Since 2017, the East African community has been implementing a project supported by the German government through GIZ, which is support to pandemic preparedness using a One Health approach. So we've implemented many initiatives that have taught us how challenging it is to institutionalize One Health at regional level. And we want to share some of those lessons with SADC. In summary, there are certain challenges which you encounter when you want to bring stakeholders together under a One Health approach. The first thing is having an effective regional coordination mechanism. We have seen different countries trying different models of bringing stakeholders together, national level coordination, but even at regional level, we have faced our own challenges to institutionalize One Health. The second key factor is having a sustainable financing mechanism. Different sectors are funded separately at national level. Even at regional level, different sectors fall under different departments and they plan activities and allocated resources separately. So when it comes to collaborating under One Health, funding becomes a problem. The other issue is attitude of some stakeholders in One Health. some professions. Some individuals do not believe in collaboration. They believe in working and achieving their goals through their own lines. But in terms of enablers, the first step is securing political support. Every season, let's say 5 years, there is change in political leadership in most of the countries, whether it's EAC or SADC. And when there is a change in political leadership, new ministers are appointed. Some ministers have no idea what One Health is. And sometimes even in new accounting officers, in East Africa we call them permanent secretaries, principal secretaries, even director generals and under secretary. They are the ones who are the accounting officers for specific ministries. Some of them do not understand what One Health is. I know one ministry where the accounting officer is a major general straight from the army. So we have a duty to continue sensitizing and creating awareness among the political leaders about One Health, explaining to the political leaders what One Health is and how beneficial it is for national health security and even global health security. Even the accounting officers need to be continuously sensitized, especially if they are new in that role. We can achieve this if we prepare a well-written policy brief that can be understood by anybody about the concept of One Health and how we apply it to prevention, preparedness, and response to public health threats. The other issue, when it comes to coordination, every country has a different institutional arrangement and governance structure for different sectors. Even the naming of ministries and combining of different sectors to form ministries varies from country to country. There is no harmonized governance structure for ministries in the regional economic communities like SADC and EAC. So if you want ministries to cooperate, the coordination becomes a challenge. So it's important that we write some guidelines and standard operating procedures on how coordination can be achieved at national level, at subnational level, and even regional level. I'll tell you the challenge we face. In the East African community, political decisions are made by the meeting of ministers of a specific sector. We call it sectoral council. So when the ministers meet, they make all political decisions that the countries must implement. But the sector for health has its own sectoral council. Agriculture has its own sectoral council, which is for crop and livestock. Fisheries has its own council. Environment and natural resources has its own sectoral council. So it was the health sector, the health sectoral council, which decided that we needed to embrace the One Health approach and promote it within EAC. But whenever they meet, even us who are technical people associated with One Health, we don't attend meetings of the health sector sectoral council. Agriculture sectoral council meets separately. So if the sectoral councils cannot meet, here you call them committee of ministers. How can they harmonize the policies? So maybe it's us, the technocrats at regional level, who must write regional harmonized instruments, technical tools, whether it's policies, guidelines, procedures, standards. We need to write harmonized instruments which countries can use to use the same approaches to disease control. In terms of financing, at regional level, I've mentioned the challenge because every department budgets separately. It's the same at national level. So if we do not have a way to pool resources for One Health activities, it will be a challenge. At the moment, we have depended a lot on donor-funded projects and programs, but we needed to institutionalize budgeting for One Health activities at national level. Capacity building. The younger professionals need to know what One Health is, not as a discipline, but as a scientific approach to addressing public health threat. They need to leave the universities, the schools, when they know what One Health is, because us who are seniors, who have been promoting One Health, are going to retire, and if there is no institutional memory, then advancing One Health objectives will not progress. Lastly, we need to promote research and evidence generation in the area of One Health, so that we can make informed policy decisions and even identify best practices and promote them. Thank you very much.
Thank you so much. Thank you so much, Dr. Balikova, to fully emphasize the three needs, the importance of having a good regional coordination mechanism that both takes into consideration subnational, national, and regional governance for governance structures. Also to raise the importance of sustainable financing, which can come in different forms, truly through like donor support in some way. We have heard also from the different networks that are here, the Pandemic Fund, World Bank projects, you know, there is many different funding sources out there that can get you started, but it needs to be planned in a way so that you find a sustainable financing structures after the initial support ends. And then lastly, the importance of champions, and to also make sure that these champions are continued despite government change, despite reaching the retirement age, to really make sure that it's a sustainable workforce that's available. So we only have 3 minutes left of this session, so I'm just turning towards our team if I have time to just ask national champions in the room for a few perspectives. Okay, we have time. Perfect, thank you. So we just had a range of champions for One Health on stage just before. We also know that these were similar to, they were the ones that were also championing the joint call to action. So I think it would be interesting to just hear a few points from the One Health coordinators in the room on their perspectives on the roadmap, but also hear a little bit about, like, from their national perspective, is there anything that they can also bring to the table in terms of realizing the this roadmap? Because we are talking about regional collaboration, and there's so much knowledge that's also like given within the that sits within the different countries. And I know we already heard about it a little bit, but it would be interesting to also hear that being repeated shortly. So I don't know who would possibly like to start. We have Wayne over here. That's perfect. Thank you.
Thank you very much. As we heard, South Africa supports laboratory capacity development in the region. And I think with further engagement, we can continue the support. Thank you.
Wonderful. Thank you so much. And anything you want to specifically emphasize that South Africa could possibly work with?
Yeah, as we've heard as well, that South Africa works together with other agencies in the region and in the continent. Yeah. And especially through the Africa CDC, we support through the National Institute of Communicable Diseases, the NICD, support with diagnostic capacity, as well as outbreak response and capacity development in these areas. So definitely we can continue that. Thanks.
Wonderful. Thank you so much. Okay, anyone else? Yeah, it's very hard for me to see. We have perhaps Zimbabwe, Namibia. See anything? Do you want to say something? Oh, yeah.
Can I go ahead?
Absolutely.
Okay. Thank you so much, Anna Elizabeth, for that. I think going forward, it's also important that we have a community of practice. I think that has been mentioned already. It is also important that our countries realize the need for data sharing. I know that I don't think we have a policy on data sharing, because if we can share the data on whatever issues that we are realizing in the different countries, then we are in a position to better to better tackle whatever issues that are coming to us, realizing that whatever issues that we face know no boundaries. I mostly speak on antimicrobial resistance, whereby you're talking about microbes. They know no boundaries. They are moving right from Zimbabwe, South Africa, going across. So if we can have policies that allow for data sharing and be able to come up on the table as different countries, then we'll be able to, we'll be in a position to better tackle the issues that we face. Thank you.
Thank you so much for these perspectives. Then I see we have, I think first over here, Iyelu.
How do you see? I don't know.
Okay.
Are you?
Yeah, yes. Namibia is in full support of the roadmap. What we are asking is just an alignment with other One Health continental and global frameworks. Like we have been having the Africa CDC continental framework on One Health. So we would want to see the roadmap being aligned with it, and also with other, like our joint action plan on One Health. And we'll continue supporting all the efforts that are being, and also a link with our work that we are doing in our respective countries. We are also calling for more collaboration, more to south collaboration, and also cross-fertilization of ideas and technologies, because we are at different maturity levels when it comes to One Health. So we would want to see more country-to-country collaboration and technical assistance across between other countries. Thank you.
Thank you so much. And then, yeah. Let's hear from also from AUI VAR.
Yeah, thank you so much. Yeah, I don't know if member states are done with their inputs, which should have been good. Should I let them do it and I come last?
Okay, yeah, let's do that. And then Raymond, please come in.
Thank you. Thank you very much. I think I'm in alignment with other member states, and I think I just want to build up from where my colleague Dr. Yalo spoke on. So for us as well, it's a matter of this being an initiative that builds upon already existing initiatives. But one thing that we've been doing when we've, I think with the support of our big brothers, Africa CDC and the Quadripartite, has been when we have these documents, we domesticate them to the country level for a number of activities, whether it be antimicrobial resistance, EBS. One thing that I feel this roadmap for SADC does is to domesticate these continental frameworks for the region, because I think every region is quite unique in the way we are. I look at my brothers and sisters around Zimbabwe, Namibia, Botswana, that ecosystem that we share is quite one of the unique ecosystems in the world. That requires us to have a specific policy around how we govern ourselves regarding trans-animal boundary diseases and so on and so forth. So I think, yes, this is a welcome initiative. There's still need maybe for us to relook at the nitty-gritty details of it, but importantly, let it build upon the existing initiatives. Thank you.
Thank you so much, Raymond. Okay. Any last points, interventions, before we give the word to Mary from... Okay, yeah. Oh. Thank you so much.
Okay, thank you so much. I think this is really great, and we want to commend SADC region really for coming up with a roadmap that's going to bring in, change in the right direction. Really for AU-IBA is just to reiterate the need to leverage on what is already existing and to be very inclusive. When we talk about One Health, the animal aspect really needs to be very well articulated into all these discussions. What has just been raised in terms of data, there are already existing continental frameworks. For example, the African Union Data Policy Framework, which has already been endorsed by heads of state, and really it is up to us to leverage on that and not reinvent, but rather see what is the continent saying already, and then we speak to that and move the regional agenda forward. And this should speak to, I think, basically everything that is going to be done in the roadmap for SADC region so that it can be strengthened. So for AU-IBA, we look forward to supporting you as you implement this, and you can count on our commitment. Thank you so much.
Thank you. Thank you so much. Great perspectives from coordinators in different countries, and also truly a call for action in terms of establish a community of practice built on existing initiatives. Treat this One Health, even if this is a regional roadmap for SADC, treat it also as if it was more continental by looking at what has already been endorsed at the AU level. And then, truly establish this platform collaboration, because there's so much great work going on. And I think we want to end this session by actually bringing it back to our panelists for a very, very quick final remark from your side, just emphasizing one key message.
No, thank you. Thank you, Elizabeth. Let me have two parts of my one key message.
Okay.
And
we're 7 minutes over.
From
so
the Quadripartite, and I'm speaking also from my own organization, FAO, we will continue this partnership networking, working together, providing this neutral platform so that all stakeholders, including multilateral development banks, member countries, civil society, private sector, they all can come and converse and continue this dialogue and also the advocacy for One Health investment. The second part is that I mentioned it, I just want to elaborate that let's take this resource of pandemic fund and other One Health project, including AMR, as really as a seed. And based on that, we'll continue our support to develop the knowledge product, the investment plan. Because we have the knowledge, we have technical people, and we are engaged both with the country and the regional entity for to provide the data, to provide the policy. Just I want to end by saying that the data, we spoke about policy, we spoke about legislation, but they also need to be interoperable. Nowadays, data means it's always digital. And we provide tools like, again, tools like even mobile application or global animal disease information system, which are we're working with, for example, AU-IBA to have an interoperability with their animal health information system. So these are the work we'll continue. Thank you, and again, thank you for having me here. Thank you.
Thank you so much.
Thank you very much for such great inspiration today. I think my closing is more of a call to action. As you all are aware, for the first time on the African continent next year, we will be hosting the Global Ministerial Meeting on AMR. Your Excellencies, now is a time more than ever for us to speak as a continent. So my sort of key takeaway, not just to our Excellencies and peers and distinguished colleagues in the room, but also to the One Health champions, to the SADC Secretariat. We have to make sure that all roads lead to Abuja 2026 next year, June specifically. We are there in the room. Our voices are heard. We articulate the needs of our member states. We prioritize those commitments that are really going to set Africa aside and ensure that we can save the 1.3 billion Africans from the risk of AMR. Thank you.
Thank you. Strong message.
Thank you. I think we have good partnerships in terms of the networks that we've built, the different networks, and I think we need to leverage on those to take the continent forward. But in terms of what it is that I'm committing to, I commit to continue raising awareness and interacting with government, but also our strength as academia is generation of evidence as well as training future workforce. So we'll continue to do those things. And I thank you for inviting me. I thank the World Bank for bringing me to Lusaka. Thank you.
Thank you.
Thank you very much. The public health threats that we face and that we want to address through collaboration under the One Health approach are transboundary in nature. So, as we strengthen cross-border coordination and collaboration, we need also to think of strengthening collaboration between regional economic communities. When I was coming to this conference, I thought I was going to meet all the Eastern Africa countries in this conference, but I'm surprised it's only 16 SADC members. So we should have said this, the Southern Africa One Health Conference. So going forward, I want to suggest that as SADC implements the roadmap, let's think of strengthening collaboration across regional economic communities. EAC, IGAD, and COHESA are willing to collaborate with the SADC. As you implement this roadmap, we want to learn from you and also to copy some of what you do. Some countries at the border between SADC and the EAC, like the United Republic of Tanzania, the Democratic Republic of Congo. One time I facilitated the signing of an MOU between Kenya and Tanzania on cross-border collaboration, the prevention and control of transboundary animal diseases, and another between Tanzania and Uganda. So Kenya and Uganda are in IGAD and EAC, and Tanzania is in SADC. So those border MOUs will extend the collaboration between RECs indirectly without even any effort by the SADC Secretariat. Thank you very much.
Thank you so much to our panelists. This has been excellent. Thank you so much for all the nice interventions that came from the room. It's been a pleasure moderating this session, and I really truly hope that we all feel super inspired moving forward on One Health implementation, and also to join the call to action. And I think the next step is truly to set up this community of practice of learning to move forward on One Health implementation. Thank you.
Thank you so much to all the panelists, really providing amazing insight into the feedback and the comments that they've shared with us, and of course the interaction. And perhaps, as Dr. Shamsuddin wrapped it up with, challenging us to make sure that this doesn't operate in isolation. The truth is we might be gathered as Eastern and Southern African nations, dominated by SADC, but we're not operating alone. There's strong representation that we have from organizations and leaders from the East, of course, the West, so we should not exclude the likes of ECOWAS and our colleagues and counterparts in West Africa, East Africa as a whole, and really ensuring that there's ongoing partnership and camaraderie that we have right across the continent, from Cape to Cairo. On that note, it does help us propel the conversation even further to ensure that we've heard quite a bit, right? We've absorbed quite a bit of information, and there's been lots of beautiful interlinkages between the various panel discussions that we've had. Many of you sitting on panels yourselves and sharing your feedback, your commentary, your opening remarks, and even the questions that you've been able to address in interacting with us as counterparts here on stage. And perhaps this gives me an opportune time to also ensure that we fundamentally take these conversations going forward in the operations that we look to implement in the weeks ahead. As you can tell, the technical team behind me is getting ready to make sure that we prepare for the last two sessions that we're going to enjoy, which will provide us with a quick overview of what it is that we've heard over the last 2 days. The key insights, the concepts, the challenging questions we've had to respond to, and even the opportunities that have been made present. We'll also have an opportunity to fully understand and craft new opportunities for innovators who have been participating in the marketplace to continue to engage with us and build up on the ideas that they've been able to share with us. So these are just a few of the themes and concepts that we are going to implement over the next 2 sessions that will take place. One, we will get an overview of the 2 sessions or 2 days that we've had, and of course one that will mark the official closing ceremony that we have for the regional conference. I do want us to take an opportunity as well just to remind you that there are some refreshments available outside. So if you need some coffee just for the last stretch, please do feel free to make your way outside and come back in. We will be able to get your refreshments back, and you can enjoy them here whilst we are in the room, and of course making sure that you interact with your peers. As you do that, do make sure that you come back promptly, because we do want to get you back into the room and of course to hear the key insights that will be shared by the various speakers. On that note, I trust that we're ready and of course can go ahead. In just a moment we will do that. But you might recall that yesterday I took an opportunity to double check and litmus test how the audience was feeling, and I dominated this particular area of the room. A few of you who might have responded to the questions I asked might have stepped out, but for the moment, I'm going to try the center of the room and of course the part towards my left-hand side. I'm going to choose a roving mic on a random table and maybe ask one of my colleagues who's come through from Mozambique if you can stand up, ma'am, share your thoughts with us. Just 1 sentence or 2 sentences, just highlighting your reflections of your attendance at the conference so far. We have a few cameras in the room, so to make it easy for my colleagues in the technical department, you will focus on her so that we hear her feedback as you tell us who you are as well as your comments and your feedback. Is it on? You know what happens when I find a mic that's on? Here's one that's on. Fantastic. Let's try that. Thank you.
My name is Sadia. I'm from Mozambique, National Institute of Health, I'm so glad to be here today and see most of the familiar faces that we've been working together for so long, trying to implement the One Health. And to be here today, all of us, it means that we already have succeeded. So thank you very much. Keep going. I'm impressed with all the innovators that were here, and I have the feeling that we will be here together very soon and sharing more success. Thank you.
Muito obrigada. A round of applause for you, please. I continue picking on random people just to hear your thoughts, and your eyes made contact with mine. So if I could please ask you to stand up, ma'am. Share your thoughts, comments, and feedback. Maybe tell us where you're from and just some of the insights that you might have heard that really intrigued you as well. Hi. The cameras will find you, but yes, you're staring in the right direction.
There's 2 of them. Hi, I'm Kayla Kaufman. I'm from Stanford University. I'm working on schistosomiasis there, and I'm one of the innovators here. And I just have to say, I'm so impressed by all of the collaboration and the partnerships going on. Like, I think that I was not adequately educated and aware of this, and it's really amazing and inspiring to see all the amazing work that
Dr. Kaufman
want to do coming together.
Yeah, and you've been part of the innovators marketplace, and you shared some of your insight with us. I'm quite keen to understand from you, given that you come from the US, a developed economy that often leads the charge in terms of innovation, what's your view on the innovation that you see on the African continent that you'll likely take back home and share in Stanford University?
Really just working from the bottom up and listening to what the communities need and how we can provide tools for them and give the education and like use our tools, like our data tools and our skills to help make informed decisions in Africa that really impacts the communities here.
Thank you so much. Dr. Kaufman, a round of applause for her, please. Safe travels back to the West Coast. It's going to be a very long flight for you, I can imagine, with multiple connections. But if you can, enjoy Zambia for a little longer, in case there might be a safari that you can enjoy. Sir, I'd like to stop you. Dr. Carlos? In your tracks, you were not, yes, from Mozambique, so good to hear your thoughts as well. Maybe your feedback as well.
I think that more than future, One Health is acting now. It's making things happen now so that we can have something to tell in the future and we live a sustainable generation in Africa. And this is key. Thank you.
Thank you so much. Tudo bem. Muito obrigada. Giving us feedback there. Thank you so much to all the audience participants for giving us your feedback. If I've missed anyone, trust me, we're more than happy to come back and solicit your commentary. And most importantly, this underscores some of the themes that we need to be mindful of. As I've been hearing the reflections of many of our speakers and the panelists, as you can imagine, this is where we try to ensure that we highlight so much of the themes and conversations that we've heard. And typically we wrap it up with a comment or a quote regarding the African continent and sustainability and how we move forward. But as it rests on my mind and as we prepare to hear the closing themes from many of the representatives of the World Bank, but also those who have played a critical role in making sure that we get here to Lusaka, Zambia, whilst we'll have pictures, commitments, signatures on boards, and of course even social media posts to share with future generations to remind them that we were here during the Regional One Health Summit for Eastern and Southern Africa in December of 2025. In the back of our minds, we need to make sure that we're prepared for the next question that the future generation will ask us. Yes, you were here, but what did you do about it? And that's a theme that we all need to be cognizant of as we prepare for the road ahead. To help us share a reminder as to what we've covered over the last 2 days and reflections of key conversations, and then we'll build up on that to make sure that we actively draw a conclusion to the conference by highlighting the partnerships we need to embark on going forward. I'd like to welcome to the front of the stage to share the conference outcomes with us. Joining us as senior economist at the World Bank Group, Chisawe Ho, also commonly and in a very friendly manner referred to as Chow. She'll give us the closing remarks and feedback on the conference outcomes. From there, we'll hear the closing session and remarks that will also be addressed by the World Bank Group. A warm welcome, please, to Tsiao, who will be joining us on stage. Thank you.
Hello, everyone. Hi. Thank you, Gugu. I will try my best to summarize the past few days and capture the energy and ideas from these conversations. Now, we've heard from ministers, government officials, private sector leaders, and academics, experts across health, agriculture, and environment, and innovators, all bring their expertise to the table. We've also discussed practical solutions, concrete commitments to strengthen health systems, and advancing One Health approaches across the region. But before we dive into the details of each session, let me give you a quick snapshot of what we've accomplished over the past 2 days. From our expert speakers to our brilliant innovators and media colleagues reporting on these discussions, we've had over 80 speakers and innovators share their insights and new solutions. To an engaged audience of 500 participants, both online and offline, 16 journalists joined the conference that helped amplify our discussions. And here, you can see just some of the media coverage of our discussions, making sure that your statements and commitments are traveling far beyond these conference walls. On day one, we set out a joint call to action for Africa's One Health future. Over this conference, we've seen that call come to life through collaboration, innovation, and shared commitment across governments, the private sector, academia, and communities. Now it's on us to turn that commitment into action, strengthening regional systems, protecting health, and building a safer, more resilient future together. With 138 signatories already, and growing, your endorsement and outreach will help carry this momentum into the next phase of action. So please do add your name and share the call of action across your networks. The high-level ministerial panel showed how countries are turning One Health from a concept into action. As you can see from the quotes on the screen, ministers, permanent secretaries highlighted the need to integrate human, animal, environment, and agriculture sectors into coherent national systems. We also heard from how climate change is now a core health and food security challenge, and how regional cooperation and cross-border data sharing are essential because, as Dr. Lashipi reminded us, a disease in one country quickly affects its neighbors. The Healthy Jobs, Healthy People panel highlighted how One Health is building the next generation. We heard from Team Lioness on the front lines how detection and prevention of disease while expanding the workforce address both rising zoonotic risks and food security needs. Our speakers also highlighted how scaling One Health careers can create opportunities for millions of young people across Africa. And strong policies, education, and enabling environments are key to sustaining this next generation of One Health professionals. The Feed to Food session showed how circular economy help address food insecurity and environmental threats. We highlighted how insect farming is practical, scalable solution that turns organic waste into protein and fertilizer, reduces emissions and feed costs, and strengthens food security. Evidence from Africa, Europe, Asia demonstrates strong scalability, regulatory readiness, cultural acceptance, and proven market demand for insect-based systems. The decentralized bioconservation models create local jobs, improve human and animal nutrition, reduce reliance on imported inputs, and advance the One Health approach. On the Economic Resilience and Regional Trade panel, we heard a clear consensus that harmonized standards, stronger surveillance, and coordinated control measures are essential to protect livestock systems and keep markets open. Participants stressed the need that better cross-border cooperation, from information sharing to lab networks, will accelerate safe, predictable trade across the region. Speakers emphasized that aligning with Codex, WOA, and WTO SPS standards, and tapping into available support mechanisms such as STDF funding and WTO SPS processes will help countries expand market access and strengthen resilience. Now, this morning, during the Health Resilience Investment Panel, it reinforced the shift towards treating One Health resilience as an investable priority, embedded in national financing rather than managed as a response cost. Speakers highlighted how country-led catalytic financing is already strengthening systems and accelerating preparedness in practice. The discussion concluded with a clear call for One Health integration and regional coordination as the most efficient path to scale and impact. In the private sector roundtable, our speakers demonstrated how much of the private sector can contribute with clear frameworks and trust are in place. They highlighted the importance of enabling African countries to their own genomics capacity, protect data, and collaborate effectively. With strong governance, global standards, and regional coordination, we can track risks, respond faster, and strengthen preparedness across human, animal, and environmental health. In the Knowledge to Impact session, speakers discussed what it will take to move from evidence to action in One Health. citing powerful real-world examples that are driving progress and what we can do to scale them up. Our panelists explained what is needed for effective One Health solutions, ensuring that data has value to trigger policy action, meaningfully engaging with communities to ensure they are co-creators of One Health, not beneficiaries, and the key role that's played by our political champions who drive these conversations forward into decision-making spaces. Speakers also called for efforts to overcome barriers to One Health solutions, a lack of coordination, siloed systems, and disconnect with local communities. In the Bridging Sectors panel, we heard from countries across the region on how they are advancing and formalizing One Health governance by embedding coordination at the highest levels, working across ministries and sectors. While gaps and barriers remain, these are strong momentum to address these, while we continue to share best practices and strengthen regional collaboration. Now, in our final discussion of the conference, we looked at the way ahead and explored the key policies, priorities outlined in the SADC regional roadmap. From shifting the focus away from response to risk reduction and prevention to how we can support smarter investments guided by country deep dives and tailored investment cases. The roadmap itself is intended to serve as a unifying mechanism for member states and to institutionalize One Health and translate it to practical, multi-sectoral action. As we've discussed, it builds on existing regional strategies and activities while embedding new complementary initiatives and sets out how SADC will coordinate, harmonize efforts through shared systems, platforms, and partnerships. And at its heart, the roadmap will support us to translate policy commitments into effective action. Now, in closing, I hope we've captured the essence of the discussions, the innovations, and the energy that's been generated over the course of the conference. Stay engaged, sign the joint call to action, and keep the conversation going on our LinkedIn page. Thank you.
Thank you so much, Tal. Really appreciate it. Giving us clear feedback on the outcomes that we've attained and the conversations that we've had so far. It is imperative, however, that as we reflect on much of these themes, that we do lead to the official closing of the program with understanding that there's been key levels of partnership that have been unlocked to ensure that not only have we gathered here, but we've also crafted the way forward. To help lead the formal closing session, giving us perspective from two key stakeholder groups that played a critical role in ensuring that this could happen. Please warmly welcome to the front of the stage, Senior Economist at the World Group, Ms. Dipti Thapa. She'll be followed and joined back on stage by a very familiar face who's been instrumental to making sure that we have these conversations and themes. He'll be joining us, Professor Roma Chilengi, Director General for the Zambia National Public Health Institute. Please give them both a warm round of applause.
Thank you, Gugu. Excellencies, distinguished delegates, colleagues, and friends, I promise I'll be brief. You've heard a lot from us today. It's been a full 2 days, and honestly, it feels like endless months of behind-the-scenes prep from us. Over this time, we've learned from each other, we've challenged our assumptions, we've shared ideas, and we have heard the outcomes of the 2 days, thanks to Xiao. We have collectively come together to sign a joint call to action. We've been inspired by innovators, by youth leaders, by the incredible women and men in this room and on the front lines. We have heard the lionesses roar. As we've come together from such a diverse group of stakeholders and sectors, something only a One Health conference could really boast about. One thing feels very clear to me. We are all deeply connected, including across Eastern and Southern Africa. Ecologically, economically, socially, we share ecosystems, we share trade routes, pastoralist landscapes, wildlife movements, and vibrant human mobility across borders. And because we are so connected, we also share risks. from zoonotic diseases and AMR to food safety challenges and climate-driven outbreaks. Another thing that is clear to me, though, is that shared risks means shared opportunities to act together, to build resilience together, and to really to grow together. Now, one message has come up over and over again during the conference. No country, no sector, and no institution can do this alone. These challenges are complex, and they are transboundary. The solutions also need to be regional, and they have to be grounded in One Health approaches. This region is really fortunate to have such strong champions and institutions, many of whom are in this room with us today, already doing this work. Your role will only become more important as countries move from dialogue to action, and as community and national efforts are reinforced through regional collaboration. We hope we all leave Lusaka not just energized, but really with a concrete idea of how to take this conversation and this movement forward. Now, my personal takeaway from this conference really has been that there has been a real shift in the way in which we are talking about One Health. Yes, it is about prevention, it's about avoiding crises. But what came through really strongly, for the first time, I think, at least in my engagement in this community, is that One Health is a driver of stability and for long-term growth. This is truly about protecting livelihoods, strengthening food and nutrition security, and regional value chains, creating the stability that we need, really, for investment, trade, tourism, agriculture, and livestock systems. I don't think I've ever been to a gathering where this storyline has come out as clear and as strong, that One Health as a development and economic imperative. Strong One Health systems are the foundation to advancing our shared development goals. From the World Bank Group side, I just want to say thank you. Thank you to you all. Thank you for letting us be a part of your journey. What we've seen here is real regional and national leadership on your part. And as we close, let me end on this note. This joint call to action that we have all signed is not the end of the conference, it's the beginning. It's a starting point for continued engagement and collaboration, accountability, and action. The challenge now is to carry this joint call to action beyond Lusaka, out into regional and global platforms, and really to let the region lead the movement, to show what coordinated, multi-sectoral One Health action looks like in practice. And the SADC roadmap is a big step in that direction, so congratulations on that. Thank you again for your energy, your leadership, and your commitment. A big thank you to everyone who made this possible. The Government of Zambia, SADC, the World Bank team, you all know who you are, to Global Health Strategies, to CUBE, to our panelists, our innovators, all of you in this room, and to Gugu, who is now a convert and an expert on One Health as well. And with that, it's my great pleasure to invite Professor Roma Chilengi, Director General of the Zambia National Public Health Institute, to formally close the conference. Prof, it's yours.
Wow, what a conference it's been. Your Excellencies, representatives of governments, regional economic communities, distinguished partners from the Quadripartite, colleagues, youth delegates, ladies and gentlemen. It is an honor on behalf of the Government of the Republic of Zambia to formally close this important Regional One Health Conference. Over these 2 days, we have convened around a shared conviction that the health of our people, our animals, and our environment is inseparable, and that addressing any one component in isolation weakens the resilience of all. Our engagements have been intellectually rich and deeply practical, reflecting the lived realities of zoonotic outbreaks, antimicrobial resistance, food safety challenges, ecosystem pressures, and climate-driven health threats across our region. Distinguished delegates, as we reflect on the substance of this conference, several tangible outcomes have clearly emerged. We have collectively reaffirmed the urgency of integrated surveillance and early warning systems that enable rapid detection of zoonotic, vector-borne, food safety, climate-related signals. This includes a strong emphasis on strengthening cross-border information exchange, establishing harmonized regional platforms capable of detecting and responding to threats in a consistent and timely manner. We have agreed that functional coordination mechanisms anchored in National One Health platforms, interministerial structures, and regional technical networks are fundamental to embedding One Health into existing governance, planning, and operational systems. Delegates highlighted the cross-cutting agencies of antimicrobial resistance as a mounting public health, agricultural, and environmental challenge that requires robust stewardship, responsible use of antimicrobials, and integrated surveillance spanning multiple sectors. In addition, our discussions reaffirmed that climate vulnerability and variability and environmental degradation are reshaping disease patterns in ways that must be integrated into preparedness, planning, risk analysis, and resource allocation. Taken together, these outcomes represent a coherent regional recognition that One Health must now evolve from a guiding principle into a fully institutionalized practice. Ladies and gentlemen, and distinguished delegates, a central feature of this conference has been the innovation marketplace, which brought together some of the region's and world's most promising innovations in public health, agriculture, biotechnology, data systems, and environmental stewardship. The marketplace has showcased practical tools and solutions from digital surveillance platforms and cold chain innovations to sustainable feed technologies, community-led conservation models, and next-generation diagnostics that demonstrate what is already possible when creativity, science, and investment converge. These innovations remind us that operationalizing One Health will depend not only on policy frameworks, but also on our ability to adopt, support, and scale the ingenuity emerging from our researchers, entrepreneurs, youth, private sector actors. The energy, experimentation, and forward-thinking ideas we witnessed in the marketplace reinforce the message that Africa has both the talent and the commitment to drive a new era of integrated health security. Distinguished colleagues, as we look ahead, it is equally important that the commitments made here take the form of deliberate and coordinated action. We are resolved to work towards harmonized multi-sectoral frameworks that consolidate surveillance, reinforce cross-border collaboration, and strengthen joint emergency response capabilities across SADC member states. We have committed to accelerating efforts to mobilize predictable and sustainable financing for One Health systems. Recognizing that long-term resilience cannot depend on episodic funding cycles, but must be supported by integrated domestic and external investment. We have also embraced the need to ensure that One Health extends beyond policy platforms and specialist communities and becomes a lived reality for ordinary citizens whose daily practices, whether in the livestock keeping, farming, environmental management, food handling, or household sanitation, directly influence health security. This requires expanded public education, local relevant communication, and meaningful engagement with communities, youth, farmers, teachers, traditional leaders, and many more. Finally, our commitment to expanding innovation, research, translation, and cross-sectoral partnerships reflects our recognition that One Health solutions must be rooted in science, enabled by data, and delivered through the collective capability of governments, civil society, academia, private sector, and regional institutions. Honorable Ministers, allow me to take this moment to express, on behalf of the Government of the Republic of Zambia, our deep appreciation of all government counterparts present, Your Excellencies, ministers, and senior officials, for your leadership and for the clarity of your national perspectives. I acknowledge with equal gratitude our partners from Quadripartite Alliance, regional bodies, development organizations, civil society networks, private sector leaders, academic institutions, and remarkable youth delegates whose contributions grounded our discussions in both precision and lived experience. Your collaboration commitments have enriched this conference and strengthened our collective resolve. Distinguished delegates, as we conclude, let us take forward the energy, cohesion, and strategic clarity that have defined this meeting. Let us ensure that outcomes articulated here translate into strengthened national systems, well-coordinated regional efforts, and community-level action that protects and promotes health. This conference marks an important milestone in the region's One Health journey, one that must now be lived by implementation, marked by accountability, agency, and shared purpose. Together, we can build a safer, more resilient, and healthier future for the people, animals, and ecosystems of the Eastern and Southern Africa region. Wishing you all the very best in your endeavors as you go back to your places. Thank you for coming all the way to Lusaka, Zambia.
Thank you, Prof. Ladies and gentlemen, it has all been said. Mine is just to say, Tangi unene, asante sana, rialeboch, siabong. Merci beaucoup. Muito obrigada. Zikomo. We wish you safe travels, great success, and of course, nothing but the best in future. Thank you so much, ladies and gentlemen. This concludes the One Health Regional Eastern and Southern Africa Conference for 2025. Please join us for networking and safe travels again.